Good afternoon. Our first item of business is time for reflection. And our time for reflection leader today is Ronit Quayle, Celebrant, Humanist Society, Scotland.
Presiding Officer, thank you for inviting me to address Parliament. As a celebrant with the charity Humanist Society Scotland, my job is to tell stories. Everyday stories of everyday folk. I celebrate the banalities and mundanities of people and their lives. It is those seemingly unimportant things which make up a life, and they are always worth celebrating. When I tell love stories at weddings, it's rarely the big romantic gestures that my couples tell me about. It's the wee things. It's hanging up the laundry because they left it in the machine, again. It's the jammies left on the radiator for somebody coming home from a night shift. It's going to the supermarket a bit further away because it sells their favourite biscuits. Love is a verb because it's a doing word. Can you tell that I have a primary school-age child? I am privileged to see and to celebrate the myriad ways that love is shown. I told a man's story at his funeral recently. I said something which might sound like nothing at all, but which is, I think, everything. I said he was a good man, and he was. His name will not be recorded in the history books. He didn't change the world, but he changed the world of those who loved him. That is something all of us have the power to do, the power and perhaps the responsibility. The world is a scary place. It feels like it's getting scarier. It's easy to feel helpless and to feel powerless. To think, how can I possibly make the world a better place? The problems we face feel too big, too complicated, too deeply entrenched. Is there even any point in trying? It's easy to think that our actions are superfluous, but they are not. Your job is to do what you can to make Scotland a better place. You hear the stories of your constituents and are tasked with making them happier stories. Will each of you change the world? I believe so. The work of being a good person, though, is not grand and will rarely make headlines. But we all have the power to make the lives of the people we encounter just a wee bit better, so that at the end of our lives, people telling our story will say, she was a good woman, and those words will be true. Thank you.
Thank you. Thank you, Ronit. The next item of business is topical questions. At question number 1, I call Carol Mochan.
Thank you, Presiding Officer. To ask the Scottish Government what action it is taking in response to reports that 1 in 5 adults in Scotland are unable to access dental care.
Minister Jenny Minto.
Thank you, Presiding Officer. We remain committed to improving access to NHS dentistry across Scotland, building on our 2023 reform, which incentivised dentists to deliver more NHS care and backed by a funding increase of nearly 40% over this parliamentary session. As a result, we have seen participation in NHS dentistry increase by over 10 percentage points to 62%, while the number of dentists has returned to pre-pandemic levels. We recognise we need to do more, and so our operational improvement plan commits to additional actions to further increase the dental workforce and support equitable access in rural areas.
Carol Mochan.
Thank you. Thank the Minister for the answer. Our constituents' well-being should not come down to a postcode lottery, but sadly, dental deserts are far too common, particularly in my South Scotland region. Too many dentists are forced to use their savings on private dentistry. A YouGov poll highlighted in the British Dental Association's manifesto that 65% of Scots believe the Scottish Government should do more to improve NHS dentistry in Scotland. As workforce is a key part of this issue, can the Scottish Government give an update on how it will plan to boost the workforce, specifically given that dentists remain in short supply and even fewer are willing to treat NHS patients?
Minister.
I thank Carol Mochan for her question, and as I highlighted in my first answer, we improved the pay situation for dentists in 2023, and I was very clear when that started that it was the beginning of a journey. We have increased the number of spaces available for dentists to train in Scotland by 7%, and I think that's a very positive way forward. I recognise that there are some areas that we need more dentists, and so we have given an additional £437,000 funding to Dumfries and Galloway, which has been used to recruit 2 senior dental officers and a dental therapist to resource Garden Hill Dental Surgery in Castle Douglas.
Carol Mochan.
Thank you, Presiding Officer. As part of this, we need to view dentistry as part of the health prevention agenda. In places like Ayrshire and Arran in my South Scotland region, only 60% of registered patients live in the most deprived areas had contact with an NHS dentist in the past 2 years. The last National Dental Inspection Programme report revealed an alarming gap in oral health between children living in the most deprived areas of Scotland compared to those in the least deprived areas. Given inequalities have widened under this government, does it recognise that access is a system-wide issue and significant changes must be made to tackle dentistry inequality?
Minister.
I thank Carol Mochan for her follow-up question. As Carol Mochan knows, we have continued to invest and increase investment in Child Smile, which is a multifaceted, multi-setting dental public health programme which supports the young children. We also have a number of adult programmes specifically to support inequalities called Caring for Smiles, and that's to improve oral health for people with experience of the justice system, people experiencing homelessness, and adults with additional care needs. Now, I have been very clear in my answers that we recognise we have made some progress, but we have more to make. And that's why I'm meeting with the BDA for Scotland next week to discuss further changes that we could make with them.
Brief supplementary. Stuart McMillan.
Thank you, Presiding Officer. Can I ask the Minister what assessment she has made of how harmful Labour policies on immigration are having on the dentistry sector in particular, because, as we know, that the UK Labour government are determined to lurch further to the right than even the Tories were when they were in power when it comes to immigration policies.
On devolved matters, Minister.
I remain deeply concerned about the UK Government's changes to the skilled worker visa, which removes key dental professions from qualifying for sponsorship, including dental therapists, who are a critical element for increasing skill mix in dental practice, especially those in Scotland. More widely, these changes will impact practices' ability to recruit qualified staff, reducing access to preventative dental care and oral health improvement services in particular. Last year, I wrote to the UK Government to urge them to reconsider these changes, and I am disappointed that my request has been refused.
Brief supplementary. Brian Whittle.
Thank you, Presiding Officer. Despite targets within the NHS Scotland's recovery plan following COVID, tooth decay remains the primary reason for child hospital admissions, with over 6,500 extractions under general anaesthetic annually costing the NHS £8.4 million. This is an entirely preventable condition. Every procedure performed represents a drain in theatre space, staff time and resources that is needed elsewhere. So does the Cabinet Secretary share the public's concern, and as a result of these statistics, is the Scottish Government taking any new action to improve children's oral health?
Minister.
I thank Brian Whittle for his question, and as I indicated to Carol Mochan, I'm meeting with BDA Scotland on the 24th of March to discuss paediatric extractions under general anaesthetic, and my officials are looking at enhanced paediatric services in primary care, aligning to public commitments around shifting the balance of care to primary and community settings.
Brief supplementary. Willie Rennie.
The SNP government can't blame anybody else but themselves for this problem, because this has been a long time coming. The Cooper dentist in my constituency has been on emergency service only for a year, and the problems go back way before that as well. So when can my constituents expect a full-time dentistry service in Cooper?
Minister.
So, as Willie Rennie will recognise, NHS Fife works very closely with dentists across the Fife area. I have been putting in over the last 3 years changes to dentistry to allow an improvement and an increased workforce. I would point out very quietly, though, that the decision for under Brexit has impacted on a number of areas because we have got less dentists from overseas coming to Scotland. But I am pleased that the General Dental Council has expanded their opportunities for dentists from overseas to sit exams, which I hope will improve the circumstances that Mr Rennie comments upon in Fife.
Question number 2, Alasdair Allan.
To ask the Scottish Government whether it will provide an update regarding the steps being taken to support families with the cost of living in light of the conflict in the Middle East and its impact on heating oil prices.
Cabinet Secretary Gillian Martin.
Thank you, Presiding Officer. The UK Government has been painfully slow to act on the matter, given that heating oil prices have already doubled before their intervention yesterday. We have been pressing for action, but the support announced yesterday only equates to around £33 per household that uses oil heating. It simply doesn't go far enough. So, given the urgency of the problem, the Scottish Government will supplement the £4.6 million that we've been allocated with a further £5.4 million, more than doubling the level of support that is available. And with this, we will launch a £10 million Scottish Emergency Oil Heating Scheme from the 1st of April. The scheme will be delivered through Advice Direct Scotland, and low-income households reliant on oil will be eligible. Further details will be announced as soon as practicable. We again call on the UK Government to take its responsibility for energy pricing seriously, to take further actions to support these households. In an energy-rich nation, no one should struggle to pay their bills. Our schemes already deliver average savings of £300 annually, and will keep further support under review.
Mr Allan.
I thank the Cabinet Secretary for her response. In my constituency, over 86% of homes are off the gas grid and some 46% are heated with oil. Given that critics have warned that Keir Starmer's support package, as the Cabinet Secretary mentions, works out at around £33 per affected household, does she agree that this will be little consolation for the thousands whose fuel prices have doubled overnight? Does the Cabinet Secretary also agree that this cannot be the end of any action taken by the UK Government, given that energy policy is reserved?
Cabinet Secretary.
I absolutely agree with Alasdair and all the points that he's made. Developing global events only reinforce the need to put in place robust and effective consumer protections and financial assistance for users of all fuel types that will be affected. And I do call on the UK Government to keep its promise and urgently introduce regulation of this sector. But obviously there's an awful lot more they can do in this space. We don't know how long this conflict is going to last, so they need to keep a watching eye on the support that they provide.
Alasdair Allan.
I welcome the Scottish Government's work to support households and families across Scotland with the cost of living. In stark contrast, it would seem, to the inaction of the UK Labour Government. Does the Cabinet Secretary recognise that for many island households in places like Uist right now, soaring heating costs are compounded by other problems like the present unavailability of petrol, and that all this is yet more evidence for why Scotland should have control over our energy policy?
Cabinet Secretary.
And I agree with all the points that Dr Allan makes. Our island and rural communities already face significant challenges, and these have been disproportionately impacted by developing global events. The UK Government's delayed response to this crisis only underlines that we need real change to make our energy wealth work for us, and the only change that will work for Scotland is independence.
I call Tim Eagle.
I mean, isn't it crazy? We've got people suffering across Scotland with heating oil prices, and we're here talking about independence. I mean, this is just the SNP going mad, isn't it? Absolutely crazy. But anyway, let me get to my constituents who are deeply troubled. It's great that we have got extra money coming in from the Scottish Government. I applaud that, but we need it now. So when are we going to get these details of how they can apply? Because they talk about with weather in March, in like a lion, out like a lamb. Well, this year I'm worried that it's going to be in like a lamb and out like a lion. My constituents will need this money as soon as possible. So can you ensure when we're going to get the detail?
Cabinet Secretary.
Well, I don't know if Tim Eagle was listening rather than frothing at their mouth to anything that I was saying. Given the urgency of the problem, I said we will supplement the £4.6 million being allocated with a further £5.4 million, and we will launch that £10 million Scottish Emergency Oil Heating Fund from the 1st of April. Obviously, we're in the middle of March right now. We're working very hard. We're going to be delivered through Advice Direct Scotland. We only found out about the £4.6 million yesterday. I think that within 24 hours we've done quite a lot. Advice Direct Scotland, trusted partners, who also, of course, helped us with the Fuel Insecurity Fund, are working at pace to get this scheme open.
Harper.
Thank you, Presiding Officer. Almost 40% of the households in Dumfries and Galloway rely on heating oil and are therefore particularly exposed to global price volatility. Does the Cabinet Secretary agree with me that in light of the pressures caused by international events and while shackled to a Westminster government offering an equivalent of £35 per household, it's absolutely vital that Scotland continues to enhance our own energy security through sustainable fuels, including biofuels and renewables development?
Cabinet Secretary.
Well, it's rural areas of Scotland that have got the most to gain from development of renewables. And of course, if the Scottish Government, the SNP Scottish Government, hadn't stayed the course in our ambition on renewable energy, electricity generation would be in a much more precarious case than we are right now. By expanding that renewable sector and its wider supply chain, not only will we strengthen our energy independence and security, we ensure that we're less reliant on imported fuels and global fossil fuel markets, which of course we don't control. Global events will dictate the price of fossil fuel markets. So protecting Scottish consumers from situations like this one we are currently experiencing as a result of the global crisis is a mission for this government that we will continue.
Question number 3, Liam Kerr.
Thank you, Presiding Officer. To ask the Scottish Government what assessment it has made of the impact on Police Scotland of the budget 2026-27 allocation being £50 million less than the amount requested by the Chief Constable.
Cabinet Secretary Angela Constance.
Presiding Officer, the 2026-27 Scottish Budget will provide record funding of over £1.7 billion for policing. This is a total increase of £81.5 million or 5% compared to the published 25-26 ABR budget. We will also provide an additional £3 million per year in each of the next 3 years to support Police Scotland's successful work on tackling retail crime, and we will provide an additional £2.7 million in 2026-27 to support Police Scotland's work in the detection and disruption of child sexual abuse and exploitation. The Chief Constable confirmed recently at the Criminal Justice Committee that this budget allocation will allow her to prioritise frontline services for our communities to ensure that she can maintain officer numbers at 16,500 in the coming year.
Liam Kerr.
Well, one implication of being £50 million less than requested that the Cabinet Secretary strangely failed to mention is that at the SNP's own conference, the SPF, the Scottish Police Federation's General Secretary, flagged that terminally ill police officers who have been injured on duty and are off work will be forced onto half pay or even no pay, and that is, quote, because of this budget. Is the Cabinet Secretary concerned, therefore, that terminally ill officers may be losing money as a direct result of this government's cuts? And what does she intend to do about it?
Cabinet Secretary.
Presiding Officer, while police officer pay and conditions are negotiated through the Police Negotiating Board for Scotland, including sick pay, whether or not to make any discretionary payments is an operational matter for the Chief Constable. Sick pay can be extended beyond the standard periods of 6 months full pay and 6 months half pay at the discretion of the Chief Constable. And it is worth reminding Mr Kerr that in comparison to the starting position of the 25-26 budget, there is now in next year's budget a £90 million increase in comparison to that starting position, and that was against a budget act of a budget ask of £104 million. And it's always worth remembering that the Conservatives made no requests for additional funding for policing in budget negotiations.
Liam Kerr.
Well, it's always worth remembering that I've got access to figures as well. You see, since 2021, recorded crime up 6%, sexual crime up 10%, shoplifting up 137%, and violent crime up 13%. Police officers, however, since 2020, down by 1,000. What does the Cabinet Secretary think will happen to these figures and the numbers of victims of crime as a result of this government's decisions to defund our police?
Cabinet Secretary.
Presiding Officer, I'm very glad Mr Kerr's got access to figures, because he will therefore know that this government has increased the budget for policing year on year since 2016. And he will also be aware of the headline figures that show a substantial fall in violent and property crime in Scotland since 2008-9. And under this government, Scotland is a safer place.
I will take a brief supplementary. Rona Mackay.
Thank you, Presiding Officer. Can the Cabinet Secretary tell me what steps Police Scotland is taking to ensure that there is a good recruitment pipeline into our national force? And can she provide any reassurance that the record funding the Scottish Government provides to Police Scotland will maintain police officer numbers?
Cabinet Secretary.
Presiding Officer, investment in policing has enabled Police Scotland to take on more recruits in the last financial year than at any time since 2013, as Scotland continues to have more officers per 10,000 of the population than England and Wales. And Police Scotland has confirmed that they have a healthy recruitment pipeline, welcoming over 1,900 new officers since the beginning of 2024, including over 70 new recruits on the 9th of March this year. And the Chief Constable has confirmed that this budget allocation will allow her to prioritise frontline services for our communities to ensure that police officer numbers remain at 16,500.
Brief supplementary. Sharon Dowie.
Thank you, Presiding Officer. Recent reports suggest that retail crime in Scotland has risen sharply, with over 50,000 shoplifting incidents recorded last year and nearly 1 in 5 shoppers witnessing abuse of retail staff. We know the £3 million for the Retail Crime Task Force made some impact, but beyond that, what action will the Scottish Government take to ensure that this funding gap does not undermine efforts to tackle shoplifting and violence against retail staff?
Cabinet Secretary.
Well, Presiding Officer, it's a shame that Ms Dowie and her colleague didn't vote for the Scottish Government budget, which actually provides £3 million, not just this year, but next year and the next again year. And that shows a long-term commitment to tackling retail crime in this country.
Thank you. That concludes topical questions. There will be a brief pause before we move to the next item of business.
The next item of business is consideration of a business motion 2118 in the name of Graham Day on behalf of the Parliamentary Bureau, setting out a timetable for the Stage 3 consideration of non-surgical procedures and functions of medical reviewers Scotland Bill. Ask any members wishing to speak to the motion to press the request to speak buttons. I call on Graham Day to move the motion.
Move, Presiding Officer.
Thank you. No members have asked to speak against the motion. Therefore, the question is that motion 2118 be agreed. Are we all agreed? Parliament is agreed. The next item of business is Stage 3 proceedings on the non-surgical procedures and functions of medical reviewers Scotland Bill. In dealing with the amendments, members should have the bill as amended at Stage 2, that is SP Bill 77A, the marshalled list and the groupings of amendments. The division bill will sound and proceedings will be suspended for around 5 minutes for the first division of the Stage 3. The period of voting for the first division will be 30 seconds. Thereafter, I'll allow voting period of 1 minute for the first division after a debate. Members who wish to speak in the debate on any group of amendments should press the request to speak buttons or enter RTS in the chat function as soon as possible after I call the group. Members should now refer to the marshalled list of amendments. And we come to Group 1, meaning of non-surgical procedures. I call Amendment 1 in the name of the Minister. Group with Amendments 2, 10, 8 and 9. Minister, to move Amendment 1 and speak to the amendments in the group. Minister.
Thank you, Presiding Officer. At Stage 2, amendments were made to the definition of a non-surgical procedure in Section 1 and to the kinds of procedures set out in Schedule 1 that are non-surgical procedures for the purposes of the bill. This group contains further technical amendments in my name, ensuring that the descriptions of different procedures are clear. Amendment 1 clarifies that a procedure may fall within several procedure descriptions in Schedule 1 or may combine different kinds of procedures and is still a non-surgical procedure for the purpose of the bill. Amendments 8 and 9 make clear that injectable and intravenous procedures can involve the use of a microneedle. Amendment 2 removes a redundant "or" from Section 1(1)(b)(2). If I may now turn to Amendment 10 from Sandesh Gulhani, which would remove persons regulated by the General Osteopathic Council from the list of regulated healthcare professionals from Section 1(3) of the bill. This removes osteopaths from the healthcare exception in Section 1(1)(b)(2). Dr Gulhani raised concerns about the inclusion of osteopaths at Stage 2. I met with Dr Gulhani to discuss this, and he should not be surprised that I will be urging him not to press this amendment. This bill is not the place to judge what does and does not constitute healthcare, nor whether particular healthcare procedures are appropriate or effective in the treatment of disease. That is a matter for healthcare professionals and their regulators. At Stage 2, I told the committee that this amendment raises concerns about legislative competence due to its interaction with the reservation of the regulation of health professionals in Reservation G2 in Schedule 5 of the Scotland Act 1998. This includes osteopaths as the profession regulated by the Osteopaths Act 1993. I urge Dr Gulhani not to press Amendment 10 and urge members to support the amendments in my name. I move Amendment 1.
Thank you. I call Sandesh Gulhani to speak to Amendment 10 and other amendments in the group. Dr Gulhani.
Thank you, Declaration of Interest as a practising NHS GP. Amendment 10, my amendment, changes the definition of regulated healthcare professional in the bill so it does not include osteopaths who are regulated by the General Osteopathic Council. Osteopathy is a pseudoscience. Very limited evidence of any effectiveness whatsoever, and those practising it should not be considered regulated healthcare professionals. Osteopaths are unable to prescribe medicines for a reason. They do not inject Botox. This alone does not entitle them to be covered by healthcare exemption. My amendment therefore strengthens the definition of what a regulated healthcare professional is in this bill and ensures only those properly qualified are referred to as such.
Thank you, Dr Gulhani. Minister to wind up.
Thank you, Presiding Officer, and I'm grateful for Dr Gulhani's notes. If I may, the healthcare exception operates to ensure that the bill does not regulate procedures which are provided by regulated healthcare professionals for a healthcare purpose, specifically for the purpose of preventing, diagnosing or treating illness. The General Osteopathic Council has confirmed that although osteopaths are unable to prescribe, some do undertake postgraduate injection training and then work with a prescriber, for example, to administer corticosteroid injections to parents. I urge members to support Amendments 1, 2, 8 and 9, and I urge members not to support Amendment 10.
Thank you. The question is that Amendment 1 be agreed to. Are we all agreed? Yes. Parliament is agreed. I call Amendment 2 in the name of the Minister. Already debated with Amendment 1. Minister to move formally.
Moved.
Question is that Amendment 2 be agreed to. Are we all agreed? Yes. Parliament is agreed. I call Amendment 10 in the name of Sandesh Gulhani. Already debated with Amendment 1. Sandesh Gulhani to move or not move?
Moved.
Question is that Amendment 10 be agreed to. Are we all agreed? Parliament is not agreed. There will be division, and as this is the first division of Stage 3, I'll suspend for around 5 minutes to allow members to access the digital voting system. Okay, the question is that Amendment 10 be agreed to, and members who cast their votes now. And the vote is now closed. Point of order, Jenny Goldruth.
Presiding Officer, my app wouldn't have connected. I would have voted no.
Thank you. I will make sure that is recorded. Point of order, Jackie Bailey.
Apologies, Presiding Officer. My app wouldn't connect. I would have abstained.
Thank you. I will make sure that is recorded. Point of order, Ariane Burgess.
My app didn't connect. I would have voted no.
Thank you, Ms Burgess. I'll make sure that is recorded. And the result of the vote on Amendment 10 in the name of Sandra Skolhani is yes 27, no 68. There were 15 abstentions. The amendment is therefore not agreed. We come to Group 2, meaning of permitted premises. I call Amendment 11 in the name of Ash Regan. Group with Amendments 12, 13, 14, 15, 29 and 30. I call on Ash Regan to move Amendment 11 and speak to other amendments in the group. Ms Regan.
Thank you, Presiding Officer. This bill seems to me to be a classic example of the way this government has started to make law, which is it sees that there's an issue and then it rushes into legislation, but unfortunately only listening to one side of the argument, often ignoring women's voices, which we've seen time and time again, and being entirely blind to unintended consequences. The majority of aesthetics customers, 80% of them we think, are women, and the majority of providers are women. And I want to be clear at the outset, I want aesthetics provided in safe, clean premises by qualified practitioners. But I am concerned that this is not what will happen should this bill pass. Now, I think we all are aware that aesthetics is now a growing area, and whatever we think of that, that is something that I can't see declining over the next few years. There's new innovations coming through every few months. There's a growing number of first-time clients. So I think this is an area that Scotland needs to get this right. Now, 80% of the providers in this space are non-medical. And I was contacted by a constituent who I imagine is far from unusual in this context. And I want to put her story to the Chamber because she feels that despite doing everything right, that no one is listening to her. So she's been running her own clinic for 16 years. She's been supporting herself and her young family, and she also employs other women, many of whom are mothers with small children who want to work flexibly. She holds regulated off-qual qualifications in aesthetic practice at level 5 and 7, which cost her £15,000, and the level 7 qualification required over a year of structured study covering facial anatomy, complications management, clinical assessment and patient safety. And she also maintains a level 3 first aid, including anaphylaxis training. So she says in her own words, "My clinic operates as a fully licensed premises. I hold a skin piercing licence from Edinburgh City Council. My business is fully insured, and insurance within the aesthetic sector requires practitioners to demonstrate appropriate training, treatment protocols, risk assessments and clear procedures for managing complications before any cover is granted. And these safeguards are already a fundamental part of responsible practice in this field." She says, "In the past year alone, I've safely treated 496 injectable clients in my clinic." But under the current drafting, the interaction between Section 3 and 4 of the bill means that our permitted premises are effectively limited to clinics run by a prescribing doctor, nurse, dentist or pharmacist. And in practice, this means that the ability to operate a clinic may depend on professional title rather than on aesthetic-specific training or experience. My constituent is what we say we want: responsible, safe, highly trained in her field and a responsible employer. But because she's non-medical, like 80% of the providers in this industry, she wouldn't be able to continue her business as it is. A business that she, like many other women, have built up and invested thousands in investing over the last 16 years. And from my reading that I've done so far on this, it appears the government doesn't know how many women, like my constituents, that it will be putting out of business or out of a job. So I'm wondering if the Minister can cover that when she next gets to her feet. I feel that this is irresponsible lawmaking and that there's a potential that these businesses should be being compensated. If legislation is going to result in business closure, at the very least, the government should know how many businesses will be affected. So my amendments in this group would ensure that the bill recognises appropriately qualified non-healthcare aesthetics practitioners and premises within the regulatory framework. Amendments 11, 13 and 14 recognise non-healthcare aesthetic professionals within Section 4 and define that role by reference to a qualification threshold, which I know the Government has spoken about in earlier stages of the progression of this bill. It would allow ministers, through Amendments 12 and 15, to establish a licensing scheme by regulation for non-healthcare premises, and those regulations could set minimum standards for premises and specify which procedures are permitted to be provided. And this would ensure that qualified practitioners and properly regulated premises are not excluded simply because they sit outside traditional healthcare structures. And Amendments 29 and 30 are consequential, and they ensure that regulations made under these provisions would be subject to affirmative procedure. And this means Parliament can obviously scrutinise and approve these regulations at a later date. Overall, these amendments support a proportionate and, I believe, a workable regulatory framework that recognises competence and qualifications across this sector, and I move Amendment 11 in my name.
Thank you, Ms Regan. And I call Alex Hamilton briefly.
Thank you very much, Presiding Officer. I rise briefly in support of Ash Regan's amendments, which I think provide remedy to some of the inflexibilities around the bill as drafted that I raised at stage 1. Ash Regan speaks of constituents coming to see her. I've had constituents come to see me. I'm sure members across the chamber have businesses in their constituencies that would not just be affected by all of the changes proposed in this legislation, but would absolutely be sunk without trace if they were to be brought in unamended. My anxiety is that whilst absolutely we need to regulate for the bad actors in this field of procedure, but there are a good number of largely women who are well qualified, very focused on patient care and cleanliness and hygiene and all of the other things we would hope for the sector. And I think that to legislate without thinking about the consequences on them and taking remedy towards them would be a very poor thing indeed.
Thank you. And I call the Minister.
Thank you, Presiding Officer. Ash Regan's amendments provide alternatives to the permitted premises currently described in the bill. These alternatives weaken public safety by removing the requirement for a healthcare professional to be involved in these settings. Due to time constraints, I will not repeat all of the discussions at stage 2, but this is a fundamental part of the bill, so there are points that I must make. And if I may, just before I take Jeremy Balfour's intervention, we based our estimates on an estimated 1,500 businesses. I would point out that this is a non-regulated sector, partly why we're bringing in these regulations, but not all businesses will be impacted, as I will go on to explain later on.
Very briefly, Jeremy Balfour.
Thank you, President. I'm grateful to the Minister. I wonder, you've said how many businesses, how many individuals will lose their jobs because of this, and have you done an equality impact in regard to how it will affect females more than males?
All through the Chair. Minister.
Thank Jeremy Balfour for his intervention. And yes, of course, we have done an equality impact assessment. Firstly, that due to time constraints, so there are a few points that I wish to make. Firstly, that I sympathise with Ms Regan's intentions. I'm sure she is trying to mitigate what many businesses see as the most challenging part of the bill. Secondly, that the requirement for a healthcare professional to be involved is the most important part of the bill. The reasons for healthcare professional involvement being essential to public safety were discussed at stage 2. In many cases, prescriptions will be needed at the outset of a procedure. In other cases, it will be necessary for certain emergency medications to be available on site. Within the UK regulatory framework for the sale and supply of medicines, non-regulated settings delivering non-surgical procedures are not able to routinely hold supplies of prescription-only medicines without the involvement of a suitably qualified healthcare professional. To say that healthcare professional involvement is necessary is not to denigrate the skills, dedication and experience of other practitioners who should continue to have a role in this sector. These roles can and should be complementary, ensuring safe, professional and effective procedures are delivered. There are other benefits to the settings we have selected and to the role of a healthcare professional. For example, that healthcare professionals are subject to regulation by professional bodies. I will turn to the amendments themselves. Amendments 11 and 29 seek to add premises managed by a non-healthcare aesthetics professional to the list of permitted premises in section 4.1 of the bill. The Scottish Ministers can provide registration requirements for these premises in affirmative regulations. Amendment 14 defines a non-healthcare aesthetics professional by reference to particular levels of qualification. Unfortunately, this training does not qualify a practitioner to prescribe medications, nor is it clear that these settings would be able to routinely hold stocks of relevant emergency medications without the involvement of a healthcare professional. These settings do not provide the safety protections required. Amendments 12, 15 and 30 would provide for a licensing scheme to be established by regulations. Such a scheme is already to take effect from the 6th of September 2027 under the Civic Government Scotland Act 1982, Licensing of Non-Surgical Procedures Order 2026. This licensing scheme is appropriate for lower risk procedures, but I do not believe the risks of procedures in the bill can adequately be mitigated without the involvement of a healthcare professional. Amendment 13 includes a non-healthcare aesthetics professional as one of the persons who may provide or manage services from the premises of a HIS-registered independent clinic in order for it to be permitted premises under section 4.1a of the bill. Amendment 14 discussed already defines non-healthcare aesthetics professional. I cannot support these amendments for the public safety reasons given previously. I also note that section 4.1a interacts with the definition of an independent clinic in section 10F2 of the National Health Service Scotland Act 1978. Such a clinic would still need services to be provided by one of the healthcare professionals listed in that section to register with HIS. And with regards to Alec Cole-Hamilton's support, I had hoped to meet with Mr Cole-Hamilton in the lead up to stage 3. Unfortunately, he wasn't able to meet because of his diary. I'd also like to point out that I expect that in implementing this bill, the Scottish Government will work with businesses in the unregulated part of the sector to ensure that they have access to support and guidance. I understand Ms Reagan's motivations, but must urge the member not to press these amendments and for members to vote against them.
Okay, and I invite Ash Reagan to wind up. Press to withdraw Amendment 11.
Thank you, I press. This bill is creating a situation where practitioners who spent over a year completing advanced aesthetics training will not be able to operate independently, meaning women like my constituent and many others, a non-healthcare practitioner, would need to rely on a prescribing medic in order to operate and supervise a clinic. And that's even if a provider could be found, and that remains to be seen, and the costs may well be prohibitive. So it creates a model where experienced practitioners would then become dependent on prescribers who have no financial stake in their business, while potentially offering the same treatments themselves. So in practice, this means that a qualified practitioner could spend years building a compliant clinic only to find that their ability to continue operating depends entirely on securing and retaining a prescriber who may also be a competitor within the same market. Now, this market, the treatments and the demand for them, particularly from young women, is growing and, in my opinion, will only continue to grow due to changing beauty standards that are heavily promoted on social media. And I think there is a lack of understanding by the government of the drivers for particularly the consumers in this industry. And I hope the government understands and can see that those from a lower socio-economic background will not be able to afford the treatment prices, which will inevitably be driven up if all or many of the non-medical providers that are in the market are forced to close. It will then inevitably push these consumers into an underground and unregulated sector, which may then lead to an increase in the adverse treatment effects. So this bill, through unintended consequences, may force out responsible and highly trained women-led businesses and lead, unfortunately, to more women consumers getting treatment from unregulated and unsafe providers. So I would ask the Chamber to support my amendments and ask the Government to think very carefully about this issue and the predicament of women like my constituent and the unintended consequences.
Thank you, Ms Regan. The question is that Amendment 11 be agreed to. Are we all agreed? Parliament is not agreed with division and members should cast their votes now. And the vote's now closed. Point of order, Oliver Mundell.
Thank you, Presiding Officer. I would have voted no.
Thank you, Mr Mundell. We'll make sure that vote is recorded. And the result of the vote on Amendment 11 in the name of Ash Regan is yes 6, no 102. There were 2 abstentions. The amendment is therefore not agreed. I call Amendment 12 in the name of Ash Regan, already debated with Amendment 11. Ash Regan to move or not move?
Moved.
The question is Amendment 12 be agreed to. Are we all agreed? Parliament is not agreed. There will be division and members should cast their votes now. And the vote's closed. The result of the vote on Amendment 12 in the name of Ash Regan is yes 6, no 104. There were 2 abstentions. The amendment is therefore not agreed. Call Amendment 13 in the name of Ash Regan, already debated with Amendment 11. Ash Regan to move or not move?
Moved.
The question is that Amendment 13 be agreed to. Are we all agreed? Parliament is not agreed. There will be a division. Members should cast their votes now. And the vote's now closed. The result of the vote on Amendment 13 in the name of Ash Regan is yes 5, no 106. There were 1 abstention. The amendment is therefore not agreed. I call Amendment 14 in the name of Ash Regan, already debated with Amendment 11. Ash Regan to move or not move?
Moved.
The question is that Amendment 14 be agreed to. Are we all agreed? Parliament is not agreed. There will be a division and members should cast their votes now. And the vote is now closed. The result of the vote on Amendment 14 in the name of Ash Regan is yes 6, no 103. There was one abstention. The amendment is therefore not agreed. I call Amendment 15 in the name of Ash Regan, already debated with Amendment 11. Ash Regan, to move or not move?
Moved.
Question is that Amendment 15 be agreed to. Are we all agreed? Parliament's not agreed. There will be a division and members should cast their votes now. And the vote is now closed. And the result of the vote on Amendment 15 in the name of Ash Regan is yes 6. There were no 106. There were no abstentions. The amendment is therefore not agreed, which takes us to Group 3, Regulations, Power to make further provision and consultation requirements. I call Amendment 16 in the name of Sanders Golhani, group with amendments as shown in the groupings. Sanders Golhani to move Amendment 16 and speak to other amendments. Dr Golhani.
Thank you. Amendment 16 requires that when ministers make regulations imposing further restrictions and requirements on non-surgical procedures, for example around training, qualifications or supervision, that they must include transitional or saving provisions that ministers consider appropriate. Now, this should include the timescales for compliance and phased implementation period for providers. So this amendment is required because there is a great deal of concern from businesses at stage 1 about the impact new regulations would have on them and how they would be able to make the transition to the new regulatory scheme. Stage 1 report from the Health Committee concluded that the Scottish Government should provide appropriate support and guidance to help responsible providers of non-surgical procedures to make the transition successfully to the new regulatory framework. Stage 1 report also went on to say that there be a need for additional information and support to be provided to accompany the bill's implementation to help providers to take the steps necessary to comply with the law. Now, my amendment addresses the concerns of businesses and the committee by ensuring that when regulations are made, which impose new requirements, they must be accompanied by transitional or saving provisions that ministers consider appropriate. This should include the timescales for compliance and a phased implementation provided for providers. This helps businesses, leaves flexibility for ministers and ensures providers can effectively comply with new regulations.
Thank you. I call on the Minister to speak to Amendment 3 and other amendments in the group. Minister.
Thank you, Presiding Officer. Amendments 3 and 4 build on the helpful provision introduced by Ms Mackay at Stage 2 to specify that regulations under Section 5(1) may make provision for requirements for certain higher risk groups. Dr Golhani at Stage 2 raised the need for guidance in relation to mental health conditions, particularly body dysmorphic disorder. While I would expect existing clinical guidance and a healthcare professional's training on informed consent and shared decision-making to be sufficient here, I acknowledge that specific additional provision may be helpful. I have therefore built on Ms Mackay's amendment to introduce a specific reference to mental health in Section 5(2)(e) as matters on which regulations may be made. Dr Golhani's Amendment 16 requires that regulations under Section 5(1) must include certain transitional and saving provisions. I agree with his comments on the importance of such provision. I can confirm this is already possible under Section 18. The amendment is unnecessary and I cannot support it, as a transitional provision specified may not always be the most appropriate. This amendment would make it more difficult for ministers to put in place appropriate regulations with the right protections, so I urge Dr Golhani not to press this amendment. Amendments 31 and 32 by Dr Gulhani provide further specification in the consultation requirements in section 19A, which apply to any affirmative procedures made under the bill. The lists of persons to be consulted are likely to be appropriate in most cases, but I want to reiterate that even the affirmative powers may be capable of being exercised to make relatively small technical changes or changes that are only relevant to one of the groups that have been listed. I'm concerned that this amendment requires consultation with patient organisations, and I'm not aware that any such organisations exist representing recipients of these procedures. As a result, it may not be possible to comply with this duty, and I would not want that to prevent us from making necessary regulations in this area or add increased bureaucracy. Colin Beattie's amendments 19, 20, 21 and 22 all relate to the principle of supervision. I was pleased to support Fulton McGregor's amendment at stage 2 that created a requirement for regulations under section 5(1) to be made, specifying training or qualification provisions for persons providing non-surgical procedures within 3 years of section 3 of the bill being commenced. If it is not practical to do this, a report must be laid before Parliament explaining why. I supported this because of the broad consensus across the Parliament about the importance of establishing training and qualification standards. Supervision is a matter of similar importance and concern, and I'm happy to support these amendments that make similar provision, and I was appreciative of having conversations with Carol Mochan in this area too. While the timing of training and supervision regulations are not entirely within the gift of the Scottish Ministers, I am comfortable with the length of time specified in section 5(5) and the option available at section 5(6) for Ministers to be held to account if the Government cannot meet these expectations. I urge members to support amendments 19 to 22 in Colin Beattie's name and amendments 3 and 4 in mine. And I urge Sandesh Gulhani not to press amendments 16, 31 and 32.
Thank you. I call Colin Beattie to speak to Amendment 19 and other amendments in the group. Mr Beattie.
Thank you, Deputy Presiding Officer. Amendments 19 to 21 amend Section 5(5) of the bill, which currently provides that Scottish Ministers must lay a draft of an SSI containing regulations under Section 5(1), specifying requirements about the training or qualifications of persons who may provide a non-surgical procedure within 3 years of Section 3 coming into force. These amendments are a requirement for regulations on supervision to this section, meaning the Government should lay a draft SSI within 3 years of Section 3 coming into force. Amendment 22 amends Section 5(6) of the bill to make clear that more than one set of regulations may be laid to cover all of the matters mentioned in the amended subsection 5. As this bill was passing through Parliament, I have been keen to support non-medical practitioners in their efforts to have their skills and training recognised in the bill. I have met with a number of practitioners who all agree that the sector is in need of regulation. However, some of these business owners have spent tens of thousands of pounds on their training and facilities. It is vital we must bring these practitioners with us, move towards providing upskilling and training to enable a fair transition and prevent mass closure of businesses. In my discussions with the Minister, I advocated for a national governing body to be established by practitioners with the support of the Scottish Government. Understandably, I was informed that this cannot be achieved through this bill. I hope that if the industry decide to go down this route, that the Scottish Government can support them. I appreciate this is not possible at this stage due to the UK Internal Market Act. However, I hope members will support these amendments, which provide competent non-medical practitioners with the assurance that the Scottish Government are committed to a pathway into a safer, regulated industry. And I'd like to just finish by thanking the Scottish Government for working with me on these amendments, and I would urge members to support these.
Thank you. I call Carol Mochan very briefly.
Thank you, Presiding Officer. We will be supporting all the amendments in this area. Scottish Labour's approach to the bill has always been to take the view of safety first, but we think that, of course, there are businesses, as Dr Gulhani mentioned, who are working very professionally, and we would seek to make sure there was that transition and support to businesses in order that they could practice. Thank you.
Thank you. And I call on Standish Gulhani to wind up. Press to withdraw Amendment 16. Dr Gulhani.
Thank you, Deputy Presiding Officer. And apologies to the Chamber and yourself, because I didn't mention 31 and 32 that I have in this, where 31 requires ministers to consult people when they make regulations, and my 32 clarifies the people that ministers must consult before they can make regulations. As Carol Mochan has said, I do feel that these are sensible amendments, and I do hope the Chamber would be able to agree with us, and I would like to press.
Thank you. The question is that Amendment 16 be agreed to. Are we all agreed? Parliament's not agreed. There will be a division in members who cast their votes now. And the vote is now closed. Point of order, Christine Graham.
Thank you, Deputy Presiding Officer. I would have voted no. I couldn't connect. Thank you.
Thank you. I'll make sure that's recorded. Point of order, Paul O'Kane.
Right.
Point of order, Paul O'Kane. Paul O'Kane, point of order.
Presiding Officer, I couldn't connect. I would have voted yes.
Thank you, Mr O'Kane. I'll make sure that is recorded. Order, George Adam.
Presiding Officer, I couldn't connect to the system. I would have voted no.
Thank you, Mr Adam. I'll make sure that's recorded. And the result of the vote on Amendment 16 in the name of Standish Gulhani is yes 45, no 68. There were no abstentions. The amendment is therefore not agreed. I call Amendment 3 in the name of the Minister, already debated with Amendment 16. Minister to move formally. The question is that Amendment 3 be agreed to. Are we all agreed? Yes. Parliament is agreed. I call Amendment 4 in the name of the Minister, already debated with Amendment 16. Minister to move formally.
Moved.
Thank you. The question is that Amendment 4 be agreed to. Are we all agreed? Yes. Parliament is agreed. Takes us to Group 4, Qualifications and Training. I call Amendment 5 in the name of Jeremy Balfour, group with Amendments 17, 18 and 23. Jeremy Balfour to move Amendment 5 and speak to the other amendments in the group. Mr Balfour.
Thank you, Deputy Presiding Officer. I have to confess, when I saw this bill come before Parliament, it wasn't one I was expecting to have to engage with directly. But over the last few months, like Alex Hamilton and Ash Regan and others, I have been approached by numerous sole traders and businesses in regard to the effect that, if this bill is passed, will have, particularly on small businesses and particularly on young women who have gone and sought to do this as a trade. Presiding Officer, I move Amendment 5. The intention behind this amendment is to simply make sure that non-surgical cosmetic procedures are carried out safely and by people with the appropriate level of expertise. While these procedures are often described as non-invasive, we know that when things go wrong, the consequences can be significant, ranging from infection and tissue damage to long-term complications. For that reason, it is essential that those carrying out procedures independently have a sufficiently high level of training and competence. At the same time, I want to recognise that there are many practitioners who have spoken to me in this sector who have invested significant time and effort in gaining meaningful qualifications and building professional standards. This amendment is very much about recognising the expertise. It ensures that those with the appropriate level of qualification are able to practice independently and with confidence, while also giving the public reassurance that the standards that apply across the sector. Specifically, the amendment would mean that practitioners can provide non-surgical procedures unsupervised if they either are a regulated medical profession or a non-medical practitioner with a qualification relevant to the procedures they are providing at a level equivalent to at least level 11 on the Scottish Credit and Qualifications Framework. This reflects a high level of knowledge and competence appropriate for independent practice. Importantly, this amendment is not about shutting people out of the sector. Where a practitioner does not yet meet that threshold, they could still be able to practice, but with a supervised framework under an appropriate qualified medical professional. This allows people to continue working, gaining experience and developing the skills, and ultimately getting the qualification. In that sense, the amendment aims to strike a fair and, I believe, proportionate balance. It recognises and supports those practitioners who have undertaken advanced qualifications while ensuring that robust safeguards are in place to the public. Ultimately, this is giving the public safety, but protecting small businesses. Because, Deputy Presiding Officer, if we do not do this, we are going to find people who will go to other parts of the country. We will see people setting up completely unregulated, and there will be greater health consequences because of that. And we will see many small businesses closing and people being put out of work who have put in a significant amount of money. Ultimately, people undergoing these procedures deserve the confidence that the person treating them has the right expertise and the appropriate oversight exists. I believe Amendment 5 does that, and I would encourage colleagues to support it. Thank you.
Thank you, and I call Ash Regan to speak to Amendment 17 and other amendments in the group.
Thank you, Presiding Officer, and I'd just like to say to Jeremy Balfour I will support his amendment in this group as well. Injectable aesthetic procedures are not typically taught within most undergraduate medical or nursing degrees, and as a result, practitioners entering the aesthetic sector when they're medical often obtain their training on these procedures through separate aesthetics training courses. By contrast, non-medical practitioners who have often received qualifications regulated to level 7 in aesthetic practice are focusing entirely on facial anatomy, complications management and safe aesthetic practice. And this bill would create the odd position of highly trained aesthetics practitioners needing to then be supervised by a medical practitioner with only a few, or possibly with only a few hours of aesthetics training. And it also raises practical questions about capacity, as there's no clear data available on how many prescribers actively work within the aesthetic sector, or whether there would be sufficient numbers to support the independent clinics across Scotland, which the Minister has confirmed may be as high as 1,500. So this bill would force already qualified, responsible providers to recruit medics to supervise them, but the Government cannot tell us if that's possible, as the numbers of prescribers are not available. And a further point may be, can the NHS really afford to lose hundreds of prescribers to aesthetics? I think a better way needs to be found, and I think there needs to be a place, a pathway for non-medical but highly trained aesthetics providers to carry out some, perhaps not all, but some treatments. So my amendments in this group would ensure that future regulations on qualifications and training properly recognise competence across the sector. Amendment 17 would require regulations to ensure that pathways exist for practitioners who hold relevant qualifications but are not healthcare providers. And this would ensure that the regulatory framework recognises the range of qualified practitioners currently operating in the sector. Amendment 18 would require ministers, when specifying qualification or training requirements, to have regard to recognised aesthetic qualifications. Amendment 23 is a consequential amendment. But overall, and taken together, these amendments ensure that regulation is based on recognised competence and qualifications, whilst also maintaining appropriate safeguards for patients. They don't weaken the regulations, but they ensure that the framework recognises qualified practitioners and allows ministers to regulate the sector proportionately rather than excluding the sector entirely. And I hear from across the chamber there is recognition that many women-led small businesses are going to be put out of business by this bill. If we don't support amendments such as the ones from Jeremy Balfour and myself, there is no pathway to do that, and these women-led businesses will be put out of business. So I move Amendment 17 in my name.
Thank you. Very brief contribution from Fulton McGregor.
Thank you, Presiding Officer. I will be very brief. Like others, I just wanted to take the opportunity in this section to put on record some issues that constituents have brought to me about this bill. I've been contacted by a number of constituents who have businesses in the area, in my constituency, and they tend to be working class women who have built up these businesses over a long period of time and built up a skill base, and they have been concerned about some of the potential impacts of the bill. Now, I do welcome the Minister's engagement with me at the Stage 2 process, and following on, and as she mentioned previously, I did have an amendment passed at Stage 2, and I welcome the amendments passed in the previous group there relating to Colin Beatties. But I do have some sympathy with the amendments that I've raised today, although I don't think I can vote for them just now, because I think that there is unintended consequences to them as well. But what I would like to ask the Minister is if, in summing up, she can assert how the government can work with these small businesses and individuals to ensure that they are not negatively impacted by this bill. And I felt that these amendments were the best place to come in and make that request. Thanks.
Thank you. And I call the Minister.
Thank you, Presiding Officer. Before addressing these amendments, I want to recognise that there are many highly skilled practitioners who are not healthcare professionals. Many practitioners hold a qualification, as has been referenced earlier, at level 7 of the Ofqual framework or level 11 of the SCQF framework, and these amendments seek to recognise that training. However, I do not intend to support any amendments which would prejudge a decision on the appropriate training or qualification requirements. This would be a matter for future regulations under Section 5(1), and my reluctance should not be seen as a judgment against these well-recognised qualifications. The Scottish Government will engage with, the Scottish Government will engage with practitioners and training providers before taking decisions here, and I hope standards can be set at the same level in England and Scotland to the benefit of practitioners.
Briefly, Ash Regan.
I thank the Minister for taking that intervention. I think there's a frustration out there with many of these women who have spent a lot of time and energy and money building up their businesses, and they're very fearful of what is going to happen to their businesses, which I think people can understand. So the Minister seems to be suggesting there that it is the Government's intention to provide a pathway for non-medical providers. Can the Minister confirm that that is what she's saying to the Chamber today?
Minister.
What I am clear about in my points is that we will engage with practitioners and training providers before taking decisions, and I hope standards can be set at the same level, as I mentioned earlier, in England and Scotland to benefit all practitioners. Amendment 5 in Jeremy Balfour's name seeks to allow non-healthcare practitioners with a level 11 qualification to carry out non-surgical procedures without supervision. I was grateful to Mr Balfour for the discussion we had about his similar Stage 2 amendment, giving ministers the power to establish a regulatory scheme enabling certain practitioners to supervise the provision of a non-surgical procedure. This amendment appears to seek to allow practitioners who are not healthcare professionals to provide procedures without healthcare professional involvement. As I've said in relation to Group 2, it is fundamental to the bill that a healthcare professional is involved in settings providing procedures complementing the aesthetics practitioners. For example, in the event of complications requiring the emergency administration of medicines. This amendment also predetermines training and supervision standards, something which is still to be developed and consulted upon. The Government also has concerns about the legislative competence of this amendment because of its interaction with the reservation of the subject matter of the Medicines Act 1968 and the reservation of the regulation of healthcare professionals in the Scotland Act 1998. I therefore cannot support this amendment and urge Mr Balfour not to press it. Amendment 17 in Ash Regan's name appears to have the same aim as Mr Balfour's. It provides that there must be pathways for such practitioners, although it does not specify what these pathways are intended to achieve. If it's to ensure that such practitioners may undertake procedures, that is permitted under the bill as drafted. Non-healthcare practitioners may provide procedures if they are working from a permitted premises. If the member intends that such practitioners should be able to provide procedures without reference to a healthcare professional, then I would resist this for the reasons I gave in relation to Amendment 5. Ms Regan's amendments 18 and 23 provide that ministers must have regard to recognise aesthetics qualifications, the level 11 qualifications discussed already. I regret that this cannot be accepted, as it would prejudge the consideration I raised earlier. I would like to provide assurance that the Government will consider these and other qualifications that I noted earlier when setting qualification standards. I urge Ms Regan and Mr Balfour not to press their amendments, and if pressed, I would urge members not to support them.
Thank you, and I invite Jeremy Balfour to briefly wind up. Press to withdraw Amendment 5, Mr Bell.
Thank you. I will be brief. I have to say, just having heard the Minister, I am now very confused as to where the Scottish Government's position is. In one breath, she says we can't accept these amendments because there's always got to be a medical practitioner present. And then in the next sentence, she says, actually, we want to talk to the businesses about how we can regulate this going forward. So I think there is real confusion, not only in this chamber, but I expect more importantly there's going to be real confusion amongst small businesses across my region as to what this government is going to do in the future. And for that reason, I will press my amendment.
Thank you. The question is Amendment 5 be agreed to. Are we all agreed? Parliament's not agreed. There will be a division and members should cast their votes now. And the vote is now closed. Order, Angus Robertson.
Presiding Officer, unfortunately I couldn't connect. I would have voted no.
Thank you, Mr Robertson. I'll make sure that is recorded. And the result of the vote on Amendment 5 in the name of Jeremy Balfour is yes 6, no 87. There were 19 abstentions. The amendment is therefore not agreed. I call Amendment 17 in the name of Ash Regan. Already debated Amendment 5. Ash Regan to move or not move?
Moved.
The question is Amendment 17 be agreed to. Are we all agreed? Parliament's not agreed. There will be a division and members should cast their votes now. And the vote's closed. Point of order, Angus Robertson.
Presiding officer, I'm still having trouble connecting to the system. I would have voted no.
Thank you, Mr Robertson. I'll make sure that's recorded. The result of the vote on Amendment 17 in the name of Ash Regan, yes 6, no 89. There were 19 abstentions. The amendment is therefore not agreed. I call Amendment 18 in the name of Ash Regan. Already debated with Amendment 5. Ash Regan, to move or not move?
Moved.
The question is that Amendment 18 be agreed to. Are we all agreed? Parliament's not agreed. There will be a division in members who cast their votes now. Votes closed. And the result of the vote on amendment number 18 in the name of Ash Regan is yes 6, no 89. There were 19 abstentions. The amendment is therefore not agreed. I call amendments 19, 20, 21 and 22, all in the name of Colin Beattie, all previously debated with amendment 16. I invite Colin Beattie to move amendments 19 to 22 en bloc.
Moved en bloc.
Thank you. Does any member object to a single question being put on amendments 19 to 22? No members object. Therefore, the question is that amendments 19 to 22 be agreed to. Are we all agreed? Yes. Parliament is agreed. I call Amendment 23 in the name of Ash Regan. Already debated with Amendment 5. Ash Regan, to move or not move?
It's a consequential, so not moved.
Thank you. That takes us to Group 5. I call Amendment 24 in the name of Sanders Gulhani. Group with Amendment 6. Sanders Gulhani, to move Amendment 4 and speak to both amendments in the group. Dr Gulhani.
Thank you. Amendment 24 requires that HIS must publish information on the resources that are available to businesses and providing non-surgical procedures. This should include information on advice, support and funding that is available to these businesses.
I would encourage members to keep their devices off or on silent. Dr Gulhani, please continue.
As we know, businesses are concerned about the impact that the bill will have on them and how they would be able to make the transition to this new regime. Now, Stage 1 report said that the Scottish Government should provide appropriate support and guidance to help responsible providers of non-surgical procedures to make the transition successfully to the new regulatory framework. A previous amendment that I put forward was deemed inadmissible due to the cost involved, and this absolutely does not have a cost involved. All I'm trying to seek here is to ensure that there is something available for businesses.
Thank you. I call Gillian Mackay to speak to Amendment 6 and both amendments in the group.
Thanks, Presiding Officer. I'd like to thank the Scottish Government for working with me on this amendment. A number of members proposed amendments at Stage 2 that would have required the production of guidance. The proposals for guidance covered a range of issues, and I'd like to thank the Minister for working with me on this amendment, which provides a single requirement, including listing issues that may be included in that guidance. This focuses on guidance appropriate to businesses rather than matters more suited to clinical guidance or judgment, which may interfere with professional and clinical guidance, rightly issued, for example, by the professional or Royal Colleges and Regulators of Healthcare Professionals. Consideration of any relevant clinical guidance would be a part of the role that should be undertaken by the healthcare professionals involved in the procedures. The amendment places a duty on the Scottish Ministers to issue guidance in relation to the provision of non-surgical procedures. The guidance may include information about the requirements which are imposed by Part 1 of the Bill and steps which have been taken by providers to comply with those requirements. The guidance must be published and may be revised or revoked, and I urge members to support my amendment.
Thank you. And briefly, Carol Mochan.
Thank you, Presiding Officer. I would like to put on record Scottish Labour's support for both amendments in this group, which seeks to strengthen the review of support given. Amendment 24 requires for HIS to publish information on the additional resources given to businesses, including advice, support and funding, ensures that providers are supported during the transition, while Amendment 6 sets out in great detail the type of guidance which should be given to help compliance with the bill. During the transition to greater regulation, guidance and information will be incredibly important to support compliance, ensure understanding and to avoid confusion, and that is why we support both amendments in this group.
Thank you, and I call the Minister.
Presiding Officer, and I note Ms Mochan's comments there. Gillian Mackay's Amendment 6 places a duty on ministers to provide guidance about the provision of procedures. It is appropriate that this amendment focuses on the offences in Part 1 of the bill. These are providing a non-surgical procedure to a person under 18 and providing a non-surgical procedure out with a permitted premises, and the steps providers will need to take to meet these requirements. I am grateful to Ms Mackay for working with me and to other members who raised issues around guidance. I hope members are content that this single guidance provision has the flexibility to encompass the topics businesses want in guidance, and that members will support Amendment 6. Amendment 24 in Sandesh Gulhani's name overlaps with Amendment 6 to some degree. It would require HIS to publish certain information on resources available to businesses providing non-surgical procedures. I welcome my recent discussion with Dr Gulhani on this topic, and I know he noted my comments about there being resources available for businesses. As well as Amendment 6's requirements for the Scottish Government to issue guidance, Amendment 24 would place a duty on HIS to publish information about support available, such as the resources I highlighted previously from local authorities and Business Gateway. It is more appropriate for this information to be included within the guidance published by the Scottish Government rather than a legal responsibility for Healthcare Improvement Scotland. So I ask Dr Gulhani not to press Amendment 24 and members to support Amendment 6.
Okay, I call Sandesh Gulhani to wind up, press or withdraw Amendment 24.
Thank you. We do support Amendment 6, and I will not be pressing Amendment 24.
Thank you. I think you'll have to withdraw. The member seeking to withdraw Amendment 24. Does any member object? For Amendment 24 is withdrawn. I call Amendment 6 in the name of Gillian Mackay. Already debated with Amendment 24. Gillian Mackay to move or not move?
Moved.
The question is that Amendment 6 be agreed to. Are we all agreed? Parliament is agreed. Takes us to Group 6. Call Amendment 25 in the name of Sandesh Gulhani. Group with Amendments 26, 27, 28, 33 and 37. Sandesh Gulhani to move Amendment 25 and speak to the other amendments in the group. Dr Gulhani.
Thank you, Deputy Presiding Officer. There are a number of amendments in this group. So, Amendment 25. So, before the offences in the bill can come into force, ministers must review the capacity of HIS to enforce them. And I think that is quite important because we want to make sure that we have the capacity available for the regulator to be able to do the work that it actually wants to be doing, and in the way as well that we would want it to be done. Amendment 26 in this group is to look at a review of his capacity and what it's done in its enforcement within 1 year of the bill coming into force. And Amendments 25, 33 and 37 is really for a review of the capacity of what we have for HIS. 37 provides the offences introduced in the bill cannot come into force until the review has been conducted, and 35 is consequential. That just allows for the review to be conducted.
Thank you, Dr Gulhani. I call Cara Mochan to speak to Amendment 27 and other members of the group. Ms Mochan.
Thank you. My own Amendment 27 seeks to add further detail and what a review of Part 1 of this bill should include. It comes from concerns around the support and guidance given to industry once the bill comes into force, and it touches on some of the points made in the last groupings. Amendment 27 states that a review of Part 1 should include an assessment of support provided to providers of non-surgical procedures, including those who are independent and non-medical. It would also require an assessment of the training opportunities available to assist providers to upskill, including qualification and accreditation pathways for practitioners, including those who are non-medical, and a review of the guidance provided in relation to minimum training and competence requirements. During stage 1 of the bill, the committee raised concerns about provision in remote and rural areas and financial costs to providers. Therefore, a review must also consider these points. At stage 2, the Scottish Government were widely supportive of the principles of this amendment. I recognise that Stuart McMillan's Amendment 28 shares a similar objective to my own and also outlines what a review of the bill should include. While I support Amendment 28, I would note that the amendment lacks detail of specifics, particularly when considering the support given to businesses and guidance given to the sector. Turning to other amendments in the group, I support Amendments 25, 26, 33 and 37 in the name of Sandesh Gohani. They seek to introduce proper checks and balances on the available capacity of HIS, who will be enforcing the bill. During stage 1, the committee had concerns about resources and enforcement challenges, as HIS is given new powers of enter, search and seize at unregistered premises. It therefore seems reasonable to ask that a review of HIS capacity is carried out, as enforcement is a large part of this bill. Thank you.
Thank you, Ms Mochan. I call on Stuart McMillan to speak to Amendment 28 and other amendments in the group. Mr McMillan.
Thank you, Presiding Officer. Presiding Officer, I brought forward section 15A at stage 2, but after discussion with the Minister, I would like to replace it with a more comprehensive amendment, which in essence covers what I actually want to establish. And I do want to thank the Minister for working with me on this amendment. Now, members have raised concerns about the lack of post-legislative scrutiny for many years, hence the reason why I lodged the amendment at stage 2 in the first place. But in the current section 15A of the bill places the duty on the Scottish Ministers to review the operation of Part 1 of the bill within 5 years of section 3 coming into force. In recognition of the concerns which persist around the impact of the bill on businesses, Amendment 28 places this section 15A with a new section providing more detail on how such a review should actually be carried out. Now, the 5-year period was chosen because the provisions of Section 3 in Part 1 will have been in place for a few years, and with a fast-changing sector and new procedures being developed quickly, a review after 5 years will provide the Scottish Government with an opportunity to actually reflect on the changes and also additions that are required to Schedule 1 and also Section 3. Therefore, the review must look at the inclusion of the types of procedures that are listed in Schedule 1 and the operation of Part 1. This will include an assessment of the impact on businesses, the enforcement of requirements of Part 1 and any other matters Ministers may think appropriate. This could include other matters raised by members that happen at stage 2. The Ministers can delegate the carrying out of the review and the subsequent preparation and publication of the report to another individual body if they consider that to be more appropriate. Whoever carries out the review, though, must consult Healthcare Improvement Scotland, the Chief Constable of the Police Service and any other person or organisation they consider appropriate. And also, Ministers must lay the report prepared before Parliament. I'm sure that we all want the same outcome, which is ensuring that procedures are performed as safely as possible. And this amendment will help to ensure the legislation can be updated quickly, if required, after any review. And I can see why Sandesh Gohani has introduced his amendments to the group, but I consider that my amendment actually covers his points, so I would ask members not to support them. I would urge members to support Amendment 28. Thank you.
Thank you, Mr McMillan. I call the Minister.
Thank you, Presiding Officer. I agreed at stage 2 it was important to put in place a review of the bill, so I thank Mr McMillan for Amendment 28. This strengthens his stage 2 amendment, which inserted section 15A. It provides for a broad review provision at a point at which it will be possible to fairly assess the bill's impact. Given the rapidly changing nature of this sector, Scottish Government will need to keep the procedures in Schedule 1 under review so it remains effective and proportionate. Amendment 28 will provide an opportunity to review how effective the Scottish Government has been in doing that. The amendment also requires an assessment and report by Scottish Government of the operation of Part 1 of the bill, in particular the impact on businesses and enforcement. I hope members will support this amendment. I am also grateful to Ms Mochan for Amendment 27 and for her support of the bill. Unfortunately, Amendments 27 and 28 cannot coexist. All of the matters raised by Ms Mochan should be part of any consideration on the impact of business, something which must be assessed in a review under Amendment 28. I also hope my response to the amendments in Group 5 reassures members and Ms Mochan, in particular, that support for business is at the forefront of the Scottish Government's mind. Amendments 25 and 26 from Sandesh Gohani address enforcement by Healthcare Improvement Scotland. I understand the concerns raised at stage 1 about HIS's capacity to enforce the requirements of the bill, and I know HIS themselves are live to these concerns. No legislative requirement is needed to ensure that HIS can implement and enforce the bill. The Scottish Government will work with HIS to ensure they can deliver what is required. That is critical, and I am happy to have the opportunity to repeat that, of course.
Sandesh Gohani.
If the Minister could reassure the Chamber that he have the required resources to be able to carry out what we have requested of them.
Minister.
I thank Sandesh Gohani for his intervention. As I have said, there will be an intense period of work between now and commencement, which involves working closely with HIS to ensure that they do have the right resources. Therefore, it would be counterproductive to put in place an additional review requirement during this period, and so I urge Dr Gohani not to press Amendment 25. I would also urge him not to press Amendment 26, because within the timescale included, it is unlikely that data will be available to assess the effectiveness of enforcement. This matter can be addressed in the review required by Section 15A. Amendments 33 and 37 are consequential to Amendment 25, and I urge Dr Gohani not to press them either. In particular, Amendment 37 means the main provisions of Part 1 of the Bill would not be able to come into force until a review of HIS's capacity was complete and laid before Parliament. This risks delaying implementation of the Bill and the safeguarding provisions of the offences, and could prevent work on regulations from being progressed. I urge members to support Amendment 28, but urge Ms Mochan and Dr Gohani not to press their amendments.
Thank you, Minister. I call on Sandesh Gohani to wind up and to press or withdraw Amendment 25.
Thank you. Press Amendment 25, and we are very supportive of the amendments in this group.
Thank you, Dr Gohani. The question is that Amendment 25 be agreed to. Are we all agreed? Yes. The Parliament is not agreed. There will be division, and members should cast their vote now. The vote is now closed. Thank you. The result of the vote on amendment number 25 in the name of Sandesh Gohani is yes 45, no 66. There were no abstentions. The amendment is therefore not agreed. I call Amendment 26 in the name of Sandesh Gohani. Already debated with Amendment 25. Sandesh Gohani to move or not move?
Not move.
Not moved. I call Amendment 27 in the name of Carol Mochan. Already debated with Amendment 25. Carol Mochan to move or not move?
Moved.
Moved. The question is that Amendment 27 be agreed to. Are we all agreed? Yes. The Parliament is not agreed. There will be a division, and members should cast their vote now. The vote is now closed. Thank you. The result of the vote on amendment number 27 in the name of Carol Mochan is yes 50, no 65. There were no abstentions. The amendment is therefore not agreed. I call Amendment 28 in the name of Stuart Macmillan. Already debated with Amendment 25. Stuart Macmillan to move or not move?
Moved.
Moved. The question is that Amendment 28 be agreed to. Are we all agreed? Yes. Are we all agreed? Yes. The Parliament is agreed, and therefore Amendment 28 is agreed to. I call Amendment 29 in the name of Ash Regan, already debated with Amendment 11. Ash Regan to move or not move?
Not moved.
Not moved. I call Amendment 30 in the name of Ash Regan, already debated with Amendment 11. Ash Regan to move or not move?
Not moved.
Not moved. I call Amendment 31 in the name of Sanjay Kohani, already debated with Amendment 16. Sanjay Kohani to move or not move?
Moved.
Moved. The question is that Amendment 31 be agreed to. Are we all agreed? Yes. The Parliament is not agreed. There will be a division. Members should cast their vote now. The vote is now closed. Thank you. The result of the vote on amendment number 31 in the name of Sanjay Kohani is yes 46, no 67. There were no abstentions. The amendment is therefore not agreed. I call Amendment 32 in the name of Sanjay Kohani, already debated with Amendment 16. Sanjay Kohani to move or not move?
Not moved.
Not moved. I call Amendment 33 in the name of Sanjay Kohani, already debated with Amendment 25. Sanjay Kohani to move or not move?
It's consequential, not moved.
Not moved. Okay, so we now turn to Group 7 on commencement. I call Amendment 34 in the name of Jeremy Balfour, grouped with Amendments 7, 35 and 36. And I call on Jeremy Balfour to move Amendment 34 and speak to other amendments of the group. Mr Balfour.
Thank you, Deputy Presiding Officer. Presiding Officer, I move Amendment 34. This is a small draft amendment intended to improve the clarity of Section 20. As the section is currently written, subsection 1 could potentially be read on its own without clear reference to subsection 3, even though the two provisions are meant to work together. The amendment simply inserts the words subject to subsection 3, so that it is clear that subsection 1 must be read alongside the conditions set out later in subsection 3. It does not change the policy of the bill. It is purely about making the relationship between these two provisions clearer on the face of the legislation, so that anyone interpreting or applying it can more easily understand how the section is intended to operate. In short, it's a straightforward clarification that improves the drafting and helps avoid any potential confusion. And I hope members will be able to support Amendment 34. Amendment 36, Presiding Officer, I move as well. The purpose of this amendment is to introduce an additional safeguard in relation to commencement of Section 1 to 14 of this bill. As members will be aware, having heard the debate this afternoon, these sections contain the core provisions establishing the new framework for the regulation of non-surgical cosmetic procedures, and they will play a central role in shaping how this system operates in practice. Given the significance of these provisions, it is important that necessary arrangements, guidance, regulatory structures are fully in place before these sections are brought into force. Effective regulation depends not only on what is written in legislation, but also whether the systems and structures need to be implemented if it is ready to operate. The amendment will therefore make clear that these regulations made under subsection 2 to commence sections 1 to 14 cannot take effect unless the conditions set out in the new subsection is satisfied. In practical terms, this links the commencement of those key provisions to the readiness of a wider regulatory framework, rather than simply allowing them to come into force on a date that may not reflect whether the system is fully prepared to operate. The intention here is not to delay the implementation of a bill or to create unnecessary barriers to progress it. Rather, it is to ensure that when the new regime comes in, it is going to be workable and enforceable. There is, I think, confusion amongst those within the business of how this will all work in practice, and it would be far better to get everything correct for people to understand what they are doing before these are implemented. And for that reason, Deputy Presiding Officer, I would ask that you would support, or the Chamber would support, Amendment 36.
Thank you, Mr Balfour. I call Brian Whittle to speak to Amendment 7 and other amendments in the group. Mr Whittle.
Thank you very much, Deputy Presiding Officer. There are a number of businesses currently operating without a Health Improvement Scotland licence, and this legislation will require that licence for certain procedures which was not previously required. The concern here is there will be an increase in applications which could create an application decision delay, forcing businesses to close for unknown extended periods of time while they await decision or maybe even cease trading altogether. Health Improvement Scotland said they will need more resources to enforce the bill. Eddie Doherty from his said, and I quote, "To be honest, it is currently quite a long way from being a self-financing process. The discussions with the Scottish Government about baseline funding will need to continue. They have the view that as the system expands, we are likely to require more money to meet the requirements." This amendment allows the commencement regulations made under 2020 to include transitional, transitory or saving provision. I did approach the Minister to see what could be done, as we've seen this before with the new regulations for PVG come into force and the summer demands for roles facing kids at camp or pre-hiring in schools. The Outpace Disclosure Scotland's service level agreement, which states that 90% of applications should be processed within 14 days. I'm glad we found common ground here, and the Minister agreed that my concerns raised a valid point and further noted from correspondence that she would not want to penalise any business that had done everything required of them to adhere to the new regulations. The approach we have settled on in this amendment allows transitional provision to be made in regulation alongside in advance of commencement of this bill. I do hope that the Minister is affirmative that this provision will be put in place if needed to ensure that businesses are able to trade without being criminalised if they have to apply for a licence. Presiding Officer.
Thank you, Mr Whittle. And I now call the Minister to speak to Amendment 35 and other amendments in the group. Minister.
Thank you, Presiding Officer. Although commencement of the bill is rightly a matter for ministers in the next Parliament, my intention is for the key provisions of this bill to be commenced on the 6th of September 2027, the day from which the licensing scheme for lower risk non-surgical procedures will also take effect. Businesses will have until that date to adjust to the requirements of the bill, and in that time preparations will be made for enforcement and implementation of the bill. I took on board Mr Balfour's concern that some businesses may be concerned that a future minister may bring forward the date for offences coming into force. I explained the reasons that this was unlikely. However, Amendment 35 in my name puts this beyond doubt by preventing the offence in Section 3 of providing a non-surgical procedure out with permitted premises from coming into force before that date. I recognise any earlier date may be unduly difficult for businesses, and any later would delay operation of the protections in this bill. I hope this provides assurances to Mr Balfour and that members will support this amendment. I urge Mr Balfour not to press Amendments 34 and 36, which would delay the commencement of offences in other parts of the bill for 24 months. This is too long a wait. I also cannot support provision that would stop the Government from using regulatory powers until then. The Scottish Government intends to progress work on regulations during this time, for instance, in relation to training or supervision. Mr Balfour is looking to support businesses, but it is in businesses' interests that work on other regulations can be progressed, for example under Section 5 of the bill, before offences come into force, to ensure businesses have advance notice of requirements. Amendment 7 in Brian Whittle's name raises the important point that the transitional provision in connection with the implementation of the bill may be needed. If many businesses register with Healthcare Improvement Scotland at the same time, there may be delays, and it would not be reasonable for businesses who were otherwise compliant to be forced to cease trading or be criminalised due to an administrative delay. I hope that this will not occur, but if it does, transitional provision may be required if applications are pending. It is therefore right that the commencement provision in Section 20 of the bill is adjusted to provide scope for this protection to be included in commencement regulations, and I thank Mr Whittle for working with me on this amendment. I ask Mr Balfour not to press Amendments 34 and 36, but urge members to support Amendment 35 in my name and Amendment 7 in Mr Whittle's name.
Thank you, Minister. And I call on Jeremy Balfour to wind up and to press or withdraw Amendment 34. Mr Balfour.
Thank you, Deputy Presiding Officer. I do welcome Brian Whittle's Amendment 7, and I hope the Chamber will support that. And I also do thank the Minister for picking up some of the concerns in Amendment 35. However, I still think there is real concern amongst those who are going forward with businesses at the moment. It's all very well to say we're going to talk to them and bring forward possible solutions, but they have to face decisions about whether they're going to renew leases, whether there's going to be worth putting money into new equipment, whether they're going to train new staff. And as it stands at the moment, they have no guarantee at all that they will be here in 12 months' time. And for that reason, I press the amendment.
Thank you, Mr Balfour. The question is that Amendment 34 be agreed to. Are we all agreed? No. The Parliament is not agreed. There will be a division and members should cast their vote now. The vote is now closed. Thank you. The result of the vote on Amendment number 34 in the name of Jeremy Balfour is yes, 6, no, 91. There were 17 abstentions. The amendment is therefore not agreed. I call Amendment 7 in the name of Brian Whittle, already debated with Amendment 34. Brian Whittle to move or not move?
Move, please.
Moved. The question is that Amendment 7 be agreed to. Are we all agreed? Yes. The Parliament is agreed, and therefore Amendment 7 is agreed to. I call Amendment 35 in the name of the Minister, already debated with Amendment 34. Minister to move formally. Moved. Thank you. The question is that Amendment 35 be agreed to. Are we all agreed? Yes. The Parliament is agreed, and therefore Amendment 35 is agreed to. I call Amendment 36 in the name of Jeremy Balfour, already debated with Amendment 34. Jeremy Balfour to move or not move? Moved. The question is that Amendment 36 be agreed to. Are we all agreed? The Parliament is not agreed. There will be a division, and members should cast their vote now. The vote is now closed. Thank you. The result of the vote on Amendment number 36 in the name of Jeremy Balfour is yes, 6, no, 106. There was one abstention. The amendment is therefore not agreed. I call Amendment 37 in the name of Sanjay Gohani, already debated with Amendment 25. Sanjay Gohani to move or not move?
Not moved.
Not moved. I call Amendment 8 in the name of the Minister, already debated with Amendment 1. Minister to move formally? Moved. Moved. The question is that Amendment 8 be agreed to. Are we all agreed? Yes. The Parliament is agreed. Amendment 8 is therefore agreed to. I call Amendment 9 in the name of the Minister, already debated with Amendment 1. Minister to move formally? Moved. Thank you. The question is that Amendment 9 be agreed to. Are we all agreed? Yes. The Parliament is agreed, and therefore Amendment 9 is agreed to, and that ends consideration of amendments. As members will be aware, the presiding officer is required under standing orders to decide whether or not, in her view, Any provision of a bill relates to a protected subject matter, that is, whether it modifies the electoral system and franchise for Scottish parliamentary elections. In the case of this bill, in the presiding officer's view, no provision of the Non-Surgical Procedures and Functions of Medical Reviewers Scotland Bill relates to a protected subject matter. Therefore, the bill does not require a supermajority to be passed at stage 3. The next item of business is a debate on motion 21100 in the name of Jenny Minto on the Non-Surgical Procedures and Functions of Medical Reviewers Scotland Bill. I would invite those members who would wish to speak in the debate to please press the request to speak buttons, and I call on Minister Jenny Minto to speak to and to move the motion. Up to 7 minutes, please.
Thank you, Presiding Officer. I am delighted to speak to the general principles of the Non-Surgical Procedures and Functions of Medical Reviewers Scotland Bill. This, I believe, is an important bill addressing important safety concerns. It is significant to those who will be impacted by it and by those who have already sadly been affected by the lack of regulation in the non-surgical procedures sector to date. I want to start by addressing Part 2 of the bill, which makes important amendments to the Certification of Death Scotland Act 2011. These amendments extend the right to request an interested person review and update the provisions on authorising cremations and hydrolysis in Scotland when a death has occurred elsewhere in the UK. These measures ensure relatives will have more opportunities to request a review whilst updating the requirements for authorising cremations and now hydrolysis, avoids duplication of these processes, reducing delays for families without undermining safeguards. In considering the remainder of the bill, I want to start by reminding us why this bill came about, just as I did at stage 1. Concerns about cosmetic procedures were first raised over a decade ago. The Scottish Government took steps, and in 2016 services provided by independent healthcare clinics, which included non-surgical procedures, came under the regulation of Healthcare Improvement Scotland. Since then, the non-surgical procedures sector has continued to grow. Many people have had positive experiences with responsible and caring practitioners, but as the sector has grown, so have the stories of people who have been harmed or injured. The regulation of independent clinics left a gap whereby non-clinical settings remained entirely unregulated in a minority of cases. This has had tragic results. Mr. Hamilton.
I'm very grateful to the Minister for giving way. She makes reference to those practitioners who go above and beyond in terms of the qualifications they seek out and the measures they put in place to safeguard the people in their care. I think they're still none the wiser as to whether this bill is going to put them out of business when it is finally implemented. I hope she will clarify to the Chamber in either her remarks now or in her closing remarks the intention of the Government to work with the sector to find a way through all of this so that when the next government implements it, it doesn't lead to the unnecessary loss of viable, high-quality businesses.
Minister. I thank Alec Cole-Hamilton for his intervention and would note again my disappointment that he hasn't engaged with me elsewhere prior to this with regards to this bill. I would like to thank members and their constituents who have tirelessly raised these issues with government. I hope to hear from some of those members this afternoon and that those constituents are watching our progress. Most of all, I hope this bill meets the challenge that they set out for us. I am also grateful to the members of the Health, Social Care and Support and the Delegated Powers and Law Reform and the Finance and Public Administration Committees who have given this bill careful consideration. Their recommendations were balanced and reflective of the need to protect public safety, while also ensuring that our approach is proportionate and balanced. Likewise, the contributions of members who put forward amendments or who have spoken to me over the last few weeks are very much appreciated. I would also like to put on record my thanks to the Bill team. Their determination and dedication to capture every detail required for this bill has been key to ensure the right balance has been struck. The bill will make procedures safer for everyone. It will ensure that all procedures take place in appropriate hygienic settings where healthcare professionals are involved in the provision or management of services and who can assist if there are complications. It will also make it an offence to provide procedures to a person who is under 18. This bill is complemented by the Civic Government Scotland Act 1982, Licensing of Non-Surgical Procedures Order 2026, which establishes a local authority licensing scheme for lower risk procedures. I recognise that it is not possible to bring regulations to a fast-growing sector without causing some disruption to the businesses who are already operating within it. This was raised clearly in the Stage 1 debate and has been raised with me well before that too. I want to assure members that I understand the impact of the bill. I have considered this carefully. In doing so, I have met with currently unregulated businesses and I've heard which aspects of our approach are most challenging. In explaining my approach to these concerns, I want to recall some of Carol Mochan's comments from Stage 1 debate. In her carefully considered contribution, Ms Mochan stated that introducing further restrictions is a necessary step towards improving patient safety. Many of the amendments today and previously at Stage 2 sought to amend the bill to mitigate the impact of some of the requirements introduced by the bill. I did not urge members to resist those amendments lightly because these amendments weakened aspects of the bill and that are necessary to achieve our public safety aims. Neither the provisions in this bill nor our plans for future regulation go as far as some members would like, nor restrict procedures by as many as our European or comparator countries. However, I was not prepared to endorse proposals that I did not think were absolutely necessary. As a result, I believe that the bill we are voting on today is a balanced one that will achieve public safety aims, especially the protection of under-18s while protecting the space for a thriving sector. And to Mr Cole-Hamilton's point, the journey towards a safe, regulated and thriving sector does not end with this bill. So I want to take this opportunity to set out what I think must come next. In particular, I want to set out how the Scottish Government should work with businesses in both the regulated and currently unregulated parts of the sector. Clear information is needed for all businesses. If the bill is successful today, officials will host a webinar for businesses before the start of the pre-election period to explain the bill as amended today and explain more about what it means. Further information, guidance and advice on seeking support will also be produced. I expect the Scottish Government to work with businesses and associated industry in setting training and qualification standards and in considering the requirements of HIS registration to ensure that there are no unnecessary hurdles for businesses. I do not know what the composition of the Parliament will be that oversees the implementation of the bill if passed, but I am sure that the Parliament will hold the Government to account on all of these matters. I would once again like to thank the committee, members, business owners, providers and clients whose input has helped to shape the legislation. I move the motion that Parliament agrees that the Non-Surgical Procedures and Functions of Medical Reviewers Scotland Bill will be passed.
Thank you, Minister. I now call on Sanjay Gohani to open on behalf of the Scottish Conservatives. Up to 6 minutes, please.
Thank you, Deputy Presiding Officer. And as far as the certification of death part of the bill is concerned, we are in agreement with it. And I begin with a declaration of interest that I'm a registered GP and I'm registered with the General Medical Council. At its core, this legislation is about one fundamental principle, and that is patient safety. And at the moment, in parts of the non-surgical cosmetics sector, that safety is far too inconsistent. To put it bluntly, in some areas, the situation resembles the Wild West. Yes, there are genuinely good businesses, but there are also shocking ones that perform botched surgeries. This would be unacceptable in absolutely any other area of healthcare, yet for far too long, that is effectively what we have allowed to develop here. The procedures we're discussing today are often presented as simple, routine beauty treatments, but in reality they involve needles, injections, prescription-only medications such as botulinum toxin and substances injected under the skin. When something goes wrong, the consequences are not trivial. They include permanent scarring, tissue damage, severe infection, psychological trauma, emergency hospital treatment. And when complications occur, it is the NHS, under immense pressure, that end up treating the patient. And it's also worth reminding the Chamber that botulinum toxin is derived from one of the most powerful biological toxins known to science. Used correctly, in the right hands and the right clinical setting, it can be administered safely. But the key words here are correctly and safely, and that means trained practitioners, appropriate clinical environments and proper safeguards. Yet at present, we know some procedures are carried out in settings that can never be described or considered acceptable anywhere else. We hear about fizz and filler parties where you can get your Botox and your fillers whilst drinking champagne. Treatments delivered from spare rooms in houses. Procedures performed in hotel rooms or pop-up settings with little clinical oversight. No one in this chamber thinks it would be acceptable to receive antibiotics or other medicines from someone who was not properly regulated, insured and working in safe clinical environments. So why is it we're accepting injectable cosmetic treatments to be treated so differently? And I want to be very clear about one point. There are many practitioners who work in the sector who take responsibilities extremely seriously. They operate from clean, sterile environments, follow proper consent procedures and understand how to recognise complications. And I have every sympathy with those practitioners. In fact, many of them support stronger regulation because they are frustrated at being undercut by individuals who complete a very short training course and immediately begin carrying out invasive procedures. Proper regulation should not be seen as an attack on the sector, but rather protecting the reputation of responsible businesses, creating a level playing field. Yes, regulations might bring additional costs, but the reality is that good practitioners are already meeting those high standards, and regulations are aimed at raising the floor. And it ensures that poor practice must not and cannot continue unchecked. Above all, this is about protecting patients. We also know there are cases where procedures go beyond cosmetic injections. There have been reports of practitioners removing moles or skin lesions without ensuring that those samples are properly examined. Now, this raises serious concerns about misdiagnosis, including skin cancer, because even as a GP who sees skin lesions all the time, I refer to dermatology lesions that I'm not sure about. And when we remove lesions, we send it to histology to ensure that what we think that lesion is actually is what it says it is, and it's not a cancer that we have missed. There is no safety here. And again, this is not a minor issue. It's a matter of potentially life-saving clinical practice. The truth is, we are a decade behind where we should be in regulating the sector, and the popularity of non-surgical cosmetic procedures has grown rapidly, but the regulatory framework has not kept pace. And this bill is therefore a very important and necessary step. It recognises that if a procedure pierces the skin, involves injectable substances or uses prescription-only medication, then the standards governing that practice must reflect the clinical risk involved. However, legislation on paper will only achieve its aim if it's properly implemented. If we are serious about regulation, and I am, then Health Improvement Scotland must have the resources necessary to enforce it effectively. Without that capacity, even the best written legislation will struggle to deliver what the patient requires and the protection we intend. Deputy Presiding Officer, this bill is not about restricting innovation or closing down responsible businesses. It's about bringing order to what has often resembled the Wild West. Thank you.
Thank you, Dr Kulhani. I now call on Carol Mochan to open on behalf of Scottish Labour. Up to 5 minutes, please.
Thank you, Presiding Officer. Scottish Labour's approach, as I've said, to this bill has always been to take the view that patient safety should be our #1 priority. It of course recognises that there are businesses operating in this sector who provide services in a very professional manner and within a very professional environment. And Scottish Labour does recognise this, but the non-surgical procedures industry currently operates largely unregulated and has been needing regulation for some time. The committee's Stage 1 evidence gathering heard of fizz and filler parties, and people being injected or given treatment in the back of taxis and sheds. Premises administering injectable procedures aren't currently regulated in a way that the public should really expect, and there is limited oversight of risk to consumers' safety and well-being. Right now, we rely on businesses to provide services in a safe and hygienic setting. But the reality is that these premises aren't regulated and we have no way of really identifying the good practices from the bad. This legislation would correct that. This is why Scottish Labour supports the regulation of the non-surgical procedures industry. By bringing the industry under the scope of HIS, we ensure that there is oversight and regulation of premises. The bill will not only strengthen standards across the sector, but will also strengthen accountability and safety. We are aware of the concerns raised by industry over the impact changes will have for business models and operations. This is why we supported amendments that seek a phased implementation and review of the operation and enforcement of the Act. We've supported amendments which ensure minimum training and qualification standards for those providing procedures while it comes into force, and we hope that we've supported amendments which are realistic and proportionate in the timeline. If this legislation passes, it is hoped that existing providers are able to adapt their practices to continue delivering their professional services, and I know the Minister is committed to this. It's important that future governments ensure that current providers of non-surgical procedures have good access to training and support with a sufficient adjustment period, and amendments across the Chamber have sought to ensure this. These procedures are not risk-free. We want to see fair and appropriate regulation to ensure the highest standards in patient safety. We also want to protect children and young people from both access to and the appeal of such services. I welcome the bill, which takes important steps to ensuring regulation, enforcement and accountability is brought into the sector. If this bill passes, the introduction of this legislation must be balanced with support, training and guidance for the industry ahead of implementation. And we do thank the cross-party working that has happened within this bill, and I close with that. Thank you, Presiding Officer.
Thank you, Ms Mochan. I now call on Gillian Mackay to open on behalf of the Scottish Greens. Up to 4 minutes, please.
Thanks, Deputy Presiding Officer. I'd like to begin by extending my thanks to the legislation team who, as always, have been incredibly helpful and responsive throughout stages 2 and 3. A special mention from me must go to Cleft Lip and Palate Action, who worked with me on my amendments at stage 2, and I know the bill is stronger as a result of their involvement. I'd also like to thank all of the constituents and business owners who shared their thoughts with me. I appreciate that we were often approaching the bill from different viewpoints, but it was incredibly useful for me to hear their position on particular amendments and how they would be affected so I could make a considered judgment. This bill, as others have said, will create a safer environment for everyone involved in non-surgical cosmetic procedures. It sets out what's required of businesses and practitioners and what consumers can expect in terms of safety standards. It's a vast improvement on the current situation, with Scotland being described as the worst country in Europe for unqualified practitioners injecting customers with cosmetic treatments. It will also protect children and young people by introducing a minimum age of 18 for people undergoing procedures. This is vital, as Advice Direct Scotland recently warned that children as young as 15 were seeking help following botched Botox treatments and dermal fillers. As I highlighted in my Stage 1 speech, the Royal College of Surgeons of Edinburgh warned that facial structures continue to develop into early adulthood, and starting these procedures from a young age can have long-term effects. Procedures such as dermal fillers and Botox too young can lead to muscle atrophy and tissue damage, and should rightfully only be available to those over the age of 18. It is right that the bill will instate a strict age limit, and I am pleased that we have cross-party agreement on that. Robust discussions have taken place at stages 2 and 3, with differing views on how to get the balance right between protecting consumers and supporting businesses. But I have always maintained throughout that patient safety must be the overriding concern. I believe the bill upholds that, and I am glad to see that attempts to weaken it haven't passed. There are some concerns that regulation could drive rogue practitioners underground, but we cannot use that as an excuse not to act. The bill is proportionate, fair and, I believe, represents a significant step towards eradicating unsafe practices in the cosmetic industry. We must ensure, though, that where businesses have provided these procedures with care, that we see engagement with them from the next government to ensure that they can continue to be supported. While the procedures covered by the bill may seem routine or non-invasive, complications can be severe. Just last year, the BBC reported that people who have cosmetic filler injections in their face should be warned of the risk of a dangerous complication involving blocked arteries that can lead to skin loss and even blindness due to damaged blood flow. Lead researcher on the study, Dr Rosa Sigrist, said that, although uncommon, such vascular occlusion events where the fillers injected into or too close to blood vessels can be devastating because they can cause tissue death and facial deformity if not treated. Cosmetic procedures should therefore not be undergone lightly, and it is essential that those performing them have the right skills, experience and, crucially, supervision. Given the dangers posed by some cosmetic procedures, we need robust, effective regulation, and I believe that this bill delivers that.
Thank you, Ms Mackay. I now call on Alex Cole-Hamilton to open on behalf of the Scottish Liberal Democrats. Up to 4 minutes, please.
Thank you, Presiding Officer. And can I start by clarifying that the Liberal Democrats have sought to engage with this bill. It's unfortunate that we couldn't make diaries align for me to meet directly with the Minister. I am grateful for her offer of that, and I will take that up if there's time before the dissolution of Parliament, and certainly work with whoever the Minister is in charge in the next Parliament to make sure this works for everyone. Presiding Officer, this bill brings forward important reforms that are necessary. Its intention is to strengthen public safety and, indeed, by so doing, improve confidence in the sector and in the regulation of non-surgical cosmetic procedures. We will support it at stage 3, but I do offer those same caveats that I did in the intervention to the Minister in my earlier remarks to Regan's amendments, that we can't plough on with this and see those high-quality businesses of professionals who have sought to get the maximum qualifications they can and deliver the highest quality of service they can. We can't see those sent to the wall. As we know, Part 1 of the bill addresses higher-risk procedures that pierce or penetrate the skin, including treatments such as dermafillers, botulinum toxin, thread lifts and deep chemical peels. These are often marketed as routine or low risk, but when they're carried out incorrectly or by those without adequate training, the harm can be serious, lifelong and deeply distressing. And for too long, regulation in this area has been fragmented and unclear. There's been no single framework setting out where these procedures can take place, who's qualified to perform them, and what minimum standards should apply in their administration. That lack of clarity benefits no one, neither patients nor responsible practitioners, and for those reasons, Scottish Liberal Democrats have supported the principle of regulation as this bill has progressed through this Parliament at every stage. The move towards a more risk-based and proportionate framework, including the distinction between higher risk and lower risk procedures, is, we believe, sensible, and likewise restricting higher risk procedures to appropriate premises with proper oversight, prohibiting procedures for under 18s and giving Healthcare Improvement Scotland inspection and enforcement powers are all important steps forward. However, I do want to reiterate that we still have those concerns about potential impacts this legislation could have on those trained practitioners who are currently operating safely and responsibly, practitioners who also want to see regulation, who want to see the bad actors removed from this field of work. And throughout the committee's scrutiny, we heard consistent evidence that many practitioners in this sector have invested heavily in training at massive personal costs for qualifications and professional standards under the existing system. Many of those, as I've said, support regulation because they want to see those bad actors removed and confidence strengthened, but there remains risk that if this system is implemented with the inflexibility we saw at stage 1, some of those responsible practitioners, many of them who are self-employed and in large part female-led sector, could find themselves regulated out of the profession altogether. I don't think any of us really want to see that. And I am gratified at the chink of light I think I've seen in the Minister's remarks that through regulation and the implementation phases of this bill, that her government will work with the sector towards a more rational implementation. That would not improve safety. It would simply remove skilled providers and risk pushing activity outside the regulated system. If we don't get this right, some of this is still going to happen, but in a more black market setting at higher risk. As the framework introduced by this bill is implemented, it will be so important for the government to engage closely with those practitioners. I'm glad we've heard some of that today, to keep it under review and to ensure that the regulations remain proportionate, workable and focused on patient safety. To conclude, Presiding Officer, Scottish Liberal Democrats will support the overall aim of improving safety and strengthening oversight, but with the caveats we offer to protect hard-working, well-qualified practitioners who just want to protect their businesses. Thank you.
Thank you, Mr Cole-Hamilton. We now move to the open debate. I call on Stuart McMillan up to 4 minutes, please.
Thank you, Presiding Officer. Presiding Officer, this bill is important as the sector it looks to regulate has grown vastly in recent years. And today, Parliament is being asked to support crucial legislation that helps provide many safeguards to protect consumers. And since the issue was first raised with me by my constituent Jill Best in 2018, I've been on a learning journey. I'm surprised by how lax regulations actually were for non-medics. And for those people who are trained medics and who are into the sector, the hoops to be jumped through from Healthcare Improvement Scotland were strict, and so they should have been. There clearly hasn't been a level playing field, though. This bill enables the state to catch up, and my amendment for a review after 5 years, which was passed at stage 2 and then also improved upon today with Amendment 28, provides the opportunity for future Scottish Governments to try and keep pace with an ever-changing and fast-changing industry. And this sector fundamentally is here to stay, so regulations are a must to safeguard consumers. I appreciate the bill. It will not be supported by everyone, and there are people who are non-medics who are highly trained, and the Minister was clear at stage 2 and also today as we discussed stage 3 amendments. But ultimately we need to guarantee a sector that will protect our constituents, and the importance of having a healthcare professional on site is absolutely compelling. Presiding Officer, I do want to conclude my remarks. I'm not going to take the full 4 minutes. I did speak in stage 1 and throughout this whole process. But I do want to thank both the Minister for her engagement and also my constituent, Jill Best, for raising the issue with me in the first place. Firstly, to the Minister, I appreciate the Ministers are bombarded daily with requests to help and also highlighting many things. But the fact that I've been raising this issue for almost 8 years shows that this issue wasn't going to go away. And clearly COVID-19 stopped any momentum, but the Minister was always willing to listen and engage, and I want to pay tribute to her for that. The round table hosted by Miles-Briggs was a turning point, in my opinion, and when the Minister and everyone else in the room heard first-hand how a botched treatment actually had affected someone. So, thank you, Minister. Thank you for listening, engaging and acting, and the sector and the wider public will be safer as a result. And secondly, to my constituent, Jill Best. I had never met Jill before until she got in touch with me to raise her concerns about this particular issue. And after then reading more about the issue and engaging with her further, I knew that she was a person passionate about the industry and also for sharing best practice. Jill's actions and campaigning have brought about this bill. Clearly others have helped greatly along the way, but I do want to pay tribute to her. It does show that any person in Scotland can help to change the law, and Jill's actions will ensure that that happens today. And I ask the Chamber to first of all thank Jill, thank the Minister, but also vote to support this bill this afternoon. Thank you very much.
Thank you, Mr McMillan. We now move to closing speeches, and I call on Cara Mochan to close on behalf of Scottish Labour. Up to 4 minutes, please.
Thank you, Presiding Officer. And can I thank all of those who have participated in this debate, all really cross-party working. And can I thank the clerks and the bill teams throughout. As I mentioned in my opening speech, Scottish Labour's approach to this bill has consistently prioritised patient safety. The growth in the non-surgical procedures industry has highlighted a worrying gap in essential regulation to protect both people and the providers delivering professional and safe services. This is an industry that is growing, and both the public and professional bodies want it to be reflected. The bill offers a chance to introduce national standards and expectations and will in the long term ensure that patient safety is prioritised. We want all services to be as safe as possible, and can I take this opportunity to put on the record again that we in Scottish Labour do recognise the good practice which currently exists in the sector. However, we currently have no way of identifying the good from the bad, and there are clear cases when hygiene and safety standards aren't being met, and this is why this bill is so important. This is a sector which has grown rapidly, and given that these services and procedures are so widely available and easily accessible, this legislation is welcome. It's not for us to determine how a person chooses to present themselves, but Parliament has a responsibility to ensure public safety is protected and that necessary safeguards and regulation are in place. This bill will create an offence for providing procedures to people under the age of 18, which is welcome and long overdue. We know that these procedures aren't suitable for young people and that they can have damaging and long-term consequences. This bill will improve accountability when things go wrong, and there is an opportunity to raise the public's awareness, which is important, and to educate people on the standards they should be looking for before undergoing procedures with associated risks. While we support the bill, we also recognise the reservations and concerns expressed by those in the industry who support regulation but are seeking reassurance over support and guidance. Scottish Labour has supported a number of amendments that seek a phased implementation and review of the operation and enforcement of the Act. We will continue to scrutinise the legislation in the sessions to come to ensure that its implementation and future regulations are balanced with support, training and guidance for the industry. Thank you, Presiding Officer.
Thank you, Ms Mochan. I now call on Brian Whittle to close on behalf of the Scottish Conservatives. Up to 4 minutes, please.
Thank you very much, Presiding Officer, and I rise to close this Stage 3 debate on the non-surgical procedures and functions of Medical Review of Scotland Bill on behalf of the Scottish Conservatives. This is a significant piece of legislation that seeks to bring much-needed order to two very different yet equally vital areas of Scottish life: the rapidly expanding aesthetics industry and the sensitive processes surrounding the certification of death. Turning first to Part 1 of the bill, we must acknowledge that Scotland's non-surgical sector is a genuine success story. It's a fast-growing industry, and notably one that is predominantly female-owned and led. That's something we should be celebrating in this chamber. However, for too long, the sector has operated in a regulatory vacuum. The absence of a robust framework does a disservice to many high-quality professional businesses operating across our communities. When untrained individuals are unlicensed products in unvetting settings, it doesn't just put the public at risk, it undermines the reputation of responsible professional providers who strive for excellence. The bill, working alongside Civic Government Scotland Act 1982, Licensing of Non-Surgical Procedures Order 2026, allows for a two-tiered approach proportionate to risk level. Low-risk procedures such as superficial chemical peels or microneedling at shallow depths can be regulated through premise-based licensing. Higher-risk procedures, including Botox, thread lifts and deeper chemical peels, rightly require a clear focus on competence and oversight of the individual administrating the treatment. While consumer safety is at the heart of the bill, applying regulation to an established and diverse industry for the first time is a complex challenge. We have to strike the right balance. If we move too fast or burden businesses with an excessive bureaucratic process, we risk creating a flawed system which can be exploited by unscrupulous operators or deter professionals from working in the sector. I have been clear throughout this process we need well-designed regulations that improve safety for customers without making compliance an impossible financial or administrative burden for reputable businesses. I think the Scottish Government needs to go further. They need to heed the warnings from the Federation of Small Businesses. In developing the regulations, there is more work to be done alongside small businesses, such as remote clinical oversight or a national accreditation pathway for trained non-medical practitioners. Small businesses are not short on solutions. They just need a government that's willing to listen. And if I've just turned briefly to Part 2, which amends the Certification of Death Scotland Act 2011, this is less contentious but deeply important section of the bill. And by expanding the types of medical certificates of cause of death that can be reviewed, we provide greater clarity and reassurance for grieving families. In closing, Presiding Officer, this bill is a step in the right direction. If we can get the regulations right, proportionate, workable and focused on safety, we can support innovation, protect customers and provide a solid foundation for the sector's future. Deputy Presiding Officer.
Thank you, Mr Whittle. And I now call on Minister Jenny Minto to wind up the debate on behalf of the Scottish Government. Up to 5 minutes, please.
Thank you, Presiding Officer. I want to close by thanking all colleagues in the Chamber for their constructive comments on Part 1 of the bill. I think Stuart McMillan is absolutely right. When you are confronted by someone that has been impacted by some procedure, then it does really highlight the change that has made to some people's lives. I too want to thank all MSPs who have engaged with me and the bill team. I welcome the comments on patient safety and the role of the right setting of delivering safe care. This was mentioned by everybody that spoke. It is crucial that procedures regulated by this bill are delivered in safe, hygienic settings where providers have support from healthcare professionals and access to emergency medications where required. This bill delivers those safe settings for all procedures. As Carol Mochan says, it will strengthen standards. I would very much like to thank Dr Gulhani's engagement on this bill. I have found it incredibly helpful and challenging, and I appreciate the suggestions and proposals that he has made throughout the work on this bill. I'd also like to thank Gillian Mackay for her comments and her wider engagement, specifically around cleft palate, and also her comments on under-18s. I'd also like to address the comments made by a number of people around the impact on businesses. I was clear in my opening statement that I do not take these impacts lightly, and I'm confident that the bill is necessary to protect public safety. Nevertheless, I expect the Scottish Government to continue working closely with businesses to mitigate the impact wherever possible. We're proposing to commence offences in the bill by September 2027, giving a good lead for all concerned and time for businesses to adapt. I'd like to highlight one very helpful meeting that I had recently, which was hosted by Davy Russell and also included some of Fulton McGregor's constituents. We discussed the impact of Regulation 12B of the Healthcare Improvement Scotland requirements as to independent healthcare services, Regulations 2011, which require that a suitably qualified healthcare professional will be working within the independent healthcare service while service users are present. This would include an independent clinic or independent hospital falling within the definition of permitted premises in Section 4 of the Bill. I've instructed officials to consider this requirement, particularly the requirement for healthcare professionals to be on site at all times in relation to businesses that offer a mix of procedures regulated by this Bill and other beauty treatments or licensable activities. And I hope Brian Whittle and Alec Cole-Hamilton will recognise that this is a government that is listening. Colin Beattie also talked about establishing a professional body for non-healthcare professional practitioners. As he commented, this isn't something that the Scottish Government can specifically do. However, we would be very happy to facilitate introductory discussions between the PSA and our representative group wishing to establish a register of practitioners with a view to accreditation in the future. I want to thank all members for their contributions. Intervention to regulate a growing and changing sector is not easy, and I have welcomed both the support and the constructive challenge I have received. I'm also grateful for the careful consideration that Part 2 of the bill received, even if it's not been the focus of today's debate. As the Minister for Public Health and Women's Health, public safety has been my absolute primary priority, and this bill delivers its public safety aims in a proportionate way. And again, I'm very thankful to Stuart McMillan and others who have regularly met with me to discuss the impact that this has had on their constituents. As I said in my opening speech, I believe that the bill we are voting on today is a balanced one that will achieve public safety aims, especially the protection of under-18s, as noted by Gillian Mackay and Carol Mochan, while protecting the space for a thriving sector. The bill has benefited from contributions across the Chamber, and I hope that members across the Chamber will join me in voting for it at decision time today. I urge Parliament to support the bill being passed into legislation.
Thank you, Minister. That concludes the debate on non-surgical procedures and functions of medical reviewers, Scotland Bill at Stage 3. It's now time to move on to the next item of business. And the next item of business is consideration of Business Motion 2110 in the name of Graham Day on behalf of the Parliamentary Bureau, setting out a timetable for the Stage 3 consideration of the Building Safety Levy Scotland Bill. I ask any member who wishes to speak to the motion to press the request to speak button, and I call on Graham Day to move the motion.
Move, Presiding Officer.
Thank you, Minister. No member is asked to speak against the motion. Therefore, the question is that motion 2110 be agreed. Are we all agreed? Parliament is agreed. Next item of business is Stage 3 proceedings for the Building Levy Scotland Bill. In dealing with the amendments, members should have the bill as amended at Stage 2. That is SP Bill 73A, the marshalled list and the grouping of amendments. The division bill will sound and proceedings will be suspended for around 5 minutes for the first division of the Stage 3. The period of voting for the first division will be 30 seconds. Thereafter, I will allow a voting period of 1 minute for the first division after a debate. Members who wish to speak in a debate on a group of amendments should press the request to speak buttons or place RTS in the chat function as soon as possible after the group has been called. Members should now refer to the marshalled list of amendments. And we come first to Group 1, application of levy exemption and reliefs. I call Amendment 6 in the name of Michael Mara. Group with Amendments 7, 8, 9, 10, 5, 15 and 18. Michael Mara to move Amendment 6 and speak to all other amendments in the group.
Thank you, Presiding Officer. I move the amendment in my name. Scotland has been in the grips of a housing emergency for years. Even the SNP government acknowledged that that was the case in May 2024, although it has to be said that nearly 2 years later, not much has changed. House building figures in December 2025 showed the number of new build starts and completions both falling, with social sector starts hitting their lowest point since records began, and affordable housing completions down 23%. And this all has very real consequences. Statistics published last month showed that the number of children living in temporary accommodation was also at a record high, 10,480 for the periods reported. The number of open homelessness applications was also a record high, and rough sleeping is at its worst point in 2 decades. And that is the context in which the SNP government is bringing forward this bill. The committee heard repeatedly in evidence taken at stage 1 about the potential for this levy to damage an already precarious house building sector in Scotland. The possible introduction of a levy with as yet unknown rates is deeply destabilising for a market which needs certainty to plan and make decisions for the long term. Across the sector, house builders are making decisions now about where to build and how much to build. They cannot do that with the uncertainty of a levy hanging over them. Can I put on record my thanks, Presiding Officer, to Homes for Scotland and others in the sector who have engaged constructively on this bill and supported the drafting of amendments, including some of my amendments this evening. My Amendment 6 gives a firm guarantee that any construction or conversion work begun before 1 April 2028 will not be subject to the levy. It seeks to give some certainty to the sector so they can get on and build now, rather than house builders choosing to sit it out for 2 years, waiting to see what a future government may or may not do. Appearing before the Finance and Public Administration Committee on 18 November 2025, the Minister stated that the commencement date for the levy will be deferred by 1 year to April 2028. I believe that this amendment can be agreed to in keeping with that commitment. The Minister did not support a similar amendment I lodged at stage 2. I hope that in the intervening period he will have reflected on the risks that the legislation could pose to Scotland's already fragile house building sector. Turning to the other amendments in the group, I recognise that Megan Gallagher's Amendment 7 has a similar intention to my Amendment 6. I look forward to hearing the debate, and if the Government is willing to support Megan Gallagher's amendment instead of my amendment, that is something I would also be willing to support. Michelle Thompson's amendments 8, 10 and 15 seek to exempt properties sold to first-time buyers from the levy. I trust that the member has met with the Minister since stage 2, and I hope the Government will be able to support these amendments. Liz Smith's amendments 9 and 18 would exempt historic listed buildings from the levy, and that's something that we on these benches would support. Finally, Ivan McKee's Amendment 5 requires ministers to lay a statutory instrument relating to reliefs before Parliament for approval. It is right that Parliament should have the chance to scrutinise those reliefs, so we will be supporting this amendment too. I move Amendment 6 in my name.
Thank you, Mr Mara. I now call Megan Gallagher to speak to Amendment 7 and other amendments in the group. Ms Gallagher.
Thank you, Presiding Officer. Amendment 7 is similar to the original one that I submitted at stage 2 of the bill and relates to transitional arrangements. The amendment exempts from the levy a new residential unit where a building warrant application has been submitted on or before the 1st of April 2028. In other words, where a development has progressed before that commencement date. This matches the established principle that regulatory treatment follows the rules in force at the time of a building warrant application and recognises the significant upfront investment and viability decisions taken without published levy rates. Home builders have been very clear in explaining that development does not simply start when the foundations are cut. There are years of planning processes as well as investment before buildings are constructed. The liability date, in my view, ignores the investment that the land deal, ground investigations, planning costs and professional fees for design have already been borne before the developer has started the building and well before that building is completed. Retrospective levy risks stalling delivery and hindering that much needed investment, and I'm certain that the Minister does not wish to see homes stalled, considering the next government needs to deliver at pace to tackle the housing emergency that Michael Mara has just outlined in his opening contribution. The Minister has agreed to provide 22 months' notice of rates from June this year, but there has been no consideration that developers will already have appraised and agreed land deals without taking into account that the levy will come into effect from April 2028. Homes for Scotland have been crystal clear on this. Without transitional arrangements in place, Homes for Scotland, or indeed the wider sector, cannot support the bill in principle. Can I also take the opportunity just at this point to thank them for their support and also their engagement throughout the passage of this bill. And it is for this reason that I am urging the Parliament to accept my Amendment 7 or Amendment 6 in the name of Michael Mara, because I do believe that both amendments attempt to resolve the outstanding issues, and I will leave my remarks there, Presiding Officer.
Thank you, Ms Gallagher. I now call Michelle Thompson to speak to Amendment 8 and other amendments in the group. Ms Thompson.
So I rise to talk to Amendments 8, 10 and 15 in regard to a crucial part of the residential housing market, namely first-time buyers. In Stage 2 I noted, I quote, and I stand by, the vital role of first-time buyers in keeping the housing market viable. They drive demand and create a ripple effect, free up homes for rent, support economic growth, support a balanced market and play into balancing sustainable communities. So given their importance, I hedged my bets and therefore laid 3 amendments. However, do not intend to move Amendments 8 or 10, but, Presiding Officer, I do move Amendment 15 in my name. This amendment, with the introduction of the word partial and being done through regulation, recognises the fact that the Minister's consistently stated the Scottish Government concerns around quantum. And I think it was helpful in Stage 2 to have on the record the fact that 22% of new build sales are to first-time buyers. Arguably, it could be more if the measures being undertaken by the Scottish Government come to fruition. My only final point is enabling, as a minimum, a partial relief is vitally important to developers, and particularly our SME developers who also play their part in enabling sustainable communities. We need to support them to have a continued focus on the first-time buyer market, and it's much easier for them to go for the step-up market as access to finance is easier and quicker, transactions are larger and margins are better. So I thank the Minister for his open-mindedness, flexibility and engagement in this matter.
Thank you. I call Liz Smith to speak to Amendment 9.
Thank you. As the Minister knows from Stage 2, I had concerns about whether the conversion of historic buildings would face specific unintended consequences as a result of the imposition of the levy, mainly because projects of that nature are not usually speculative. They tend to be a more expensive way of producing new homes, and most importantly, through the conversion of historic buildings into new homes, they deliver a wider public benefit, which the Parliament has obviously supported in other ways regarding the historic buildings issue. The Minister agreed at Stage 2 that the Parliament should seek to find ways to support such conversions, but he was concerned that there might be the possibility of a perverse incentive in the system for people to seek listed building status for buildings in order to avoid paying the Building Safety Levy. And yes, of course.
Paul Sweeney.
Thank the member for giving way on that point. I think it's important to note that Historic Environment of Scotland has very high thresholds for listing buildings and designations of buildings, and it would be unusual for them to grant such a status on a whim.
Liz Smith.
Yes, I understand that point, but I think just in relation to the engagement that we had at Stage 2, and particularly what the Parliament has said on some other issues relating to historic buildings, I was interested to tease out with the Minister where the specific issues might lie. The Minister agreed that we should meet to discuss this, and we did so on the 26th of February. And at the end of that meeting, the Minister said that he or his officials would come back to me prior to the deadline for lodging Stage 3 amendments. That never happened, Minister, so that's why I resubmitted these amendments in order to ensure that I'm satisfied by the Minister's intentions.
Thank you. And I call the Minister to speak to Amendment 5 and other amendments in the group.
Thank you, Presiding Officer. And can I start by thanking members for their engagement and scrutiny on the bill so far, particularly those who met with me in advance to discuss the proposed amendments. And I hope, as we had at Stage 2, we'll be able to continue to engage constructively today. On the first group, I invite all members to support my technical Amendment 5, which updates the provisions relating to the regulation making powers on reliefs to reflect the position agreed at Stage 2. Amendments 6 and 7 both seek to delay implementation of the levy, and as was the case when these amendments were brought at Stage 2, the Government cannot support these. I have already delayed the commencement of the levy to April 2028 and committed to publishing indicative dates in June of this year. This gives developers nearly 2 years advance certainty of their levy liabilities. In my view, is that this provides sufficient advance notice for developers to plan their affairs accordingly. I have, however, received representations from the Scottish Property Federation that some of the flexibilities we have built into the design of the tax will not affect developers of build-to-rent and purpose-built student accommodation in the same way as other parts of the tax base. And while I was not able to support Michelle Thompson's amendments at Stage 2 to put in place permanent payment flexibilities for these developer types, I am prepared to consider what payment flexibilities can be put in place during the first few years of the levy. The Government will therefore work with industry to consider the scope of any payment flexibilities and with Revenue Scotland to ensure any increased risk to revenue can be managed with appropriate safeguards. Amendments 8 and 10 seek to introduce an exemption for property sold to first-time buyers, while Amendment 15 seeks to deliver a similar effect via a relief to first-time buyers. As I set out at Stage 2, these amendments would be complex to administer, and there are also concerns with Amendments 8 and 10 in terms of drafting it. I'm glad to hear Michelle Thompson won't be pushing those. But following on from the engagement with Michelle Thompson on the bill, the Government will work with partners to consider and test a mechanism for providing relief to first-time buyers, and to that end I'm intending to support Amendment 15 as a vehicle to deliver this aim. Amendments 9 and 18 in the name of Liz Smith seek to introduce an exemption for heritage buildings, and as I set out when these amendments were brought forward at Stage 2, I'm sympathetic to the aim of protecting conversions, but the Government is unable to support the amendments as drafted. However, I'm happy to set out to Parliament my intention to consider a broader relief for conversions using the regulation making powers contained in Section 11 of the bill. And this would be in addition to the minimum 50% brownfield relief we already have included in the bill. The Government will consult with stakeholders on scope and definition of release for brownfield and for conversions as a whole, not just listed buildings, before bringing forward regulations to the next Parliament. I hope the member will support this commitment, and that's why I ask Liz Smith not to press her amendments. Thank you, Presiding Officer.
Thank you, and briefly Patrick Harvey.
Thank you, Presiding Officer. Very briefly, I would just like to express a little, well, is surprise too strong a word, at the number of members who seem to accept the construction industry's lobbying talking points as though they are unquestionable truth. The house building industry has a long history of treating every increase in taxation or regulation or building standards as though it is going to be the end of their industry, and it never plays out that way. I do think that the Minister honestly could have done a slightly stronger job at defending the principle of his own bill during Stage 2, and I hope he won't be accepting too many amendments at Stage 3.
Okay, call Michael Mara to wind up. Press to withdraw Amendment 6. Mr Mara.
I thank members for the debate. Thank you, Presiding Officer. I'm disappointed, I suppose, at the outset that the Minister hasn't recognised the context that we are addressing this bill in. No words at all for the scale of the housing emergency in Scotland. No recognition that any further intervention into the housing market has to be on the basis of that context, and we have to address it appropriately. Little should really be said about Patrick Harvey's parallel universe where none of this is actually happening at all, but the Minister should actually be able to bring forward, I think, a cogent analysis as to how this might impact, and I'm afraid that there is no basis to that. Yes, please.
John Mason, briefly.
I thank the member for giving way, but would you accept that this Parliament has been put in a bit of a corner by Westminster, that we've had to do a bill along these lines, which might not have been ideal?
Michael Mara.
I don't really accept that, no, because the reason that we are having to deliver we're looking to deliver, cladding improvements in Scotland. The rate-limiting step on this is not the availability of money at the moment. There's £100 million that came in Barnett consequentials to the Scottish Government, and only a tiny fraction of that has actually been spent. There are other issues that are preventing the government from perhaps making progress in that area. So the reality is that they've looked to realise a certain amount of money as an equivalent amount that has been raised in the rest of the UK. It did not have to be this approach. And I would say also to Mr Mason that the housing market in Scotland is different from other parts of the UK. I would have thought that he would wish to recognise that. He looks to see autonomy in almost every factor and moment. So there has to be a recognition that there is difference. Please, Michelle Thompson.
Michelle Thompson. But surely, I mean, just as a point of accuracy, I'm sure he would recognise that it's a complete nonsense to do it on population share to arrive at the figure of 30 million.
Michael Mara.
Certainly, I think that the government have pursued it on a completely nonsensical basis. You're correct. The basis that the £30 million is actually the Scottish Government's figure. It's nobody else's figure that's insisted that that has to be realised. In terms of looking to realise the quantum of £30 million on an annual basis, an accumulating figure, it's absolutely clear that that's the approach that the government has taken. I'll rest on that basis. Thank you.
Are you pressing?
And I press.
The question is that Amendment 6 be agreed to. Are we all agreed? Parliament is not agreed. There will be division, and as this is the first division of stage 3, suspend the proceedings for around 5 minutes to allow members to get on to the digital voting system. Okay, colleagues, the question is that Amendment 6 be agreed, and members should cast their votes now. And the vote's now closed. Point of order, Jackie Bailey.
I'm afraid my app wouldn't connect. I would have voted yes.
Thank you, Ms Bailey. I'll make sure that is recorded. Point of order, Fulton McGregor.
I couldn't connect, Presiding Officer. I voted no.
Thank you, Mr McGregor. I'll make sure that is recorded. And the result of the vote on Amendment 6 in the name of Michael Mara is yes 47, no 67. There were no abstentions. The amendment is therefore not agreed. Call Amendment 7 in the name of Megan Gallagher, already debated with Amendment 6. Megan Gallagher, to move or not move?
Moved.
The question is that Amendment 7 be agreed to. Are we all agreed? Yes. Parliament is not agreed. There will be a division and members should cast their votes now. And the vote is now closed. Daniel Johnson, point of order.
My app wouldn't refresh in time. I would have voted yes.
Thank you, Mr Johnson. I'll ensure that is recorded. And the result of the vote on Amendment 7 in the name of Megan Gallagher is yes 49, no 67. There were no abstentions. The amendment is therefore not agreed. Call Amendment 8 in the name of Michelle Thompson, already debated with Amendment 6. Michelle Thompson, to move or not move?
Not moved.
That is not moved. I call Amendment 9 in the name of Liz Smith, already debated with Amendment 6. Liz Smith, to move or not move?
Moved.
The question is that Amendment 9 be agreed to. Are we all agreed? Yes. Parliament is not agreed. There will be a division and members should cast their votes now. And the vote is now closed. And the result of the vote on Amendment 9 in the name of Liz Smith is yes 49, no 66. There were no abstentions. The amendment is therefore not agreed. Call Amendment 10 in the name of Michelle Thompson, already debated with Amendment 6. Michelle Thompson, to move or not move?
Not moved.
That is not moved. It takes us to Group 2, Assessments and Reporting. Call Amendment 11 in the name of Michael Mara, group with Amendments 14, 16, 17, 20 and 21. Michael Mara, to move Amendment 11 and speak to other amendments in the group. Mr Mara.
Thank you, President Officer. My amendments in this group would require the Scottish Government to arrange for an independent sensitivity analysis to be conducted prior to the publication of indicative rates. This is in line with the Finance Committee's recommendation in its Stage 1 report, which followed extensive engagement with the house building sector in Scotland, who are rightly concerned at what this levy could do to an already fragile market. Patrick Harvey's intervention earlier on, I think, said that he didn't believe that there was any evidence in the basis of the housing industry's intervention, so perhaps this will provide him with some data and evidence upon which he can base his opinions. I will not repeat much of what I said in Group 1 about the fragility of Scotland's house building market. It's well known to many of us and indeed many of our constituents, and not least the more than 10,000 children in temporary accommodation without a home to call their own. At Stage 2, the Minister took exception to the language around independent and competent expert in a previous version of this amendment, which has been updated in my Amendment 11 to allay his concerns. I hope members will see fit to support what I think is an eminently sensible amendment based in the work of the Finance Committee. I also speak in support of Mark Griffin's amendments, which would require the Government to assess and publish the likely impact of the levy on the housing emergency and on housing supply before it is implemented. Mark Griffin met the Minister recently to discuss these amendments. The Government argues that such assessments would be too complex given the fast-moving nature of the housing market. Well, we appreciate the Government's engagement. We do not accept the argument. If we are introducing a levy that may affect the delivery of new homes, we must understand its potential impact on housing supply during a housing emergency. Without that analysis, we cannot be confident that the policy will not have unintended consequences. The housing market is complex, but it is also one of the most heavily analysed sectors in the country. The Government regularly draws on such analysis in other areas of housing policy. That's why Mark Griffin's amendments link these assessments directly to the housing emergency and the all-tenure housing target. Their purpose is simple: to ensure that measures to fund remediation do not inadvertently undermine the delivery of new homes at a time when Scotland urgently needs them. I would urge all members to support all amendments in this group. And I move amendment in my name.
Thank you. I call Mark Griffin to speak to Amendment 16 and other amendments in the group. Mr Griffin.
Sorry, Presiding Officer. Michael Mara is moving the amendments on my behalf this afternoon.
Okay. There are no other members wishing to speak, so I'm going to call the Minister.
Thank you, Presiding Officer. Talking to Amendments 11 and 14 in the name of Michael Mara, as I set out at Stage 2 when similar amendments were brought forward, I'm sympathetic to the aim of ensuring the Government is properly assessing the impact of its policies. However, I have already committed to undertaking and publishing an updated impact assessment of the levy ahead of indicative rates being introduced in June. And this will include more detailed analysis of how the levy will interact with parts of the sector, such as rural house building and small developers. The bill already contains provisions for rigorous impact assessments, as well as the further assessments committed to later this year, plus the work that will be undertaken by the Scottish Fiscal Commission, which will deliver effectively what a further sensitivity analysis seeks: a forecasting approach to sensitivity analysis in practice, with central estimates, risk analysis and alternative economic scenarios as standard. Asking for more only duplicates what's already baked in, and additional tests only extend the paperwork without any more information or benefits. As with the amendments brought at Stage 2, there is an issue with the mention of an independent expert. It's still not clear how such a person would be identified, nor is it clear why the SSE's role as Scotland's independent fiscal forecaster isn't sufficient. Finally, I would alert Parliament that these amendments would subject the levy to some of, if not the most, rigorous reporting requirements across the entire UK tax system, despite it being one of the smallest taxes in revenue terms. It's for the same reasons that the Government is also unable to support Amendments 16, 17, 20 and 21 in the name of Mark Griffin. There would seem to be an assumption that the levy's effects can be isolated from other factors: interest rates, inflation, material costs, labour pressures, global factors and many others. Of course, it can't, and forcing analysis that ignores these macro factors produces subjective, contestable outputs and needless cost. Presiding Officer, I recognise the desire for continued assurance, but we've already provided it between two business impact impact assessments, a third to come, strengthening reporting in the bill, continuous monitoring and the Scottish Fiscal Commission's independent fiscal and economic forecasts. The Parliament already has a comprehensive and credible basis on which to scrutinise the levy now and in the future, and they have therefore asked Parliament not to support the amendments in this group. Thank you, Presiding Officer.
Thank you. And a call on Michael Mann to wind up. Press to withdraw Amendment 11.
Thank you, Presiding Officer. I think that the point of difference in this group really lands on the depth of the analysis that we're seeking, and also the fact that we're not looking for single national indicators, but something that has actually depth in different areas, so that we can understand the varied impact of the taxation in those different parts of the country. Frankly, I think on the basis of the Minister's defence, much of it's spurious, and on that basis I'll press the amendments.
Thank you. The question is that Amendment 11 be agreed. Are Parliament agreed? There's not agreement. There will be a division and members who cast their votes now. And the vote is now closed. The result of the vote on Amendment 11 in the name of Michael Mara is yes 46, no 67. There were no abstentions. The amendment is therefore not agreed. Takes us to Group 3, Rate of Levy. I call Amendment 12 in the name of Michael Mara. Group with Amendment 13. Michael Mara to move Amendment 12 and speak to both amendments.
Thank you, Presiding Officer. My amendments 12 and 13 seek to hold the Government to its commitment in relation to the 22-month period. I'm also keen to ensure a specific sequencing of events, which I think is absolutely critical. First, the independent sensitivity analysis should take place, and then the indicative rates should be published, because that pre-modelling is critical to the setting. Then, after at least 22 months have passed, the rates can come into force. Earlier contributions have covered the problems that would be associated with further cooling in an already sub-zero market. I think this process is sensible and is not clear enough as it stands in the legislation. These amendments are intended to give the sector as much certainty as possible. There are more than 10,000 children living in temporary accommodation. We must ensure that the bill will not have a negative impact on them getting the houses that they need. And I move amendment my name.
Thank you. And I call the Minister.
Officer, I note that Amendments 12 and 13 are identical to the amendments Michael Mara lodged at Stage 2, which were voted down by the committee. Taken together, these amendments would introduce new statutory requirements around rate publication and impact assessment before levy rates could be set. As I set out at Stage 2, I am not persuaded that a mandatory 22-month notice period or the well-established practice of setting devolved tax rates and bands at the Scottish Budget needs to be put on a statutory footing, nor am I persuaded that the levy needs to be subject to more stringent lane requirements than other devolved taxes, or indeed the UK Labour Government's Building Safety Levy in England. And neither the Finance and Public Administration Committee nor the Delegated Powers and Law Reform Committee recommend the statutory duties to publish indicative rates or to make analysis a formal precondition to setting rates. And for these reasons, we will be opposing these amendments. Thank you.
Thank you. Call Michael Mara to wind up. Press to withdraw Amendment 12. Mr Mara.
Thank you very much, Presiding Officer. I continue to support the premise of devolved taxation. I think that they should be appropriate to the situation in Scotland, and on that basis I will press the amendments in my name.
Thank you. The question is that Amendment 12 be agreed to. Are we all agreed? Yeah. Parliament's not agreed. There will be a division of members who cast their votes now. And the vote is closed. Point of order, Craig Hoy.
Apologies, Deputy Presiding Officer. My app's frozen. I would have voted yes.
Thank you, Mr Hoy. I will ensure that vote is recorded. And the result of the vote on Amendment 12 in the name of Michael Mara is yes 47, no 66. There was one abstention. The amendment is therefore not agreed. I call Amendment 13 in the name of Michael Mara. Already debated with Amendment 12. Michael Mara to move or not move?
Moved.
Question is that Amendment 13 be agreed to. Are we all agreed? No. Parliament's not agreed. The division of members should cast their votes now. And the vote is now closed. And the result of the vote on Amendment 13 in the name of Michael Mara is yes 49, no 66. There were no abstentions. The amendment is therefore not agreed. I call Amendment 14 in the name of Michael Mara. Already debated with Amendment 11. Michael Mara to move or not move?
Moved.
The question is Amendment 14 be agreed to. Are we all agreed? Yes. Parliament's not agreed. There will be a division of members who cast their votes now. And the vote is now closed. The result of the vote on Amendment 14 in the name of Michael Mara is yes 48, no 67. There were no abstentions. The amendment is therefore not agreed. I call Amendment 5 in the name of the Minister. Already debated with Amendment 6. Minister to move formally.
Moved.
The question is that Amendment 5 be agreed to. Are we all agreed? Yes. That is agreed. I call Amendment 15 in the name of Michelle Thompson. Already debated with Amendment 6. Michelle Thompson to move or not move?
Moved.
The question is that Amendment 15 be agreed to. Are we all agreed? Yes. Parliament is not agreed. There will be a division of members who cast their votes now. And the vote is now closed. The result of the vote on Amendment 15 in the name of Michelle Thompson is yes 108, no 7. There were no abstentions. The amendment is therefore agreed. It takes us to Group 4, levy-free allowances. I call Amendment 2 in the name of the Minister. Group with Amendment 3. Minister to move Amendment 2 and speak to both amendments in the group. Minister.
Presiding Officer, Amendments 2 and 3 in my name are minor technical amendments which do not affect the substance of Section 12 but ensure that the text of this section is updated in line with the non-government amendments passed at Stage 2. These amendments ensure that the 29-unit threshold for the levy-free allowance is enshrined in legislation while removing uncertainties caused by the duplication of definitions as currently set out in the bill. Thank you.
Thank you. No other members have asked to speak. I take it you're nothing further to add, Minister, and wind up?
No.
The question is, therefore, that Amendment 2 be agreed to. Are we all agreed? Yes. Parliament is agreed. I call Amendment 3 in the name of the Minister. Already debated with Amendment 2. Ministers move formally. The question is, Amendment 3 be agreed to. Are we all agreed? That takes us to Group 5, use of levy proceeds. Call Amendment 4 in the name of the Minister, in a group on its own. Minister to move and speak to Amendment 4. Minister.
Presiding Officer, Section 13 of the Bill sets out revenues from the levy must be used for the purposes of improving the safety of persons in or about buildings in Scotland. This wording aligns with the UK Government's England-only levy and aligns with the specific power devolved to the Scottish Parliament. And the Scottish Parliament has been clear from the outset that our specific intention within that power is to use the levy proceeds to fund the work of the cladding remediation programme. Stage 2 amendments were brought in the name of Liz Smith, which, if passed, would have narrowed the use of funds to specified sections of the Cladding Act. The Government could not support these amendments because of the way they were worded, but as I said in my remarks to committee, I was sympathetic to Liz Smith's intent to narrow the hypothecation of the levy in order to provide reassurance to industry. Amendment 4, my name, delivers on that commitment to bring forward a form of words which captures the intent of Liz Smith's Stage 2 amendment. In addition to the existing amendments on building safety improvements, this amendment ensures that funds must go towards cost of remediation, mitigation or prevention works in buildings with an external wall cladding system. This includes work undertaken as part of our single building assessments. So this amendment would require that levy funds are solely directed at the cladding remediation programme, while also ensuring that hypothecation captures the full scope of the programme's work. Well, this has always been the Government's intention. I hope that it delivers increased certainty to industry and further demonstrates the approach I have taken with this bill to constructively engage with and respond to issues that have been raised. Thank you, Presiding Officer.
You move the amendment. I call brief and contribution Patrick Harvey.
Thank you, Presiding Officer. I think the Government's position is that there is no chance, zero chance, that the levy will generate excess funds more than the cost of the remediation programme. I've got no reason to doubt that, and that being the case, I find it hard to see that there's a need or a real requirement to place this restriction on the face of the bill. If the levy is only going to raise a portion of the funds that need to be spent on the remediation programme, I think there are already significant restrictions in the bill. I don't see any requirement to have an additional restriction. If for some unforeseen reason the cost of the remediation programme were reduced and there were excess funds, then why not spend that excess money on other aspects of building safety that the industry itself hasn't chosen to pay for in the past? So I don't think it's a likely scenario, but I don't see a real reason to put an additional restriction on the face of the bill.
Minister, wind up.
No further comments.
The question is that Amendment 4 be agreed to. Are we all agreed? Yes. Parliament is not agreed. There will be a division of members who cast their votes now. The vote is now closed. Result of the vote on Amendment 4 in the name of the Minister is yes 106, no 7. There were no abstentions. The amendment is therefore agreed. I call Amendment 16 in the name of Mark Griffin, already debated with Amendment 11. Michael Mann to move or not move.
Thank you, President Officer. I rise to speak in support of Mark Griffin's amendment and also to move them at this point. These were lodged and debated.
I think you should have been speaking to them during the grouping.
Apologies.
You just need
jumping ahead.
You just need to move this.
And I shall. Moved.
You are not talking to the next group there, I think, Mr Marr. The question is that Amendment 16 be agreed to. Are we all agreed? Parliament's not agreed. There will be division of members. Should cast their votes now. And the vote's now closed. The result of the vote on Amendment 16 in the name of Mark Griffin is yes 49, no 66. There were no abstentions. The amendment is therefore not agreed. Call Amendment 17 in the name of Mark Griffin, already debated with Amendment 11. Michael Mara to just move or not move?
Just moved.
The question is that Amendment 17 be agreed to. Are we all agreed? Yes. Parliament's not agreed. There will be division of members who cast their votes now. And the vote is now closed. Point of order, Gillian Martin.
I wasn't able to connect this time. Would have voted no.
Thank you, Ms Martin. I'll make sure that is recorded. Result to the vote on Amendment 17 in the name of Mark Griffin is yes 46, no 67. There were no abstentions. The amendment is therefore not agreed. I call Amendment 18 in the name of Liz Smith, already debated with Amendment 6. Liz Smith, to move or not move?
Not moved.
That is not moved. Takes us to Group 6. On expiry, call Amendment 19 in the name of Mark Griffin. Group with Amendment 22. Michael Mara to move Amendment 19 and speak to both amendments in the group.
I'm sorry, President Officer, that the Government's enthusiasm for these amendments don't quite match my own, but I do rise to speak in support of Mark Griffin's amendments, and I move them at the same time. These were lodged and debated at stage 2, but were not pressed to vote at that stage in order to allow further engagement with the Government on the issue. The principle behind the amendments remains straightforward. The Government has accepted that the levy should be restrictive in nature by stipulating that the proceeds raised can be used only for specific purposes, namely the remediation of unsafe cladding. If the Government accepts that the scope of the levy must be restricted in that way, it follows that the duration of the levy should be limited to the required time to complete that work. However, I have real concerns that, contrary to the consultation findings and the Committee's recommendations, the bill would allow the levy to continue across successive governments long after its stated purpose has been fulfilled. That would risk undermining the purpose of the legislation and damaging confidence in the housing sector. In developing this amendment, Mark Griffin has worked closely with the Scottish Property Federation, which shares the concern that moving beyond the original 10-year framework risks mission creep. For those reasons, I believe it is appropriate Parliament has the opportunity to take a clear view on this issue. Having previously allowed time for engagement with the Government, Mark Griffin is now content for me to move these amendments and allow Parliament to vote on them. Thank you.
Thank you. I call the Minister.
Thank you, President Officer. At stage 2, the Government responded to the views of the committee and stakeholders and brought forward amendments, now section 51A, introducing a sunset clause into the bill. The period of 15 years is in line with the committee's recommendation in its stage 1 report and with the estimated lifetime of the cladding remediation programme. If Parliament and Government do nothing, then the levy will cease after the 15-year period. However, in recognition of the potential for unforeseen costs for the programme, ministers can take action by regulation to extend the lifetime of the levy, importantly subject to the affirmative procedure. Amendment 22 would curtail the levy to operate for only 10 years, which does not match with the Committee's recommendation nor the proposed lifespan of the cladding remediation programme. It would also remove the ability of future governments to provide for an extension subject to parliamentary approval. That would be a substantial departure from the UK Labour Government's approach to the building safety in England, which contains no sunset clause whatsoever. As at stage 2, I ask that members consider the implication of placing a greater share of the costs of this work onto the wider public purse of the levy is forced to end prematurely, with no regard to emerging data or to the cost of cladding remediation. Indeed, the combined effect of this amendment and Michael Mara's previous Amendment 6 would have been to reduce the period of taxable activity by around 7 years. At £30 million per annum, that's £210 million that the public purse would have to have had picked up, and neither Mark Griffin nor Michael Mara have put forward a credible plan for how that would be funded. So for those reasons, the Government is opposed to Amendments 19 and 22. Thank you.
Thank you. I call on Michael Mara to wind up, press or withdraw Amendment 19.
And nothing further to add. I'm happy to press.
Question is that Amendment 19 be agreed to. Are we all agreed?
Yes.
Parliament's not agreed. There will be a division and members should cast their votes now. And the vote is now closed. The result of the vote on Amendment 19 in the name of Mark Griffin is yes 50, no 66. There were no abstentions. The amendment is therefore not agreed. I call Amendment 20 in the name of Mark Griffin, already debated with Amendment 11. Michael Mara to move or not move? Moved. The question is that Amendment 20 be agreed to. Are we all agreed? Not agreed. There will be a division and members should cast their votes now. And the vote's closed. Result of the vote on Amendment 20 in the name of Mark Griffin is yes 49, no 66. There were no abstentions. The amendment is therefore not agreed. I call Amendment 21 in the name of Mark Griffin, already debated with Amendment 11. Michael Mara to move or not move?
Move 21.
Question is that Amendment 21 be agreed to. Are we all agreed? Parliament is not agreed. There will be a division and members should cast their votes now. And the vote's now closed. And the result of the vote on Amendment 21 in the name of Mark Griffin is yes 49, no 66. There were no abstentions. The amendment is therefore not agreed. Call Amendment 22 in the name of Mark Griffin, already debated with Amendment 19. Michael Mara to move or not move?
Not moved.
That is not moved, and that ends consideration of Stage 3. As members will be aware, the presiding officer is required under standing orders to decide whether or not, in her view, any of the provisions of the bill relate to a protected subject matter, that is, whether it modifies the electoral system and franchise for Scottish parliamentary elections. In the case of this bill, in the presiding officer's view, no provision of the Building Safety Levy Scotland Bill relates to a protected subject matter. Therefore, this bill does not require a supermajority to be passed at Stage 3. The next item of business is a debate on motion 21101 in the name of Ivan McKee on the Building Safety Levy Scotland Bill. I'd invite members wishing to participate in the debate to press the request to speak buttons, and I call on Ivan McKee to speak to and move the motion. Minister, around 7 minutes, please.
Thank you, Presiding Officer. I'd like to begin by thanking the Finance and Public Administration Committee for its scrutiny of the bill, and also to welcome the evidence and insights that have been provided by the Scottish Property Federation, Homes for Scotland and indeed developers themselves, both before and after the introduction of the bill. The committee's Stage 1 report provided no recommendation on the bill, and the report recognised the need for further funding, whilst raising concerns over the potential for the levy to depress house building figures, requiring a balance between revenue generation and impacts. To put this need for balance in context, I think it's helpful to set out the scale of the work we are undertaking. The cladding remediation programme will undertake work to address the estimated 1,260 to 1,450 residential buildings in Scotland, 11 metres or more in height, which require work to alleviate external wall system life safety fire risks. Following its pilot phase, where critical Scotland-specific issues relating to assessment and consent were addressed, the programme is now progressing building assessments at pace, with grant offers issued to 473 buildings by the end of 2025. Over the next few years, the programme will significantly ramp up its activity in both assessments and remediation, in line with our 2029 target for every high-risk residential building over 18 metres identified with unsafe cladding to have been resolved. Sure.
Michael Mara.
I just wonder whether the Minister can confirm for us how many building remediations have been completed and whether he is satisfied with the progress rate.
Minister.
Well, as the member will know, there was a significant amount of work had to be put in place before the work commenced, but as I've indicated, that work is now ramping up, and so will the funding requirement. In the first year of the levy's operation, the spending review has allocated £115 million to cladding remediation. The Scottish Government has rightly stepped in to marshal the necessary work to protect and repair Scotland's housing stock and to ensure it's properly funded, and I'm sure members across this Parliament will be supportive of that work. Undertaking this vitally important work comes at a sustained and significant cost to the public purse. The programme's costs are currently forecast to be between £1.7 billion and £3.1 billion over the expected 15-year lifetime of the programme. Faced with the need to ensure Scotland's public finances are sustainable, the Government is proposing through this bill that a contribution to these costs is made by the residential property development industry, just as the previous Conservative and current Labour governments have done in England. Over its 15-year lifespan, the levy will raise an estimated £450 million for the programme, meaning the levy will only form a contribution to the overall funding requirements. To those that have called for the levy not to be introduced, I think they would have to be honest about the consequences for future Scottish governments in terms of higher taxes borne by the general public, or less money for hospitals, schools, roads, or indeed less money for affordable housing. Presiding Officer, I've looked to ensure balance as far as possible and to ensure that any costs arising from the levy do not restrict the supply of house building. When introduced, the bill contained protections for those part of the sectors which could be most impacted, including exemptions for social and affordable housing, for island house building, and an annual levy-free allowance to protect Scotland's small and rural house builders. With thanks to views from members and stakeholders, the bill has been amended at Stage 2 to increase the levy-free allowance to 29 units, which will remove around 85% of developers from the scope of the levy entirely. This supports a healthier and more diverse house building sector. The universality of the allowance also ensures that medium-sized developers will see a sizeable share of their activity exempted, strengthening their capacity to invest in future projects, and the increase of the unit threshold to 29 units will also benefit development in rural areas, removing up to 89% of units from the levy in classes 4 and 6 of the urban-rural classifications, depending on developer behaviour. Also included in the bill at stage 2 is a duty for ministers to introduce a minimum 15% discount on brownfield development, which will ensure the additional costs of building on previously development land are taken into account. Moreover, the bill includes delegated power to allow for further exemptions and reliefs to ensure the levy maintains pace with an industry that is subject to a wide range of external factors. As I set out into stage 2 amendments, the Scottish Government will consult on proposals for a brownfield relief of at least 50% and a further relief for conversions. We will also use the opportunity of consultation to consider other support measures, such as payment flexibilities for build-to-rent or purpose-built student accommodation developments. Through further engagement with our industry partners, this Government is committed to getting that balance right. Ensuring the levy remains frictionless and fit for purpose requires reporting and reviewing mechanisms. That's why the bill contains provisions for reports on the operation of the levy at least every 3 years. The changes brought forward by the Government and agreed by the Committee at stage 2 mandate clear periodic reporting that ties spending directly to the cladding remediation programme, giving industry confidence in the operation of the levy. And the Parliament asked for stronger reporting provisions, and the Government heard that and acted, and I'm pleased that these amendments were approved. Presiding Officer, I note the concern that some stakeholders this bill is in contravention of the housing emergency. Our housing emergency action plan sets out that a safe, warm and affordable place to call home is central to a life of dignity and opportunity. Homes impacted by unsafe cladding cannot be said to meet this criteria, and as the revenues raised will be spent on efforts to rehabilitate existing stock, the levy is indeed intended to support the alleviation of the housing emergency rather than exacerbate it. Given the scale of the funding challenges and the need to minimise any disruption on house building, the levy is a small but necessary contribution to the remediation of Scotland's cladding-affected housing stock.
Paul Sweeney. Sorry, thank you.
Thank the Minister for giving way. I would like to just reiterate the point about concern of built heritage concerns. We already know that the VAT is a major impediment on development of derelict listed buildings. We know that business rates exemption relief being removed is another impediment. Can the Minister really take close note of how this could affect the viability and the conservation deficit faced by heritage building renovation projects?
Minister.
Absolutely, and the member obviously aware that VAT is the responsibility of the UK Labour Government, but in regards to the points he made, we're absolutely seized by the need to consider the impact on historic and indeed all conversions and indeed on brownfield, and that's why the reliefs that are in there are set at a minimum of 50%, and there is scope to increase those further than that. As I mentioned earlier, I asked that members consider the implications to public spending of the lifetime of the programme were this levy not to be agreed to, and remind them that there will be ample opportunities to review the levy's operation over its lifetime. So I move the motion in my name and urge members to vote to pass the bill. Thank you, Presiding Officer.
Thank you. And now call on Liz Smith.
Thank you. And, Presiding Officer, I want to say something that I said at the start of my stage 1 speech, and that is the fact that nobody could possibly doubt the very far-reaching implications of the most appalling human tragedy at Grenfell Tower in 2017, nor the importance of ensuring that nothing like that can ever happen again. So it is absolutely right that measures are put in place to improve building standards, especially so that the people who are engaged in the new build sector fully recognise and adhere to their responsibilities. And it's also right that there is a legislative process to ensure that for the future. However, the question that we as parliamentarians still continue to face is whether this bill, this levy, is the right procedure. And for Conservative members, and I suspect several members in other parties, there have been serious doubts. Not because improving building standards is not the right thing to do, but because the evidence that has been taken throughout from witnesses and stakeholders has expressed considerable concern, including the fact that far too much of the important detail could actually be left to secondary legislation. As colleagues know, the point was made in the Stage 1 debate that it is unusual for a committee not to fully endorse the general principles of a bill. However, on that occasion, it didn't endorse them, and that, I think, was for good reasons, because there was concern about the extent of the negative externalities. As the convener said at the time, the major issue was the likely impact on the housing market itself, which, as we all know, has already been facing significant challenges for the way that Michael Mara set out earlier. The most significant concern among witnesses and members of the committee was the fact that the bill could actually reduce house building capacity, because it would make certain sites unviable and therefore have a detrimental effect on the ability to deliver much needed affordable housing. Yes, of course.
John Mason.
I thank the member for giving way, but I think it was her Conservative government who actually brought the equivalent legislation in England, where presumably it would have a similar effect. Would it not have been better, really, if we just put a bit more on corporation tax?
Liz Smith.
The member is correct. It was the Conservative government, but I think the housing markets in south of the border and north of the border are completely different. And I think we have to look at it in the context, as I said earlier, of this particular proposed levy rather than what has happened elsewhere. I think that there are different but nonetheless related issues about the potential effects on rural Scotland, where a depopulation has already had significant problems. I was satisfied by the Minister moving to address these concerns via some amendments at Stage 2. But I think several factors do remain that make it a very, very complex issue for rural housing. House prices, as we know, are often particularly high in relation to local incomes in rural areas, and there's a shortage of housing that is suitable for families, which means, sadly, that too many families choose to move away. And, of course, the combination of that with the infrastructure concerns is something that I think is of considerable concern. There is likely to be a disproportionate effect on smaller developers. I don't think anything will convince me otherwise, and that's owing to the fact that they will... Yes.
Minister.
Given that 85% or more than 80% of developers won't pay, I think 85% of developers won't pay any levy at all, and that 89% of development in rural areas will be exempt, how does she square that with what she just said?
Liz Smith.
Well, I indicated to the Minister a little bit earlier that I was pleased with the amendments that we agreed at Stage 2, but there is another percentage there, which is a very rural setting, and I think the evidence that we took gives considerable concern, and that's something that worries me greatly about the rural dimension. I think when we sum up, Presiding Officer, I think the thing that bothers me most about this is that we have had a very extensive engagement about this bill, and I believe from the Finance Committee angle, I think there was a high percentage of concerns amongst the stakeholders providing evidence to us that were really pointing to the fact that this could have a detrimental impact on an already troubled housing market. And it's the uncertainty, I think, that many of them are pointing to. The fact that contracts for the purchase of land for development often happen years in advance, and that the uncertainty surrounding the effects of this bill are making things much more difficult. Now, they welcome the Scottish Government's decision to delay the implementation of the levy, but they are clearly pointing out that this doesn't solve the entire issue of uncertainty. Presiding Officer, no one likes to be paying more tax, least of all the building sector, but we continue to harbour concerns that the behavioural change which is likely to result from this particular levy will be harmful to a key sector which is tasked with infrastructure development and therefore with stimulating economic growth. Now, we acknowledge that the Minister listened to the concerns of the committee at Stage 1 and that he brought forward some helpful amendments at Stage 2, but for the Conservatives there are still deep-seated concerns. Thank you.
Thank you. And I now call on Michael Mara.
Thank you, Presiding Officer. On 4th September 2024, John Swinney said this: "Keeping residents and homeowners safe is our priority, and we are taking action to protect lives by ensuring that the assessment and remediation of buildings with potentially unsafe cladding is carried out." At that point, 7 years on from the Grenfell disaster, in which 72 of our fellow citizens perished, remediation had been completed on precisely 0 buildings in Scotland. Based on the latest statistics available from November 2025, and the Minister refused to demur from these statistics today, that figure still stands. 8 years and 9 months on, not a single building in Scotland has been completed. By contrast, in England, 1,938 buildings had been completed by November 2025. That is an utterly shameful record of incompetence from this government. But the reason that the work has not been completed on a single building in Scotland is not because we do not have a building safety levy. The Scottish Government had failed to spend even a fraction of the near £100 million provided by the UK Government for the purposes of cladding remediation. And the Scottish Government has now admitted that those funds intended for cladding remediation were used to fill other budget gaps across government. So it's up to the SNP Government to explain why it has taken so long to act, leaving people in Scotland at risk of fire and death in their own homes. And if we wound back the clock to the day after the Grenfell disaster on June 15, 2017, I don't think we could possibly imagine that we would be in this position as a country. There are specific structural differences in the housing and building sector in Scotland which make remediation challenging. That is without dispute. If the SNP wants to do something to speed the process up, then those are the areas where legislation could be brought and which we should be looking at as a Parliament. An additional tax on house building will not change any of that, none of it. Critically, this tax comes at the worst possible time. But Scotland is still in the grip of the SNP-made housing emergency, acknowledged by this government nearly 2 years ago, but frankly, precious little has been done about it since then. More than 10,000 children are still stuck in temporary accommodation. House building rates are at record lows. It's estimated this levy will add an additional £3,500 to the cost of building a new home. In evidence to the committee, house builders were clear that it will render house building anywhere outside Edinburgh and the Lothians unviable. That's the repercussions that nobody on the government benches, or the Green benches in particular, seem to be willing to tackle. And in an unprecedented step, as Liz Smith has said, the Finance Committee made, on that basis, no recommendation on the general principles of the bill. That gives a clear indication about the very serious misgivings that the committee had about the viability of the levy in its current form. And I'm sorry to say the bill has not been greatly improved by amendments at stage 2, or certainly today at stage 3, with the Minister refusing to support many sensible amendments which sought to analyse the levy's impact on the house building market and introduce exemptions in specific cases. The Minister has repeatedly failed to commit to the independent sensitivity analysis on local areas which the Finance Committee recommended and about which multiple members lodged amendments. That does not give confidence to Parliament, the sector, or the thousands of Scots without a home to call their own, that this SNP government takes seriously the mess it has made of Scotland's housing system and the further damage that this levy could do if it is not very carefully introduced.
Thank you. I now call on Patrick Harvey.
Thank you, Presiding Officer. I'd like to just begin with a wee reminder of why this bill is necessary. It's necessary to ensure that the house building industry collectively puts right the failures for which it is collectively responsible, because it can't be relied upon to do so itself. It would be fundamentally unjust if the failures of the house building industry all fell on the public purse to clear up. Now, are there other options than a levy to do it? Well, it might be satisfying. I'd certainly find it satisfying if we could go after the specific developers who've caused the most problem. But we all know that that's not realistic, because the most irresponsible of them will be long gone. It's possible that in principle an insurance scheme might work, but it would need to have been in place for many, many, many years in the past. It wouldn't be workable to introduce that now. So a levy is the option that's going to work, even if it wasn't for the case of trying to align with other UK nations. A levy is clearly a more effective way of doing it. And it does baffle me that some people are arguing that we need more and more rapid progress on the remediation programme, but we don't want the money from a levy in order to pay for it. This is the responsibility of the industry, and they have a responsibility to pay for it. A levy is a mechanism to ensure that that happens. Now, the housing emergency is undoubtedly something that we need to respond to. I'll make a little progress, and I'll let Mr Mara in a moment, because I'm responding specifically to some of his comments. The housing emergency should not be presented only as a numbers game. Numbers of new builds do matter, but so does quality. And as for the criticism of industry lobbying points that I made earlier, that was challenged by Michael Mara as though somehow he thinks the Greens don't get it. He seems to have forgotten that it was the Greens who took the boldest steps to address it in the rent freeze and the long-term rent controls, something that Labour figures like Andy Burnham and Sadiq Khan have long called for, because they recognise that the housing emergency goes far beyond Scotland and affects their constituents too. And that's clarity that has been sadly lacking from Scottish Labour's position. I give way.
Michael Mara.
Appreciate the member giving way. Would you recognise, though, that housing completions are at a record lows, the lowest level since records began, and that supply is absolutely critical to making sure that people have houses that they can buy or rent and, frankly, to live in?
Patrick Harvie.
And there are many reasons why there are challenges to improving and increasing that supply. But supply is not just about numbers, it is also about type. And we have far too much support, not just from opposition parties, but from the Scottish Government as well, for forms of house building which serve the interests of landowners and developers. Things like super-rich build-to-rent organisations that build properties that are going to be put out to rent at high end, at luxury end, when we should be building the affordable homes that we need. Presiding Officer, action on the housing emergency is needed, but whether it's on addressing rent levels on existing homes, or ensuring that we're building the right homes for the future, or indeed in fixing the house building industry's mess that it's already created and ensuring that they fit that bill, it needs the nerve to stand up to industry lobbyists, not the desire to cave into them. That's the kind of action that the housing emergency demands of us all.
Thank you. And I now call on Willie Rennie.
That contribution just shows why there are thousands, tens of thousands, if not hundreds of thousands of people across Scotland who are delighted that Patrick Harvie is no longer a housing minister in this government. He almost single-handedly starved Scotland of £3.4 billion of investment in housing. Everybody who wants a home should make sure that Patrick Harvie is never in government ever again. Now, of course, we need to remember where this came from, the appalling tragedy at Grenfell, but also now the anxiety that residents who are trapped in properties surrounded by cladding, dangerous cladding, now feel. And they feel incredibly anxious. I know many of them myself. And that's why I feel particularly strongly that this government has put us in this bind today, by introducing a bill that has been so flawed that they have had to introduce such extensive exemptions on numerous sectors that undermines the very bill that it's trying to introduce itself. Surely the Minister must understand that the sector sees this not in isolation, but as an accumulative impact on the sector, from the issues around about the housing emergency, from the home energy standards, the accessibility, all the various taxes and regulations, the problems with planning. All of that together creates an impact on the sector, which the Minister has referred to in his contribution earlier on, but seems to be blind to the impact that this bill is actually having on that impact. Yes, certainly.
Minister.
Rennie knows this, so I don't know why. I know why he's going down the track he's going down, but he knows this very well. First, of course, this is something that isn't unique to Scotland. It's happening across the rest of the UK. But the main point is, of course, if we weren't raising that money through the Building Safety Levy, which part of the Scottish Government's budget would he propose taking it from?
So Liz Smith was right. The housing sector in Scotland is different. The market is different. We've been starved of investment, and therefore we need to act incredibly sensitively over this next period. And I would have more sympathy for the government's position If it had powered on and used that £100 million sum of money that it had received from the UK Government to actually tackle some of the cladding issues that the homeowners are desperate to get resolved, yes, we'll take an intervention.
Mary McCallum.
Sorry, thank you. I thank Willie Rennie for taking the intervention. I think it's worth remembering in this debate that we are talking about a contribution to what could be billions of pounds of public money to rectify something and keep our residents safe. Surely that's something that members can understand is an important contribution to make. The other thing I wanted to just ask Willie Rennie is, does he appreciate that you can both foster confidence and investment, as we have been doing with record budgets, greater confidence, a delivery agency, clear exemptions to encourage investment? You can do all that, and you can work with developers to ensure that key issues of public safety are addressed, and I do hope that members can support that.
Willie Rennie.
Look, I understand some of the changes that have been made, and I've welcomed some of the changes that have been introduced, but it is still incredibly sensitive. We don't have the investment that the changes are designed to bring. We don't have that yet, and that's why acting carefully must be the first priority, and therefore that's why I would urge caution with the government. It shouldn't be charging ahead, because what the sector sees is a government that's more interested in taxing than it is actually on delivering the programme. And that's why, if the government had moved ahead and had spent that money and had resolved more of the properties that are desperate for resolution, then I may have more sympathy. I think I'm concluding, I'm afraid. I've only got 4 minutes. But that's why we won't be supporting the bill today. We think it's a cack-handed measure. It's something that is going to knock confidence in the sector, and that's why we will oppose it.
Thank you. We move to the open debate, and I call Michelle Thompson.
Thank you, Presiding Officer. I'll just start my short remarks by popping in with the intervention. I hope to get in on Willie Rennie, and I hope that he will be joining me in my calls for an adjustment to the fiscal framework to remove the quite ridiculous limits on the Scottish Government around capital and their ability to borrow, because we know it's a fundamental aspect of being able to increase our infrastructure. Presiding Officer, given the volume of legislation we have to get through this evening, I only intend to make a few brief remarks. And I think I join those members that state that the decision today we make or have made has real consequences for homeowners, for the housing market, I agree, and for the collective responsibility we bear to keep people safe in their homes, and that's the fundamental. And I've been heartened by the members across the chamber who have engaged so constructively, and even where there have been disagreements, we share a commitment to ensuring that homes in Scotland are safe, secure and fit for purpose. And it is a pity that this levy hasn't emerged from a Scottish policy design process. It has been foisted upon us by the UK Government decisions on building safety funding and the UK-wide levy framework. That said, whether we agree with the framework or not, Scotland must respond, because doing nothing risks leaving homeowners and local authorities without the mechanisms needed for remediation. And I agree that for many homeowners, the uncertainty that they've been required to live for must have been extremely difficult. So we can't lose sight of the human stories behind that, not just uncertainty, financial worry and a loss of confidence in what should be their safest space, their home. So, whatever disagreements about funding, with the need to complete remediation is unquestionable, and I fully accept it is going to cost billions over a multitude of years. I recognise, as part of my role in the committee and this debate, the concerns from members, developers and the wider housing sector. And I think it is fair to recognise that the current market faces rising costs, tightening supply chains, pressures on affordability, and therefore introducing a levy at this moment isn't ideal. And I think the government themselves recognise that. And I do recognise and accept that the government will monitor and mitigate any unintended consequences on supply and affordability. So to that end, I do thank again the Minister and the Government's acceptance of my Amendment 15. First-time buyers already face significant barriers, and it would have been unfair for this levy to create further obstacles. So I'm grateful to colleagues and the Minister for ensuring fairness is at the centre of this legislation. This Parliament didn't choose the circumstances surrounding the levy, but we can choose a responsible response. With safeguards secured and a commitment to monitoring impact, we can take a step that protects homeowners, advances cladding remediation and avoids, where possible, undue burdens on those entering the housing market. I'll therefore support the bill and urge all colleagues to do the same. Thank you.
Thank you very much. I now call on Michael Mara to wind up. Thank you.
Thank you very much, Presiding Officer. On these benches, we are unequivocal that the horrors of Grenfell must never be repeated. It is incumbent on governments across these islands to ensure that people have safe homes to live in, that lives are not needlessly lost through the neglect of government and of industry, who failed in their duties to the 72 residents of the Grenfell Tower. I think Patrick Harvie actually set out in this start of his contribution many things that I actually agree with in terms of where responsibility in those areas lie, in terms of the culpability around that, and we've had a public inquiry that's drawn the conclusions of that starkly. But I would have to say that to take that step further and then seek, in our own context, to demonise anybody who's involved in the building of houses as some kind of malignant force in Scotland, I think is a jump far too far. And I think I'll let him in 1 second. I think within that, there's the issue of some of the language that's been used around this bill, around a polluter pays principle. Because, of course, there are members of the house building industry in Scotland, small family firms, for instance, who have never built a building above 2 storeys, who have never taken on any of the projects that are involved in this, and who are worried that they will be affected by the general levy across the sector. So I think it's right that we try and make sure that we get the language of the specific Scottish sector correct in this regard. I'll take Mr Harvie.
Patrick Harvie.
I agree with him. We should be careful about our language. Now, I think suggesting that I've demonised anybody involved in the house building industry is a hyperbolic use of language, to be honest. But does he accept, even if he doesn't support this specific levy, does he support the principle that the house building industry needs to pay at least a significant portion of the cost of the remediation programme? And what alternative mechanism does he propose to ensure that they do so? Because they won't do it voluntarily.
Michael Mara.
Mr Harvie will be aware that there are already taxes placed, specific taxes in this area, on the house building industry. And the Minister is right in when he sets out that we have a challenge in funding the large gap between what the requirements in Scotland and what we require to raise, and we have to find vehicles to do that. I would say to Mr Harvie, I think that the nub of this debate today has been about whether, in the current circumstances of a housing emergency, which he has some culpability for, the mismatch between the need to actually raise that money and the vulnerability of a housing sector which is in a terrible state. An absolutely dreadful state. So we also have to make sure that within that we don't lose sight of the fact that there are 2 forms of social good within this. Yes, there is safety for people who are in high-rise buildings that require remediation, but there is social good in people having decent houses to live in as well. That children, over 10,000 children, a record number in Scotland, should not be living in a temporary accommodation. So we have to have a housing market that works. It's absolutely critical in that regard. So, and Ivan McKee's points in this area. I think it's slightly odd that the Minister seems to be incapable of understanding that we should have Scottish answers for Scottish problems. He's through stage 2 and stage 3. He's been very keen to talk about what the Labour government is doing elsewhere in this policy area. My job here, the job of this Scottish Parliament, is to come up with answers for Scotland that are specific to the Scottish challenges that we face. And that is the position that Scottish Labour takes in this instrument that we're looking at today. It's absolutely critical that we need to make sure that we do deliver the right resources to make sure that we can get this work done, and we have to do that timely. Yes, I'm happy to take the intervention.
Cabinet Secretary.
Thank you, Presiding Officer. I agree with Michael Mara that we have to find the right resources to do that, but with some that will apply to the public purse of billions of pounds, I can't understand why he doesn't see that this is a reasonable contribution to make, and I wonder how he will explain to the people he represents that he wasn't willing to vote for something that made sure that remediation could progress and alleviated the significant pressure on the public purse that the programme requires.
Michael Mara.
I would say to the Minister, quite gently if I can, that there's £100 million that came to the Scottish Government to actually spend on remediation programmes. The Government has not applied that to remediation. They have spread it across other parts of their budget to fill the gaps and holes in that regard. The management of the capital programme in this country has been a disaster for years, and frankly they should reflect on that. And on that basis, Presiding Officer, I close.
Thank you. I now call on Megan Gallagher.
Thank you, Presiding Officer. When we first debated the Building Safety Levy Scotland Bill, I said that I would not support legislation that risks further damaging Scotland's housing sector. Stage 2 and Stage 3 today was the chance to fix this bill. That opportunity was missed, and the Scottish Government, in my view, has not engaged in the way that it should have done constructively with all parties regarding issues that have not just been raised from sectors, but in terms of house builders and homeowners who have been impacted by cladding. And as a result, the Scottish Conservatives will not support it at decision time. Building safety is not optional. We all agree on that, and we all do recognise the tragedy of Grenfell and why remediation is required on all affected buildings. But the real question is this: is this bill the right way to fund cladding remediation, or is it yet another knee-jerk response from a government that has failed to act with pace and properly? In my view, it is the latter. And the issues that Michael Mara raised demonstrates why we are so far behind the rest of the United Kingdom. £100 million used to fill other budget gaps. That's utterly shameful. And he's right. This has nothing to do with a proposed new levy. It shows the Scottish Government's own incompetence. I think I've got two interventions. I think Ben McPherson was first, so I'll let him in first.
I thank Megan Gallagher for taking the intervention, and on behalf of many of my constituents who have been affected by the challenges with cladding remediation, does she, on behalf of her party, take any responsibility for the fact that her UK government at the time was so unresponsive and unconsiderate about the fact that Scotland had a different property law system, and that this caused significant delay in remediation here in Scotland?
Megan Gallagher.
I genuinely believe that Ben McPherson's own constituents would wonder why his government has refused to spend a penny of the £100 million that was meant to be used for cladding remediation and didn't. So I think Ben McPherson should reflect on that. Another point that I want to raise is Willie Rennie, because he spoke about the intense pressure of our housing sector and how they are feeling at the minute. When the Minister raises what should be cut to fund remediation of cladding, Willie Rennie is right. We need to tread carefully. We need to build the confidence with the sector, and we need to secure that investment and use the £100 million that should have been used in the first place to kick-start the cladding remediation. This is what the Scottish Government should have been doing years ago and has failed to do it. Homes for Scotland and the Scottish Property Federation have repeatedly warned that this levy will not simply be absorbed. It will hit viability, it will stall projects, and it will reduce the number of homes that could potentially be built, all whilst we're in the middle of a housing emergency. Why would this government risk fewer homes built, fewer affordable homes at that, and fewer jobs across the construction sector? During scrutiny at Stage 2 and Stage 3, Michael Mara and I proposed what I believe to be sensible, targeted amendments to protect projects already underway that reflected a simple, established principle. Developments should be judged by the rules in place when they begin, not hit with new costs after significant investment has already been committed. Those amendments have been rejected, and in doing so, the Scottish Government has ignored industry warnings and chose not to mitigate the very risks it has been repeatedly warned about. And we've seen this before, particularly when it comes to housing. The same mistakes, the same refusal to listen, and yet the same consequences. Presiding Officer, talking about lack of progress, I previously raised concerns about conflicting letters sent to homeowners affected by cladding. I have now received a response from the Cabinet Secretary for Housing, of which I am thankful for, confirming that there was indeed a disparity. Yet the Government claims that these letters do not guarantee funding. But that's not how the two letters that I have in front of me right now read. One implies certainty, The other creates doubt. That's two different messages, no clarity, and it's homeowners who are paying the price. People are stuck, unable to sell, unable to move on. Properties sit on the market for months, offers fall through, buyers walk away, not because they want to, but because they cannot risk the uncertainty. Who can blame them? There is no guarantee that remediation costs will be covered, only confusion, concern, and that looming question of personal liability. So what does this bill deliver? It's a levy that will slow development, a policy that will reduce housing supply. I think I'm in my last minute, Cabinet Secretary. I'm in my last minute. Apologies, because I would have taken it. A policy that would reduce housing supply, and a government pressing ahead despite clear warnings from the very sector it depends on. At a time when Scotland faces a housing emergency, this, in my view, is the wrong policy at the wrong time. And for all of those reasons, we cannot support the bill at decision time.
Thank you. I now call on the Minister to wind up.
Thank you, Presiding Officer. And at the outset, I think it's important that, as many members have done, we reflect on the tragedy of Grenfell as the reason why we find ourselves in a position to take forward this remediation work in the lives that were sadly lost at that time. Presiding Officer, there has been a range of views expressed throughout the consideration of this bill. However, I believe there is consensus amongst us that members on all sides of the chamber are committed to safeguarding homeowners and residents from the dangers that unsafe cladding poses, and that members agree it is right for this government to take action through the cladding remediation programme to safeguard homeowners in and residents of buildings with potentially unsafe cladding, and to ensure that an event like Grenfell is never allowed to happen again. And as the programme ramps up its pace, the conversation, of course, must turn to how we fairly fund this vital work. Based on the programme cost estimates, it is clear that the Scottish budget will bear the brunt of this cost over the lifespan of the programme. And given the scale of efforts needed to rehabilitate Scotland's housing stock, this government believes it is right that the residential property development industry provides a contribution to this work. This view, of course, is also shared by the UK Labour Government, the previous UK Conservative Government, in light of the England-only Building Safety Levy commencing operation in October of this year. As I said in my opening speech, the challenge in implementing a levy to help fund the programme is one of balance. How do we secure the necessary funding while ensuring the levy operates as frictionless as possible across the house building industry? And this has been the crux of the debate on the bill, and I am very grateful for the contributions by members from all parties on getting this balance right. The Government has listened and moved in line with a range of recommendations from the Chamber. Members asked for a sunset clause, and the Government has delivered that. Members asked for a closer link between the use of funds and the cladding programme, and that has been delivered to give certainty to the industry as to where the funds would be spent. Members asked for stronger reporting requirements. The Government has delivered that. And as I said in the opening, I am pleased that the Government and Parliament worked together in that way to strengthen the bill. The Government has taken forward measures to increase the levy-free allowance to 29 units, exempting 85% of developers from engaging at all with the levy, and indeed 89% of development in rural areas will not have to pay the levy. We have taken forward the business impact assessments. We have been indicated flexibility on build-to-rent and purpose-built student accommodation in the initial period. We have today included amendments to give relief, the potential for relief to first-time buyers. And of course, we have already delayed the implementation of the bill from 2027 to 2028. As indicated earlier, that's almost 2 years later than the equivalent levy being implemented in England. So I say we take considerable steps from listening to industry and listening to others to make reflect on their concerns, to make the bill reflective of the issues that industry and other stakeholders have raised with us. And the evidence and response gathered by the committee alongside our own, informed by 2 public consultations, has been very helpful, and I am grateful to the committee and MSP colleagues for this engagement. Presiding Officer, as I said in my opening speech, there is no free lunch when it comes to funding this vital work. The funding of this levy, or the absence of this levy, would mean either higher taxes to the general public or cuts to public spending, which paradoxically would impact potentially on our affordable housing programme, something I'm sure members would not want to see. That does not feel fair or appropriate in the eyes of this government or, I would expect, members of the public. So I believe that this bill provides a strong fiscal measure to support the delivery of our cladding remediation programme, while also containing the appropriate safeguards to give confidence to our house builders. And I commend the motion in my name and very much hope that members will vote for this bill at stage 3 tonight. Thank you, Presiding Officer.
Thank you. That concludes the debate on the Building Safety Levy Scotland Bill at stage 3. It's now time to move on to the next item of business, which is stage 3 proceedings for the Assisted Dying for Terminally Ill Adults Scotland Bill. In dealing with the amendments, members should have the bill as amended at stage 3. That is Scottish Parliament Bill 46B, the second marshalled list and the groupings of amendments. The division bell will sound and proceedings will be suspended for around 5 minutes for the first division of stage 3. And that period of voting for the first division will be 30 seconds, and thereafter I will allow a voting period of 1 minute for the first division after a debate. Members who wish to speak in the debate on any group of amendments should press their request to speak buttons or enter RTS in the chat as soon as possible after the group is called. Members should now refer to the marshalled list of amendments, minor and technical. I call Amendment 1 in the name of Liam MacArthur, grouped with Amendments 2, 3, 4 and 5. Liam MacArthur to move Amendment 1 and speak to all amendments in the group.
Thank you, Presiding Officer. I've lodged these 5 amendments under Standing Order Rule 9.8.5d to address technical drafting issues in some amendments passed by the Parliament last week, so as to ensure they can work as intended, respecting the will of Parliament at stage 3 and ensuring the integrity of the statute book should the bill be passed later this evening. Ahead of lodging, I informed the members who lodged the original amendments, Bob Doris, Jackie Bailey, Daniel Johnson and Paul O'Kane, as well as the Scottish Government. I also provided a note explaining the purpose and effect of the amendments. That was circulated with the daily list yesterday, which I hope members have found helpful. Amendment 1 ensures consistency relating to Section 7.1a. Section 7.1a, added by Bob Doris's Amendment 160, defines indirect pressures for the purposes of subsection 1ZD. However, subsection 1ZA and subsection 3 also refer to indirect pressures and should therefore also be covered by subsection 1A. This amendment ensures that is the case. Amendments 2 and 3 correct cross-referencing in sections 7.8 and 7.9 of the bill as amended, as a result of Parliament agreeing amendments 165 and 168 in the name of Bob Doris. As drafted, amendments 167 and 168 both referred to subsection 3, which was the number given to new subsections in amendments 165 and 166, which were intended to be related to 167 and 168. However, subsection 7.3 in the bill as amended is an unrelated provision and is not the intended provision for referral in subsections 8 and 9. The intended cross-referencing for the bill as amended in stage 3 therefore needs to be corrected. These 2 amendments therefore ensure that both subsections 8 and 9 refer as intended to both subsections 6 and 7, the policy effect being, as Parliament intended, that where a terminally ill adult declines to take up a palliative care appointment, they are not prevented from receiving assistance to end their own life, but that not taking up an appointment can also be taken into account by assessing doctors when deciding on making a statement under sections 8.1 or 8.2. Amendment 4 corrects an error in Amendment 195 brought by Daniel Johnson, which referred to accompanying statements made under Section 8.3c, when under Amendment 183 accompanying statements are made under Section 8.3d. Finally, Amendment 5 addresses an inconsistency in Section 28.3bc, which was inserted by Jackie Bailey's Amendment 129. 28.3bc refers to Section 22b. However, paragraphs in section 28.3 should specify which subsection the actual regulation powers, the regulation-making powers, is in. This amendment therefore amends the reference to make it specific to section 22b(5), the subsection which contains the regulation-making power. And I ask Parliament to support these technical amendments and move Amendment 1 in my name.
Thank you. I call on the Cabinet Secretary, the Minister.
Extremely briefly, Presiding Officer, just to state that Amendments 1 to 5 would appear to be necessary technical amendments to correct some of the cross-references within the bill as amended at stage 3.
Ask Liam MacArthur if he wishes to wind up.
Nothing further to add, just to press.
Thank you. The question is that Amendment 1 be agreed to. Are we all agreed? We are agreed. I call amendments 2, 3, 4 and 5, all in the name of Liam MacArthur and all previously debated with Amendment 1. And I invite Liam MacArthur to move amendments 2 to 5 on block.
Moves on block.
Does any member object to a single question being put on amendments 2 to 5? The question there is that amendments 2 to 5 are agreed to. Are we all agreed? We are agreed, and that ends consideration of amendments. And as members will be aware, I am required under standing orders to decide whether or not, in my view, any provision of a bill relates to a protected subject matter. That is, whether it modifies the electoral system and franchise for Scottish parliamentary elections. And in the case of this bill, in my view, no provision of the Assisted Dying for Terminally Ill Adult Scotland Bill relates to a protected subject matter. Therefore, the bill does not require a supermajority to be passed at stage 3. Our next item of business is a debate on motion 21005 in the name of Liam MacArthur on the Assisted Dying for Terminally Ill Adults Scotland Bill at stage 3. I'd be grateful if members who wish to take part in the debate were to press their request to speak buttons. And I call on Liam MacArthur, the member in charge, to speak to and move the motion.
Thank you, Presiding Officer. This is a significant moment for the Parliament, so let me start by acknowledging some of those who played their part in getting us to this point. NGBU, who, like colleagues in the legislation team, are unsung heroes of this institution. To my own team, Amanda, Niamh, Ashley, and before them George, Peter and Jack, who've had my back throughout. Dignity in Dying, Friends at the End and Human Society Scotland, who have run the most amazing campaign while also supporting me directly, and I remind the Chamber of my declaration of interest. Those who responded in record numbers to my original consultation, many with the personal stories of dying Scots that I firmly believe must be at the forefront of our minds as we come to vote this evening, and are represented in the gallery this evening. The stakeholders who have engaged with me while also supporting the scrutiny process with evidence to our Health Committee, which carried out its responsibilities superbly. And colleagues across the Chamber who have given time to have conversations with me over the last 5 years and who, regardless of their position on this bill, engage seriously and respectfully. It's often said that Parliament is at its best when it speaks with one voice. I believe it's at its very best if it can come together when debating an issue upon which there is profound disagreement, and I commend colleagues for rising to that challenge. For me, this has been exemplified by the amending stages of this bill. Of the 175 amendments agreed by Parliament last week, half came from members who I fully expect to oppose the bill at decision time. This speaks to a determination amongst colleagues across the board to ensure that this bill, if it's passed, is the best it can be. In drafting the bill, I drew on international experience to ensure it was tightly drawn, heavily safeguarded and balanced the need for choice with protections patients, medics and the public rightly expect. Quite properly, at the Health Committee and again last week, MSPs have had the chance to amend the bill to introduce further guardrails, additional clarity and stronger restrictions and requirements in a wide range of areas. That's as it should be. I may have introduced this bill, but it's very much Parliament's bill now. It feels invidious to pick out individuals, but let me throw caution to the wind. And I refer to colleagues who at stage 1 either were opposed or their support was certainly caveated. Jackie Bailey has successfully introduced changes reflecting priorities of CHAS, the RCN and hospices. Fulton McGregor has been tenacious in speaking up for social work, securing changes that reflect the important role these professionals must play in assessments and wider safeguarding. Ruth Maguire helped Parliament reinforce protections to address concerns about coercion. Meanwhile, Bob Doris secured so many amendments at stage 3, my office are referring to this now as Bob's bill. Together with Miles Briggs, however, they have ensured the needs of palliative care have been reflected in the debate around this bill, recognising the inevitable interaction between the two. It's allowed a light to be shone on a sector that is crucial and often misunderstood and undervalued. Brian Whittle led the way on advanced care plans and the importance of using this bill to promote much greater discussion and early planning of people's wishes at the end of life. Paul Sweeney ensured stronger requirements around signposting to social work and mental health services, an area he has commendably prioritised. Daniel Johnston, whose forensic scrutiny of international legislation I referred to last week, but has lodged amendments that enable debate on key issues and put in place further safeguards, including a prognosis period, mandating in-person meetings and toughening up reporting requirements. And finally, Ross Greer, built-in advocacy support for those who need it, while also crucially supporting my efforts to ensure fundamental protections and training for medical professionals will have to be in place before the provisions of this bill can be implemented. On those issues of legislative competence, again, I acknowledge the work of the Scottish and UK Government. They are neutral on the issue of assisted dying, but once this Parliament voted strongly in favour of the general principles at stage 1 in May, both governments worked at pace and in good faith. In record time, they reached agreement on a way forward that respects both the will of this Parliament but also the provisions of the Scotland Act. That agreement allows issues around medicines and medical devices to be dealt with via a Section 30 order. No duty, no detriment protections, as well as training qualifications and experience requirements, will be taken forward via 104 order. I recognise colleagues and some in the sector are anxious, but the fact remains the provisions of this bill cannot come into force unless and until the 104 order is passed. Of course, there are different views on the Constitution and how the Scotland Act might work in future. We'll have ample opportunity to debate those views in the run-up to May's election. For now, the reality is we must deal with the Scotland Act as it is, not as we would wish it to be. And I'll take a brief intervention from Daniel Johnson.
Daniel Johnson.
Very grateful to Liam MacArthur for giving way. I think, in a sense, I agree with him about the points when the 104 is coming back to Parliament. But would he also reflect that actually much of the detail of how this bill will work, in terms of the detail of the practice, will rest with the guidance, and therefore Parliament will be provided with a yes or no option, when I think many people in this chamber might want to be able to look at the detail and scrutinise it.
Liam MacArthur.
I understand the point that Daniel Johnson has made. I've worked very closely with the BMA on bringing forward the amendments I did at stage 1 to provide that reassurance around the 104 order. And in relation to the guidance, I think there are elements both of the guidance but also the Secretary's legislation, all of which will need to be taken forward in consultation with the sector. I fully expect that to happen, and I think this Parliament should have confidence in that process. I'd also like to pay personal tribute to the Cabinet Secretary and wish him a speedy recovery. Neil Gray is the MSP I've known longest. He's a good friend and someone I respect enormously. It's not been easy for him to navigate the path he has on this bill, given the differences in views around the Cabinet table and across government. However, he's discharged those responsibilities unwaveringly. I hope he will now feel able to vote, like every other MSP in this chamber, according to his conscience. To expect him to do otherwise would be unfair, unreasonable and unjust. I said earlier that this is a significant moment for this Parliament, probably the most significant. I know too how conflicted many colleagues feel. Some may even still be unsure how they're going to vote later. Yet what we are doing is not breaking new ground or something legislators around the world have not already done. I accept that every assisted dying law is different and each must be tailored to meet the circumstances of that jurisdiction. What I don't accept, though, is the assertion that were this bill to be passed and the choice of assisted dying available in Scotland to those who meet the strict criteria, it would operate at odds with what we see in states and countries with similar models based on terminal illness and mental capacity. Dr Andrea Bendrup's, President of VADAS, the body representing health professionals providing voluntary assisted dying care in Australia and New Zealand, wrote to MSPs last week. With many VADAN's members having trained or worked in the UK, our debate on this bill is being watched closely. In his letter, Dr Bindrup writes, "It's been notable that the arguments being made against a change in the law are the same arguments that were made over many years in Australia and New Zealand. None of the fears raised have been realised in practice. Eligibility criteria have not been expanded. Proper assessments to confirm capacity and the absence of coercion have meant not all applicants have been found eligible, and palliative care has flourished. Regular scrutiny and oversight show these laws are safe and are fulfilling their aims." Addressing concerns about doctor-patient relationships, Dr Bendrup goes on to say, as clinicians, we know how helpless we can sometimes feel with palliative care has reached its limits and when patients ask for help that we cannot offer. The change in the law on assisted dying meant we can now deliver a fuller range of choices to dying people in a more transparent and regulated manner. The integration of voluntary assisted dying into our existing health system has meant that end-of-life care is now safer and fairer than ever before. Presiding Officer, I don't underestimate how difficult a decision this is for colleagues, even some very clear on how they're going to vote and why. We must recognise, however, that not passing this bill has consequences. The issue won't go away. Indeed, numbers affected will only rise. All we do by putting off changing the law is push decisions overseas and behind closed doors. So, as I did at stage 1, I urge MSPs to have the voices of dying Scots at the front of their minds when they come to vote. To help with that, let me conclude with the words of Lisa Fleming, who visited Parliament recently to share her experience of living with secondary breast cancer over the last 9 years. Lisa explains, sadly, choosing not to support this bill is a vote for continuing the well-established risks and dangers present in the status quo. As with many things, there is a cost to inaction. In this instance, the price of MSP's uncertainty would be mine to pay. Voting down this bill is not risk-free. The consequences are not hypothetical. They are lived every day. To the concern that this would lead to an enormous change in healthcare, I disagree. I can already choose to refuse treatment whenever I wish, even if that treatment would save my life. I can legally choose to hasten my death by voluntarily stopping eating and drinking, literally starving myself to death. Doctors can already administer doses of morphine and other palliative medicines that would hasten my death, as long as their motive is to alleviate my pain. Legalising assisted dying would not change my relationship to my doctor. It would allow me to be open and honest about what I want and ensure I wouldn't be forced to suffer against my wishes. I fight every day to live a little longer. But every day I have contains fear of how I will die. If I knew I had the choice of an assisted death at the end, I could live the rest of my life without that fear. Please think of me as you cast your vote. Presiding Officer, I urge members to listen to Lisa and the many, many like her who desperately need us to give dying Scots more choice, more dignity, more compassion, and I move amendment in my name.
Thank you. I call the Minister. Tom Arthur.
Presiding Officer, unfortunately, Neil Gray, who up until today has led on Liam MacArthur's assisted dying for terminally ill adult Scotland bill for the Scottish Government, was admitted to hospital yesterday. Whilst I am pleased to say he has now been discharged, he is unable to take part in this evening's debate. I will keep my remarks on behalf of the Government short and remind the Chamber the Government is neutral on this bill. This bill has been carefully and properly considered by Parliament through the actions of Mr MacArthur as member in charge of the bill and through the contribution of all members. There are strongly held and passionate views on both sides of this debate. Yet I believe members have taken a considered and courteous approach so far, and I'm sure that this will continue this evening. I'd also like to note the work of the members of the Health, Social Care and Sport Committee and the Parliamentary staff who have supported them. They have had a larger role to play than most through the first two stages and have considered these profound matters with the care and seriousness they deserve. Presiding Officer, let me now turn to the role of the Scottish Government. As members are aware, we undertook to respect the will of this Parliament by engaging with the UK Government to try to resolve the issues of legislative competence that we had identified within the bill as introduced and set out in our September 2024 memorandum, as well as with provisions that were added to the bill at stage 2. Liam MacArthur has reminded members during these stage 3 considerations that he was also aware of the need to ensure legislative competence, and I appreciate his acknowledgement of the constructive and timely work by both governments in this regard. As Neil Gray has said to Parliament, that engagement has taken place in good faith and resulted in a Section 30 order that modified Schedule 5 of the Scotland Act 1998 to allow this Parliament to legislate on the identification and regulation of substances and devices for use in assisted dying in relation to this bill. Both Parliaments and the Privy Council have approved this, and it came into force on 11th March. It also resulted in an in-principle agreement with the UK Government to take forward a Section 104 order, should the bill pass, and it would be for a future Scottish Government and the UK Government to work together on the detail of that order. This in-principle agreement covers making provision consequential on the bill for individuals and practitioners to opt out of participating in assisted dying and providing appropriate employment protections. It also covers considering and making appropriate provision to specify the training, qualifications and experience required for participating medical practitioners and nurses. Through Stage 3 amendments passed by the Parliament last week, the changes that were necessary to address the issues of legislative competence with the bill have been made. Another potential issue was that amendments at Stage 3 could bring the bill further out with competence. That is why the Government provided a commentary on the amendments, highlighting technical, deliverability, legal and legislative competence matters, to help members in making decisions around the amendments they might wish to accept or otherwise. We also did this at Stage 2 and yesterday provided the final short commentary on the bill to support MSPs in making their decision. Presiding Officer, we all know the huge sensitivity of the subject before us, the complexity of it, and the weight that is on our shoulders as we make our individual, personal decision on the bill. It is now for members to cast their final vote on the decision before us.
Thank you, Minister. We will now move to the open debate. Backbench speeches of up to 4 minutes, please. And I call Rona Mackay to be followed by Edward Mountain. Ms Mackay.
Thank you, Presiding Officer. This will be my last speech in this place before stepping down next week after 10 years. It's a short speech and, of course, it's not political. But, Presiding Officer, that's okay, because what we're debating is not about me. This debate and the days we spent passing amendments last week are for terminally ill people who are pleading with us to be given the choice to die a dignified, pain-free death of their choosing. Now, I respect those members who do not share my views about this bill. I don't agree with their views, but they have a right to hold them. They have the choice to vote for or against this bill. And that, Presiding Officer, is the point. We in this chamber have a choice. Terminally ill people who are terrified of what they may face at the end of their lives do not. Who are we to deny them that choice? To put our values and preferences before theirs because we have the power to do so? If this bill passes tonight, and I hope with all my heart that it does, it will be the most heavily safeguarded bill in any jurisdiction. The respectful and collegiate way Liam MacArthur and his hard-working team have brought this bill to this final stage is to be commended. No one has worked harder, and after last week, no bill in any jurisdiction in the world with assisted dying is more heavily safeguarded. This bill has always been about creating a compassionate, regulated, safe and legal option for terminally ill adults who choose to end their suffering. We know that terminally ill Scots Many terminally ill Scots face a bad death and are forced to contemplate a series of desperate, traumatic decisions, decisions which do not belong in a compassionate 21st century Scotland. International evidence proves that assisted dying is safe, compassionate and is a comfort blanket to those who choose or not to use it. What makes Scotland so uniquely different that it couldn't be the same here? The most recent polling found that 81% of people in Scotland want to see assisted dying introduced as an option for those diagnosed with a terminal illness. There is a clear majority support for the bill across every constituency, so Scotland is not on the fence on assisted dying. Presiding Officer, I said earlier that this bill is not about me or any other member at this time, so I want to give terminally ill people who have had all agency stripped from them by their illness a voice. One woman opened her heart and said, "Assisted dying would be a lifeline for us. It would let us live the rest of our lives in peace, making precious memories with our loved ones without the constant dread of how our lives will end." Voting against this bill will not stop us from dying, but will deny us a lifeline to a safe, peaceful death, surrounded by our loved ones. Too many families are left traumatised by what they have witnessed at the end of a loved one's life. Now is the opportunity to make things right for those that have died, so no one has to suffer as they did. The status quo abandons people at the moment they most need compassion, safety and support. The most dangerous thing Parliament can do is nothing. So in the name of humanity and for those depending on us, I urge you to support this bill.
Thank you, Ms Mackay. I now call Edward Mountain to be followed by Jamie Hepburn. Mr Mountain.
Thank you very much, Presiding Officer. So we finally reached the last stage of the assisted dying bill. A long and uncomfortable journey, I'm sure, for many. We've all had to consider our own mortality and that of our constituents. Looking death in the eye has never, ever been easy, and we must always consider the fragility of life. But let's be clear, in my mind, life is always about living. I've heard much in this debate about why people should have the choice, and in principle, Presiding Officer, I would agree. But choice can only be made if there are genuine options, and those options must include palliative care, that my colleague Miles Briggs has fought so very hard for. But the sad fact is, Presiding Officer, over 14,000 Scots a year die without proper palliative care, and we need a lot of money to be able to provide that. Thus, to some, it may be easier to opt for death, knowing palliative care close to their home and family is unavailable. That's not a choice. Before we consider helping those people to die, we must know that their end of life is fully provided for and funded, which it isn't at the moment. And funding is a key issue when it comes to this bill. What we know is that funding will come from the existing NHS budget. Now, the government has been clear they have no idea of the costs, which they can admit will be high, and they say that it will require a level of reprioritisation. That means existing services will face funding cuts. So what cuts will be cut? What treatments will be cut? Cancer care? Palliative care? Elective surgery? Or perhaps even screening for breast or bowel cancers? It's just not good enough to say, pass this bill, and then we'll work out how we're going to pay for it. We need the clarity now. And on clarity, what is to happen to those who want to opt out of providing an assisted death? From doctors to nurses, to care homes, to palliative care homes. Many of them, like me, will have no religious drivers, but know in their hearts they don't want to be part of this process. The part of the legislation that protects conscientious objectors have been removed to make this bill competent. That worries me. We will now have civil servants and ministers at Westminster deciding on how to protect Scots in what is specifically a Scottish bill. No choice here in our Parliament on the exact detail. And that not only seems wrong to me, but it is wrong. Presiding Officer, I want to turn to the area of the bill that gives me the greatest concern. Coercion, and I include self-coercion. I find this a really difficult area to discuss. When one's grip on life is fragile, your mind does somersaults. But once you get past thinking that it might be easier and kinder to your family to die, the overriding consideration will turn to living. Treatment options, pathways for care are rightly the top priorities. But this bill will now give doctors the right to say in terminal cases, death is available. I believe that the last thing we should be doing is suggesting that ending life is a form of treatment. Presiding Officer, when we despair, we need hope. Death offers no hope. Treatment and care offer hope. Let us provide and fund that care before we legislate to end life. Until we do, Presiding Officer, I'm afraid I cannot support the offering an assisted death. To me, that is morally wrong if we can't allow them to have an assisted life. Thank you, Presiding Officer.
Thank you, Mr Mountain. I call Jamie Hepburn to be followed by Michael Mara. Mr Hepburn.
Presiding Officer, I want to begin by thanking Liam MacArthur for the considered manner in which he has advanced this bill. This has been the single most difficult matter to determine upon in my 19 years in Parliament. I recognise and understand that many colleagues have known from the outset as how they would vote today. I have not. As we debated this bill at stage 1 last May, I did not know how I would vote, cast my vote that day. Indeed, it's only been the last few days that I've come to determine my final position. I admire and perhaps even envy those who approach this bill with absolute certitude on the best way forward, and I respect those who have such certainty. Even at this stage, I find myself grappling with how best to make the right decision. I have approached the bill with an open mind throughout its passage. The first principle with which I've considered it is whether or not a person should be able to command autonomy in decisions that impact them and their lives most directly. That is a principle that I broadly agree with, and it is a principle that lends itself towards supporting this bill. Indeed, after having heard the debate in May, and from the many colleagues who took part, it was one of the reasons that I felt able to support the bill in principle at stage 1. However, it is not a principle that sits in isolation from other considerations, and in contact with the many constituents who have been in touch with me about the bill, I've always been clear that these are just as important. And the other primary areas of importance have been tightly defining eligibility, protecting the most vulnerable in our society, and protecting the interests of clinicians and medical professionals. I recognise last week we made a great number of changes, and I think have gone some way further to improve what was in the bill. The short time available prohibits me from mentioning many, but the one I'm clearest on is that having a reasonable end-of-life prognosis of 6 months was an essential change from my view. However, I do have lingering concerns. I was disappointed that Daniel Johnston's amendments that would have absolutely required it to have been in the hands of the patient to first raise the prospect of an assisted death with a medical professional were not agreed. Any new legal right to an assisted death does change the context of patient-doctor conversations and does create a new dynamic. I believe in such circumstances the amendments that Mr Johnston brought were very important, and their being disagreed to has been an important part of informing my thinking. So too was I disappointed with the rejection of the amendments that were advanced that sought to create institutional opt-out. I think that would have been a helpful provision. I am also concerned that Parliament has found itself in the unsatisfactory position of not being able to legislate for the protection of conscientious opt-out for medical professionals. I do recognise that we are up against the limit of Parliament's legislative power, but to have to remove those provisions and to rely on the Section 104 order process that leaves it to the UK Government to determine how this will work is of concern for me. They should have, by my view, agreed a Section 30 order to enable this Parliament to legislate to provide clarity. I appreciate it is argued that we can reasonably expect the UK Government to put in place provisions that we would require to be satisfied with the position of the medical workforce being protected, but the fundamental point is that we do not know what these will be. That concerns me, and the inability to demonstrate how this area will work, along with those other areas I've highlighted, leaves me at this time, and with some sense of regret, unable to support this bill. This is a decision I know will disappoint many in this chamber, and beyond all, just as sure the alternative would equally have disappointed many. But it is the decision that I have come to sincerely hold and that I come to rest upon.
Thank you, Mr Hepburn. I call Michael Mara to be followed by Patrick Harvey. Mr Mara.
Thank you, Presiding Officer. When I was elected in 2021 for the first time, I was undecided on this issue of assisted dying, although I knew a decision was likely in this term of Parliament. And I believe on these 5 years I have learned from colleagues and constituents that being a Member of Parliament is far more about listening than it is about speaking. And I have listened to the voices of my constituents who have sat at bedsides and suffered as relatives have died the most difficult of deaths. And those families have our empathy and our sympathy, and it is a privilege to be entrusted with their stories. Today, I believe that MSPs must listen to those who know the messy, emotional, painful and inevitable business of dying best of all. Those who have seen thousands of deaths rather than our terrible handfuls. Those who have the duty of seeing the aggregate as well as the individual. We should acknowledge together that those who would be most involved in delivering the process of dying that we are voting on today are asking us to vote against it. Starting with the patient's trusted GP, through the psychiatrist who assesses for capacity, to the pharmacist who provides the drug, and to the palliative care staff there at the end. All of their esteemed professional bodies have considered the bill and are asking MSPs to vote against it tonight. And like many Dundonians, I have said goodbye to beloved family and friends in Roxburgh House. That's an outstanding palliative care facility in the verdant shadow of Balgay Hill in Dundee. This morning I was struck by the testimony of Dr Martin Leaper. He was the lead consultant physician in palliative medicine in Tayside and led that hospice during 35 years in our NHS. And of our vote tonight, he said this: "I'm really worried about the effect it might have on my former place of work, whether its staff would be willing to work in an environment where palliative care was delivered and also there was the option for life to be ended. I worry that some staff, fantastic staff, would no longer go into work in that sort of environment." And I know from speaking directly with staff that this would be true, and a delicate balance would be broken. Instead of improving palliative medicine, which we all have agreed must improve, this bill risks harming it. The Government reiterated just yesterday that the costs will be high and that no new money is available to our NHS. So beyond principle and practicality, lack of safeguards and fear of coercion in what is a deeply unequal society of ours, where the vulnerable, the disabled, may easily see themselves as a burden and where women suffer daily at the hands of men. On top of all of that, these expert caring staff are opposed because there is a huge hole at the heart of this bill where protection for those dedicated professionals and their care of patients should be. And ceding this process to backroom officials is an unsafe dereliction. It's the job of elected representatives to hear the voices of the people, to balance competing claims and to act in the public interest. So, Presiding Officer, we have exhausted scrutiny of this bill. The vote at stage 1 allowed that to happen. But to those who agreed with the principle and must now judge the practicality, I say please, not this bill.
Thank you, Mr Mara. I now call Patrick Harvey to be followed by Alex Cole-Hamilton. Mr Harvey.
Thank you. Let me start by recognising the hard work of Liam MacArthur and everyone on his team, but also the high quality of debate that other members have acknowledged across the chamber. Members on both sides of the principles that this bill raises have engaged constructively and respectfully, and I'm convinced that the result is a bill that is stronger thanks to the scrutiny of Parliament. I know that some members' opposition to this bill is very strong, and for some that wouldn't change regardless of the detail. I respect that position, but I must take this opportunity today to speak primarily to those who have concerns but who are open to the principle, those who accept the case for a change in the law but who need to know that the system we're creating will be safe, compassionate and robust. And I ask members to consider two key points as they reach their final decision. The first is that this is not a choice between this bill and some ideal status quo. In today's Scotland, far too many of those who reach the end of their lives in the most difficult of circumstances experience fear, unbearable suffering, a desperate desire to have control of what's happening to them, and indeed pressure or coercion in different forms to make choices that they wouldn't make freely. And even with the very best palliative care, which is something that we all support, this is still the case. This bill is not an alternative to something benign. It is an alternative to a status quo which we should consider unacceptable, unsafe, and which too many people face not only without choice, but also without the protections that this bill contains. Secondly, I ask members to reflect on the very fact that our debate has heard the different principles, the different values on which we base our choice as legislators, the different values that inform the views of our constituents too on both sides. Those different values that we bring to this debate reflect the different values by which we live our own lives, the different values which inform every choice we make, including as we look ahead to the uncomfortable truth that we will, each of us, one day face the end of our own lives. That fact of the different values by which we live is, for me, the central reason why we must respect the right of people to make choices on their own terms, including choices we might never make for ourselves, even choices of which we may disapprove. That's at the heart of what it means to be a creature capable of choosing. I know there have been legitimate and valid concerns about getting the detail right in this bill, and I believe the work Liam MacArthur has done and the amendments Parliament has made give us the chance to allow choice with meaningful protection for those who need it. This bill will give Scotland the most safeguarded assisted dying system in the world, working in tandem with palliative care, never against it. It will have support and advocacy at its heart. I'm not sure if we have time in hand.
Very briefly, Daniel Johnson.
I'll give way.
I'm grateful to the member. Would he accept that there are a number of safeguards present in many territories in Australia which just aren't present in terms of oversight? To say that it's the most safeguarded, I'm not sure is correct.
Patrick Harvey.
Well, in looking at the various systems around the world, I don't believe that there's one which has this package of safeguards and measures. But every member must make that judgment for themselves. This bill will have support and advocacy at its heart, and it will be available only for those who are truly reaching the very end of life. And it contains within it the path to the most robust protections for those who feel the need to exercise a conscientious objection, and complete democratic control here in this Parliament. The bill will not come into force unless MSPs are satisfied with the treatment of reserved matters. Presiding Officer, this bill is the path to the safe, compassionate and controlled system that will give meaningful choice, that will give protection for those who need it most, and that will meet the public will for a change in the law. And I urge members to vote yes.
Thank you, Mr Harvey. I now call Alex Cole-Hamilton to be followed by George Adam. Mr Cole-Hamilton.
Thank you, Presiding Officer. May I start by echoing the tributes paid to my friend Liam MacArthur and his excellent team for getting us to this space. Presiding Officer, throughout our consideration of this bill, I have listened with quiet awe and at times great sadness to the testimony of colleagues and constituents who have lost the people they love in the most brutal and unforgiving of circumstances. I have nothing to match that. I have no comparable experience from my own family or friendship group to offer the Chamber, and I am profoundly grateful for that, just as I am grateful for their strength in sharing these stories, in framing the debate around the human at the heart of this, about their loss of agency, about their loss of dignity, the agony of it, the terror of it, distilling into heartbreaking clarity what really matters at the end, and how all too often so much of that is robbed of people in their final days. Medical culture and practice have led us to a point where life can be foreshortened, but only with the removal of sustenance and fluids. That is the barbaric and inhumane compromise we have settled for, where emaciated bodies are made as comfortable as possible, but still left to a lingering death that can take many, many days. The provisions in this bill offer patients in the end stages of life a far more gentle and dignified alternative to that, but only if they are terminally ill, only if they are 18 and over, only if they have mental capacity, only if they are acting of their own volition, and only if their clinicians agree that they have fewer than 6 months left to live. Presiding officer, that is a powerful matrix of safety. And the member in charge has drawn from the very best practice of those jurisdictions that have gone before us. And we benefit from that because we are not pioneers in this. Over 300 million people live in jurisdictions which already offer assisted dying. And presiding officer, consider that over the decades, not a single one of those countries or territories have ever reversed that decision. If this were so readily exploitable or dangerous, there would be examples of repeal, but there are not. The narrow scope and significant safeguards of Liam MacArthur's bill as introduced have only been strengthened and enhanced by the quality and the depth of the amendments that we have passed into it as it moved through this Parliament. The guardrails around this bill are unprecedented. This is one of the safest approaches in the world. So please don't vote against this bill because you are waiting for a safer one. In this moment of final decision, all that is left for us to decide is whether we support the idea of choice at the end or we don't. Now, I respect and have great admiration for many of those who have spoken in opposition to this bill, but we have made sure that if this passes, you will never be forced to choose it. But please, please don't take the choice away from the rest of us. Presiding officer, I have no real fear of death itself, but I have abundant fear of dying. Uncontrollable breakthrough pain frightens me. Asphyxiation and an inability to swallow, they frighten me. And more than anything else, a loss of my identity or the recognition of those I love frightens me. I want to be able to choose a different end, to remain the author of my life story to the very last word. But the law as it stands makes death a lottery, a potentially cruel and terrifying uncertainty that all too many Scots meet the sharpest edges of. That is why, with all of my heart, I hope we change the law tonight.
Thank you, Mr Hamilton. I now call George Adam to be followed by Sanjay Gohani. Mr Adam.
Thank you, Presiding Officer. Can I take this time to thank Liam and all the work, Liam MacArthur, for all the work he's done in this bill. In my notes here, Presiding Officer, I've got try not to cry during this debate because it means quite a lot to me. But I often use song and music as a way to describe how I'm feeling and tell people how I feel. And it's often said that music is the soundtrack of our lives. And I've used that phrase during stage one of this debate to express my love for Stacey. And I kind of do that a lot, Presiding Officer. After 30 years of marriage, it probably is less romantic than what it was back in the day. But it was American broadcaster Dick Clark who first used the term music as the soundtrack of our life. When we hear certain songs, we're instantly taken back to when we first heard them. The school disco, the relationship that was fleeting but powerful, St Mirren winning the cup. That one might just be me, but the music takes us to that moment in our life that shaped us. When I hear All I Ask of You from the Phantom of the Opera, I see Stacey walking down the aisle on the day we get married, looking gorgeous. And when I hear God Only Knows by the Beach Boys, the opening bars melt my heart. And I'm thankful that Stacey is part of my life and I've become the man I am because of her. As you know, and I said this during the Stage 1 debate, Stacey lives with multiple sclerosis. Like many people living with long-term conditions, she carries it with remarkable strength, even if life is not always quite as rosy as she sometimes leads us all to believe it is. There's a song that means a lot to her, Smile. The melody was written by the brilliantly creative but very human and flawed genius Charlie Chaplin, and the words added later and made famous by Nat King Cole. The words say, smile though your heart is aching, in many ways has become her anthem. She lives with MS, high blood pressure, asthma, osteoporosis. MS itself won't kill her. but it does make her more vulnerable to other illnesses that could come later, and yet she smiles. She smiles, Presiding Officer, because we have each other, because we have our children, James and Jessica, and we have our 4 wonderful grandchildren, soon to be joined with a 5th. She gets through the hard times because she's so much to live for. And when Stacey talks about that song, she's not talking about the end of life, she's talking about living it. Every day she possibly can. But she also said that if the worst should ever come to her, if she was ever facing that unbearable suffering at the end of life, she would want a choice. And, Presiding Officer, there's another song that means the world to me as well, No Matter What by Boyzone, Please Don't Judge Me. I played that to my daughter Jessica when she was wee. It was my way of telling her to be true to herself, to grow up into her own woman, and to know that no matter what, she would always be loved. And that is what it all comes down to for me. My wife and my daughter, the 2 most important people in my life. We all have these stories, Presiding Officer, every single one of us, but all stories inevitably reach their final chapter. For many, that end comes with peace and comfort. For others, it comes with profound suffering, a loss of independence and loss of dignity. The question is whether compassion has a place during the final bars of life's soundtrack. We cannot control every single note, but we can decide the final notes are shaped with humanity, dignity and choice. Those who tell me we need better palliative care, I agree with them. My mum Elizabeth spent the last few days of her life in the Accord Hospice in Paisley. 2 days before she died, Stacey and I spent the whole day on the Saturday afternoon, and I created a playlist which had the Beatles, Tammy Wynette, Patsy Cline, Willie Nelson. She liked 2 types of music, country and western, Presiding Officer. We had a great day, but a week later I was carrying her coffin down the aisle of Woodside Crematorium to Blue Eyes Crying in the Rain and her own personal anthem, Stand By Your Man. But when I hear that music, I remember that sunny day. Presiding Officer, music really is the soundtrack of our lives. The songs we hear before the memories we carry, the people we loved, the lives we built, the moments that shaped us. Stacey says, smile though your heart is aching, and that is how so many people live their lives, with courage, with resilience and the love for the people around them. But every life, no matter how rich its soundtrack, eventually reaches its final chapter. And when that moment comes, the question before us today is simple. Should those final notes be written only by illness and suffering, or should compassion, dignity and choice have a voice as well? If music truly is the soundtrack of our lives, then the final note should be written with compassion and by the person themselves.
Thank you, Mr Adam. I call Sandesh Gohani to be followed by Carl Mochan. Dr. Gohani.
Thank you, and I wish to make a declaration of interests. I'm a practising NHS GP, registered with the General Medical Council, a member of the British Medical Association, and I chaired the Assisted Dying for Terminally Ill Adults Bill Medical Advisory Group, and I am a practising Hindu. This debate touches on some of the most profound questions any of us will ever face: life, suffering, dignity and death. I want to begin by expressing my sincere respect for those colleagues and members of the public whose religious, ethical or philosophical compasses make it deeply difficult to contemplate supporting this bill. Those views are sincerely held and deserve respect in this chamber. I say that as someone who shares some of those internal tensions myself. As a practising Hindu, I wrestle with the philosophical, ethical and spiritual aspects of my faith when I consider legislation such as this. These are not abstract ideas to me. They are part of my own moral framework. But this Parliament is not a theocracy. Our responsibility is to inquire, to investigate, to debate, and sometimes to struggle with difficult questions so that we make decisions that improve people's lives. And that is why I came into politics. And we cannot be out of touch with the country that we all serve. Scotland today is largely secular. We live in a plural society with many different moral perspectives, and 81% of the public support assisted dying. We here in this chamber, and for all those watching, we share two things. We are born, and we will die. All of us. No exception. And we control all aspects of our lives, but we have no control over how we die. People dying alone, scared, in agonising pain. As a patient told me, I would not let a dog die like this. Why am I having to suffer like this? She can choose to starve herself or to stop drinking, to die horrifically, but she could not choose to die with dignity or painlessly. Let us here today give people a real choice over how they die. Having chaired the Bill's Medical Advisory Group, I believe we have before us a serious and sound piece of legislation. We must also be honest about the reality that already exists. Today, the option of a peaceful assisted death is effectively available only to those with financial means to travel abroad. Those without such means often face prolonged suffering without the same choices, and that inequality should trouble us. This bill is also not and must never be seen as an alternative to high-quality palliative care. As a GP, I have seen the extraordinary compassion and skill of palliative care teams. They do remarkable work, and I will continue to advocate strongly for greater resources in this area. Palliative care must remain a cornerstone of how we care for people at the end of life. But choice matters. For some patients, despite excellent palliative care, suffering cannot always be relieved. For those individuals, the dignity of choice at the end of life is something many Scots believe should be available. This bill represents years of work, consultation and scrutiny. It offers compassion, safeguards and dignity for those facing the end of life. If it falls today, it will not simply be a procedural moment. It will be a lost opportunity to help those suffering and dying who have no voice. For those reasons, and with respect for colleagues who will reach a different conclusion, I believe this is a good bill, a sound bill, and one that deserves the support of this Parliament.
Thank you, Dr Grahani. I call Cara Mochan to be followed by Jeremy Balfour. Ms Mochan.
Thank you, Presiding Officer. In my 5 years as an MSP, I've had the great honour of hearing directly from people across my region and across Scotland. People have experiences well outside my own. I value all those interactions and take them very seriously. I thank everyone who's contacted me on this bill. Presiding Officer, I am here to serve, and today that is exactly what I intend to do. Few groups have affected me as much as those who are pleading with us to introduce this bill. What I have come to understand is that choice at the end of life really matters. Their experiences is one any of us may encounter in one way or another. Yet, until we do, it can seem like an abstract or a far-off consideration, and so we cannot allow ourselves to imagine that we might consider assisted dying. People who have experienced this are, or experiencing as we speak, are watching us today, awaiting a vote that signals to them their concerns have been heard and that their lives remain their own. Those same people watched last week as we constructively debated the issues and assessed the amendments, the longest such process that has occurred certainly in my time here in Holyrood. No one can say this bill has not received serious and considered scrutiny, and I thank my fellow members for that. I want to remind colleagues in the Chamber today that there is widespread support, public support for assisted dying legislation. As parliamentarians in Scotland, are we going to simply ignore the move of public opinion towards such a reform? I truly hope not. I believe that we need this legislation, and to once again turn our back on compassion and choice would be a grave mistake driven by fear. Polling does suggest that around 76% of people across my own region of South Scotland support legislating assisted dying. The figure is broadly similar in every region. So to be clear, this bill is about choice, This bill has strong public backing and it has received unprecedented scrutiny and constructive debate. This is how democracy should work. This is the basis for good legislation that will stand the test of time. In that spirit, and in line with the principles I have strongly held since I worked in the NHS, I will cast my vote today for the people who are suffering, for those who will suffer in the future, and for everyone who simply wants a fair and compassionate option in the likely final 6 months of a terminal illness. I entered politics to help people and to empower them, and this bill does both. It may not be a comfortable subject or an easy one, and I accept that, but it is the compassionate approach that best serves the complex experiences of so many people across Scotland. At times, I have been dismayed by how little meaningful legislation makes it through this chamber. A great deal of time, public funds and people's hopes are invested in our democratic processes, and I fear due to excessive caution or needless delay, we do not provide the public with many examples they can measure our worth. Today, we can do so. I will just close by offering my thanks to Liam MacArthur MSP and his team who have done such a great work navigating this bill. Without that steadfast and constructive approach, we would not be at this stage to begin with. Please, I urge my fellow MSPs, let's not delay compassion. Let's not delay the ability to help others. Let's pass this historic bill and end this session having truly changed Scotland, not just maintaining the status quo. Let's give dying people the chance to decide the last moment for themselves. Thank you, Presiding Officer.
Thank you, Carol Mochan. I now call Jeremy Balfour to be followed by Bob Doris. Mr Balfour.
Thank you, Presiding Officer. It's been said many times over the course of this Stage 3 debate already that we are dealing with the most important decision that we as parliamentarians have taken. I want to thank Liam MacArthur and all his team for the way that they have taken this bill through Parliament. The decision that we make this evening will profoundly change the very fabric of our society, and we should all consider that very carefully when it comes to decision time. Presiding Officer, disabled people are frightened. I want to ask my colleagues to put themselves in my shoes and their shoes. Imagine you relied on your family and friends to make daily sacrifices to help you get up, dressed and ready for the day. Imagine you've been told by many people, including a number of politicians, that you're a burden on society and the benefits that you rely on to survive could be better spent elsewhere. And I want you to imagine that you've heard on numerous occasions the words, "I'd rather die than live like you." How do you think you would feel watching this debate? I think you would rightly feel terrified. President, I know that those on the other side will say that this bill only affects those with terminal illness, but as we have seen time and again in other jurisdictions, this bill marks the beginning of the story, not the end. Take Jersey, for instance. Their bill was passed not even a month ago, and there has already been attempts to broaden my criteria by which someone is eligible. In passing this bill, we would be opening a Pandora's box, and the effects of the most vulnerable in our society will be devastating. Because despite what we have heard from the other side, there can be no meaningful protection against coercion. We cannot legislate for the feeling of being a burden. We cannot legislate for the throwaway comments that make me and others feel that our lives are worth less. Presiding Officer, I am very fortunate. I have had a loving family. I have a superb wife and loving children that would never let me go through this. But even if I'm at a low moment, but there are many in our country who are not that fortunate. The protections in this bill are not good enough. They can never be good enough. Colleagues, friends, I'm begging you to consider what the consequences of passing this bill will be for the most vulnerable in our communities. Don't let this be our final act of this session, to be a disappointment to them and to future generations. Thank you, Presiding Officer.
Thank you, Mr Balfour. I call Bob Doris to be followed by Liz Smith. Mr Doris.
Presiding Officer, if assisted dying is not passed this evening, many who have led a dignified campaign in support of a law change will be deeply disappointed. Likewise, should the proposed legislation become law, there will be many others who will feel that the exact same disappointment. In particular, many of our disabled constituents will be very shaken by that outcome. And as we all have, I've had heartfelt pleas from constituents on both sides of this debate. My approach to this legislation has been to amend it as best I can, to bring in some safeguards, even though I am not convinced as the level of reassurance such safeguards will offer. I sincerely thank Liam MacArthur for his constructive engagement on amendments at stage 3, as well as the Scottish Partnership on Palliative Care, who I worked with to develop my amendments. I should note they are neutral on this bill. I think there has been some positive amendments to the bill, if not enough to make a substantial difference from my perspective anyway. They have been taken forward with sincerity and in good faith. There is now a requirement for the registered medical practitioner to set out in detail how they arrived at their decision to approve a request for assisted dying, rather than a simple declarative statement to attest the criteria has been met. That will aid transparency on decision-making, but it won't improve the decision-making process itself. There are also now requirements to seek to identify indirect pressures and undue influence. That said, I was concerned by suggestions of some that coercion would not particularly be an issue. I remain concerned about the ability to identify coercion, which can be hidden and tricky to identify, particularly in relation to coercive and controlling behaviour. I want to put on record a quote from Professor Annie Donaldson, Dr Mary Neal and Professor David Jones in the Scottish Legal News in relation to some of this stuff. They said, given the scale of abuse to the law, the low rates of disclosure and the fact that training, however thorough, cannot reliably detect coercion, it is inevitable that coerced deaths will result if a assisted dying bill becomes law. That's not a reason not to pass it, but we should not pretend it won't happen. There will now be a referral to a palliative care specialist by the registered medical practitioner if they believe appropriate care was not being offered. But I'm concerned as to how the practitioner will always be able to inform view on that front. Indeed, more generally, we remain unclear as to the skill set and training requirements of any practitioner. Of concern to me is that the bill does not prevent the any GP from raising assisted dying with a patient, and my concern that a GP raising such a measure would not be a neutral act, even if it was intended. I'm sure it would be intended to be so, and in some circumstances I think it would compromise a doctor-patient relationship. I am also aware of our Parliament having to remove protections regarding opt-outs in matters of conscience from those professionals who may otherwise be required to be involved in the delivery of assisted dying. We all know that examples of excellent palliative care practice which can make a real difference for many. We also know that there are gaps in resource issues. It's not consistent. We need a strategic expansion of palliative care services across Scotland and must build the budget to deliver that expansion in our next Parliament, irrespective of whether this bill is passed. But for me, that ideally happens before we consider assisted dying. We must also not conflate palliative care budgets with assisted dying budgets. I am not really sure the bill does that appropriately. Assisted dying is not palliative care. I will vote against assisted dying this evening. That doesn't stop me from being conflicted. My reasons, no matter how sincerely held, are likely to offer little comfort for many of those who wish to see assisted dying. We've heard powerful arguments. However, should this legislation pass, many people, particularly many living with disabilities, will be deeply shaken also. And I think I'll just finish with a quote from Inclusion Scotland, which brought this home to me. It said, "Until disabled people have full access to support necessary to live with dignity, legalising assisted dying will not only exacerbate existing inequalities, rather than expand genuine choice and control." Presiding Officer, I'm conflicted in how I vote in relation to this.
but choice for some will not offer meaningful choice for all.
Thank you, Mr Torres. I now call Liz Smith to be followed by Pam Duncan-Clancy. Ms Smith.
Thank you, Presiding Officer. It is on occasions such as these, when the matter under consideration is just so challenged by complex ethical, moral, legal and practical questions, that I have come to know this Scottish Parliament at its best. I think we saw that last week, and I believe we are seeing it again this evening. And that's because for free votes, the increasingly confrontational and divisive politics of this chamber can be put to one side, because these votes encourage widespread respect across the debating chamber for different views. They are always sincerely hurled by the individuals concerned, and many of them are obviously based on very personal reflections. And I again pay tribute to Liam MacArthur for the very respectful manner in which he has led this bill. Over many years now, I have come to this debate conflicted, well understanding several of the key points raised by those who support assisted dying, partly based on my own family experience, but also understanding the key points in the case against. It's a debate in which I have become much more interested, and as such, I hope, better informed, given all the reading that I have undertaken on the subject, and having listened to the many hundreds, perhaps many thousands of constituents who have been in touch, not just about this bill, but about the two previous similar bills, and I want to thank all of them. But there are two particular aspects of this debate which continue to trouble me a very great deal, and which are the main reasons why I will vote against this evening. And the first one relates to the protection of our most vulnerable constituents. Now, I sympathise with all those who tell us that this debate is all about free will and the right to choose. But that free will and the right to choose can never exist in a vacuum. They are contingent upon other factors, free from pressure and free from any coercion. And death, whether it is assisted or not, also affects the rights of other people. And I raise this because these issues have been a very substantial part of the concern of many within the disability and vulnerable groups who believe that this bill would apply too much pressure on them, and I share that concern. As MSPs, we often deal with very vulnerable constituents, and I have personally and professionally learnt a very great deal from that experience. As a result, I really do worry about the implications for coercive situations within families who put pressure on vulnerable relatives to end their lives, perhaps for financial reasons, and that's obviously in increasingly difficult fiscal situations, or for the reasons which suit their own circumstances rather than those of the patient. The second reason for opposing the bill is my ongoing concern about the lack of safeguards and the hidden costs. Irrespective of whether you are for or against the principle, medical professionals are very clearly telling us that some aspects of this bill are both unsafe and unworkable, and that's because of the removal of Section 18, because it has removed vital protections, protections which in their eyes are central to the safe, ethical and fair delivery of care. For me, society must surely always have a respect for the sanctity of life, and that must include the medical profession's commitment to saving lives. And I continue to worry about a situation whereby we hand ultimate power to doctors with the possibility that voluntary action could lead to involuntary action. Then there is the issue about constantly improving medicine. The fact that all the time more and more successful treatments are being developed, including some for diseases that were previously thought to be terminal. And that's obviously not unrelated to some of the arguments about widening the eligibility criteria, as we saw in Canada. And I note, again, that the lead committee worried about the broad definition of terminally ill, believing that it could potentially include those who might well live much longer. Presiding Officer, as I mentioned at the start, this has always been a very complex and a very emotive debate, so deserving of our fullest attention. As I stand down from this Parliament in a few days' time, may I take the opportunity to thank all colleagues, former and present, for their engagement with me over the last 20 years. But may I also express my earnest hope that in future Parliaments, much more of our politics can be conducted in this manner, which is both considered and respectful, and free from the unpleasant rancour which has come to colour far too much of our political discourse. That change is something which I believe the public both wants and has a right to expect if Scotland is to be a stronger nation.
Thank you, Ms Smith. I call Pam Duncan-Glancy to be followed by Evelyn Tweed. Ms Duncan-Glancy.
Thank you, Presiding Officer. And I too would like to start by thanking Liam MacArthur for the way in which he's engaged in this bill and the way in which he's engaged with me. Last week, colleagues, we considered the specifics of what this would mean in real life. For 25 hours, we heard personal reflections and experiences, as well as some of the difficulties in the detail. But it was the question, when is it okay to bring up assisted dying with someone, that got to me. It got to me because it gets right to the heart of what we are debating tonight. What sort of life leaves someone with no hope? What would we rather die than live with? Presiding Officer, that question and this bill are hugely consequential. The bill before us, I believe, will not only put sick and disabled people at risk that cannot be mitigated in one bill or by one policy, including the risk from coercion, but it will also serve to reinforce the internalised ableism that we live with every day of our lives, to legitimise the view that a life like ours, one of dependence and often pain, is not for living. I cannot support that. No matter how hard or intolerable life can be for disabled people, there must always be hope that our right to practical assistance and support to live will be there. If this bill passes, there's a risk that it will be easier to access help to die than help to live. From fighting to go to the same nursery as my sister, to delaying university for 2 years because I couldn't get a care package. From fighting to be allowed to travel on the same bus as my husband, to fighting to get a bathroom adapted so that I could have a shower. Absolutely everything I have has been a fight. I even had to fight to keep overnight care, so I could go to the toilet because the council said it would be cheaper for me to lie in incontinence pads. Presiding Officer, that was the fight that nearly broke me. I was ill, crying every day, and the pain from my advanced stage arthritis got worse because I was worn down fighting. And during the pandemic, so scared of other people's power over our lives we could see others devaluing daily, my husband and I wrote letters to each other, making it clear we wanted to be resuscitated. I am one of the most empowered people in this country, and I have been broken by how hard it is to get the help that I need to live like the rest of you. When I have the support I need, when I'm not fighting, I and people like me can live well. We can thrive. That is what this Parliament is for. We are here to legislate to empower everyone in this wonderful country to live well, including at the end. But even when my pain is intolerable, it is the everyday ableism and discrimination that makes me feel like I can't go on. It's the lack of support, the lack of options that makes me feel like I can't go on. Disabled people don't have real choices in life, Presiding Officer. There will be countless disabled people in our constituencies tonight who haven't had the choice to have a shower in weeks. People who can't choose when they go to bed, some who will already be in bed. People who can't choose what to eat. People who can't choose to go out of their house because it isn't accessible. People who tonight can't choose the care or the health care they need, including at the end, because it simply isn't available for them. And crucially, there will be disabled people whose struggle is so hard that they've given up hope, given up fighting, and will be considering tonight taking their own lives. I know this because I have been all of these people I've described. They live in fear every single day, worrying about what new limit someone else will put on their lives and what little power they will have to change it. They live every single day without choice at all. It is inconceivable to suggest that the introduction of assisted dying is about choice when disabled people do not have choices in life. In a world where so many have little or no choices, we cannot risk making death the only choice they ever have. If this bill passes, in a world of inequality, it will be easier to access help to die than help to live. That's why I'm asking colleagues to vote against this bill tonight. Presiding Officer, I don't have much to lose when it comes to my body or my functions. And I too am scared of losing what I have like others are. Of course I am. But I know that life can be good when we create a society where we have the support to live it and live it well. Please, colleagues, vote against this bill. Choose to make it easier to live than to die, not the other way around. Thank you, Presiding Officer.
Thank you, Ms Duncan Glancy. I now call Evelyn Tweed to be followed by Paul O'Kane. Ms Tweed.
Thank you, Presiding Officer. I am going to start my speech with the words of Kate Buchanan, who was a constituent of mine. Kate said, "I don't want to die, but I am going to. I want to be just like the rest of you, not thinking of dying all the time. But I can't. It consumes me. It totally dominates my living, worrying about what is going to happen to me and my family. I want my children to not see me suffering. I want to mitigate that. And the only way I can see that happening is through this bill passing. When you are debating this, think of me and think of my family and all the other hundreds of families that are going through exactly the same thing. And do right. Do right for Scotland. Kate died in October 2024. Kate's husband, Roger, shared these words with me. My wife, Kate Buchanan, was an active supporter of the assisted dying bill. It has come too late for her to benefit. She found a lump in her breast in September 2023 and died in October 2024. She was fairly well until August 24 and continued to have good days until mid-September. She was lucky enough to receive excellent care from Strathcarron Hospice for the final 5 days of her life, where the staff were unfailingly kind and responsive. But even the best palliative medicine has its limits, and Kate knew that. It wasn't the death that she wanted. Actually, she didn't want to die. She loved life, but she knew she was going to die soon. She had stockpiled some medications to be able to take her own life, but ultimately we decided we didn't have the knowledge to be sure of using them effectively and safely, and we didn't want to put a friendly GP or a GP friend in a difficult or unlawful position by asking for advice. He went on, while Kate was an effective supporter of the assisted dying bill, she had a flaw as a campaigner. She was ill. She was dying. She wasn't going to be able to see the campaign through to the end, something she shared with many other supporters of the bill. Kate was very conscious that this wasn't a characteristic shared by many of the campaigners opposing the bill. And so that brings me to the point that she tried to make in her campaigning. That is the task of you as MSPs to keep her and her fellow dying and dead supporters of the bill in mind, to represent as elected lawmakers those constituents who are no longer here to put their point across, to have the courage to imagine having that difficult conversation with a loved one about how they wish to die. When it becomes apparent that death will come unavoidably soon, this bill has come too late for Kate, but it's not too late for us to vote for assisted dying and to give terminally ill people like Kate the death that they wished for. Remember Kate's words, Do right for Scotland. Thank you.
Thank you, Ms Tweed. I call Paul O'Kane to be followed by Ross Greer. Mr O'Kane.
Thank you, Presiding Officer. This is undoubtedly the most consequential decision we will make in this session of Parliament, just 5 days before its conclusion. And indeed, it is one of the most consequential decisions that this Parliament has ever made in its relatively short existence. For many this evening in the Chamber, present as MSPs, they will have made their final speech knowingly in the debate, and we've heard some of that already. For some in the Chamber, they will make their final speech unknowingly. And of course, for some, they will return to this Chamber again to make speeches in coming years. Because nobody's place in this Parliament and nothing we do here, Presiding Officer, is certain. Of course, as we've heard already referred to by colleagues, the only thing that is certain in life is death. And in these past days, weeks, months and years, we have debated what it is to die, what it is to have a good death, and how we support people in our society throughout their life and in its completion. So I want to begin, as I did at stage 1, in acknowledging the variance of views and experiences that have been shared with me by constituents and from so many others across the country, shared with genuine concern, passion and honesty. Presiding Officer, I will vote against this bill this evening, but I want people to know that I do so with a genuine respect for those whom I have found that I cannot agree with, including Liam MacArthur, the member in charge of the bill. In stage 1, I set out my key concerns on coercion and the deep concerns that disabled people have communicated to me in relation to this bill, not just in my time in this Parliament, but throughout my career working with people who have a learning disability and their families. In stage 2, I followed growing concerns about the right for conscientious objection for healthcare professionals and organisations, and as colleagues will have followed in my amendments last week at stage 3, I sought to enhance protection from coercion, mandate training on it, and provide an opt-out for organisations, particularly those with a faith ethos. And it's on the failure of that amendment that I will dwell briefly. I cannot fathom why we would pass a bill that does not provide a sufficient safeguard and the right of conscience for organisations in this country who have provided care for hundreds of years. These organisations and institutions are at the heart of our communities, and whether you have faith or you do not have faith, those organisations and their staff have walked with, have laughed and cried with, and have held the hands and the hearts of those in our community in the darkest of moments. They cannot be allowed, Presiding Officer, to simply be put into the annals of history. They have a place and they belong in our communities, and they must be protected. And my amendment that sought to do that only failed by 4 votes, which was markedly different from the margin that passed the general principles of the bill at stage 1. Of course, my opposition to this bill goes beyond just the amendments that were passed or not passed last week. I fundamentally do not believe that we debate this issue on a level playing field. We have heard a vast amount of testimony from disabled people about their fears if this bill were to pass. That isn't imagined. It doesn't come from nowhere. It comes from the daily lived experience of disabled people and their families. Where in a country as rich as ours, as democratic as ours, and as socially aware as ours, too many disabled people feel like they are not heard, not seen, not valued. They are our colleagues, our constituents, our neighbours, our friends. And this is no longer a debate, Presiding Officer, for the kitchen table, or for the pub, or for the radio. It is a monumental decision before us, and we must hear their voices. And in concluding, I come back to the comments I opened with about certainty. Our time in this place will come and go. The debates we have, the victories that we mark, the disappointments we experience will fade. The decision we make tonight will be lasting, and its impact will be wide. And we must look disabled people in the eye and assure them that we can give them safety, dignity and protection the things that they need to live their lives. I do not believe we can do that. And if there are colleagues tonight who even now at this hour are unsure about that or any other aspect of this bill, they must join me and many others across this chamber at decision time, and they must vote no. Thank you.
Thank you. I call Ross Greer to be followed by Humza Yousaf.
Thank you, Presiding Officer. I said at stage one that I supported the principles of this bill, but not the specifics. I believe that the circumstances of our death should be as safe and compassionate as possible, but for too many people suffering prolonged and undignified deaths in Scotland, that is not because of a lack of effective palliative care. There's a total consensus in this Parliament on the need to improve Scotland's palliative care services, but that is not enough for everyone at the end of their life. People still suffer over their final days and weeks, whether they effectively starve to death, when they lose their autonomy and the dignity that for them is rooted in that autonomy. The first draft of this bill didn't get the balance right between affording those at the end of their life that option and giving sufficient protection to vulnerable individuals. But it's to the credit of Liam MacArthur and a great many other people inside and outside of this Parliament that it has been so significantly strengthened. Daniel Johnson secured the most important change, the 6-month prognosis. And I recognise that this will disqualify some people who perfectly legitimately, in my view, and without any external pressure, wish an assisted death because of their illness. But it hugely reduces the risk of vulnerable people being coerced into something they would not otherwise choose. It's not perfect, but it ensures the system is only for those approaching the end of their life. I'm grateful to the Health Committee for agreeing to my proposals for an advocacy service for any patient who wants it, and to all MSPs who supported the further changes last week to make that service stronger. The advocates would provide an essential service, helping patients to navigate this system, to know their rights and their options, and to act as an additional safeguard against coercion. On top of that, the patient must have palliative care options presented to and discussed with them. The doctor must inquire about indirect pressures, including issues like financial pressure, and they must discuss potential coercion. The assessments by both the medical practitioners involved have been strengthened to include requirements for assessments to take place in person, and by medics who have met the patient on more than one occasion. Thanks to Ruth Maguire, there is an additional structured assessment at the point of the second declaration that must take place in private. That is an important protection against coercion by partners or caregivers in particular. I am frustrated, though, that the very late concerns around legislative competence created so much uncertainty last week. But we can be absolutely clear now. If this bill is passed, it will not commence until arrangements are in place to ensure that no worker is ever required to participate, that any worker who exercises their right not to do so is protected from any detriment as a result, and that training and qualification requirements have been set for the professionals involved. And that leads me to what I think is an important point here. This is the final vote on the principle, but if this bill passes, it is not the final vote on whether or not the system actually commences. Once those provisions are in place to protect staff and to set training and qualification requirements, commencement regulations will be tabled in this Parliament. And if Parliament considers any of those to be inadequate, those commencement regulations can be rejected and the system will not start. The guidance necessary for the system to operate will also be subject to a resolution of this Parliament, a further safeguard and a further opportunity for Parliament to exercise its rightful control. I respect that that might not feel like a sufficient safeguard for some, but it is for me. And I want to close by repeating what I said in the Stage 1 debate. I sincerely believe that this is not an issue that should be decided by opinion polls. Organisations on both sides have shown that you can get whatever answer you want, depending on how you word these questions. The public have put their trust in us to make this decision on their behalf. It is the most important decision that I can imagine this Parliament making. And for my part, I cannot reconcile myself with the prospect of denying those facing a life-ending illness the dignity of dying on their own terms. So I will vote for the bill this evening.
Thank you. I call Humza Yousaf to be followed by Maggie Chapman.
Can I echo other members by thanking Liam MacArthur for the approach that he is taking and has taken in engaging with members right across the chamber on both sides of this debate. And I don't think that there's anybody better suited, neither in temperament nor in terms of his engagement, to have taken such a sensitive and complex bill to this chamber. So I sincerely thank him. And I echo what Liz Smith said, that I think this debate, throughout the stages, stage 1, stage 2, and here at stage 3, has been an exceptional demonstration of this Parliament at its best. And it is perhaps cheeky of me saying this as I leave this Parliament, and somebody who has been an MSP for 15 years, 12 years in the government and never voted once against the whip. But perhaps less whipping in this Parliament might not be a bad thing after all. Presiding Officer, what is likely to be my final contribution as an MSP? I can't think, as others have said, of a more consequential piece of legislation than speaking on this bill. In 15 years in this Parliament, like so many of my colleagues, I've cast hundreds, if not thousands of votes. Day after day, we come to this chamber, and more often than not, we vote as instructed by that slip of paper handed to us by our whips. But today there is no party line, no whip. Today, every single member must be guided not by a slip of paper, but by the weight of their own conscience. And my conscience tells me this: a society that leaves someone with a terminal diagnosis believing that their only options are to either endure intolerable suffering or end their life prematurely is a society that has failed them. I refuse to accept that these are the only two choices available. There must be a third one that gives people comfort, relief and, yes, dignity in their death, without sending the message that ending their life is the only option available to them. As someone who has taken a number of bills through this Parliament, and dare I say one or two that have even courted some controversy, I know how carefully we must think about the unintended consequences of legislation, especially legislation like this one that is born of good intentions. We have, over the years, corrected bad law. We've amended acts. We've even repealed acts. But this bill is different. Because when the unintended consequences are death, there's no correcting it afterwards. No repeal can reverse it. No secondary legislation can undo it. Death is final. And even many of the bill's strongest supporters have had to concede that there is no absolute cast iron safeguard against coercion. Coercion is not always loud. It's not always an overt threat. Sometimes it is quieter than that. Sometimes it's a look, a sigh, a hesitation, a sense that you are a burden, a feeling that your family would simply be better off without you. And that is what troubles me the most. That is not to say that those who argue passionately for the right of an assisted death do not have a case. Of course they do. You'd have to have heart of stone not to be moved by some of the testimony we've heard. I know that from personal experience. When my uncle died from pancreatic cancer aged 54, I washed his body in preparation for his funeral, as is our Islamic custom. He had been a stocky man, 5'8", 13 stone, before his diagnosis. By the time he died, he weighed just 6.5 stone. And as I washed him, I could feel his bones protruding through his skin. When he died, I felt grief, I felt heartache, but I also felt relief that he was no longer suffering. So I say this with real empathy for those that are facing terminal illness, pain, fear and loss of dignity. But if, to give a small minority this option, we create a law under which even one person ends their life because they feel guilty, dependent, or like a burden, then this Parliament will not have made compassionate law. It will have made dangerous law. And when disabled people's organisations warn us, when domestic abuse organisations and experts warn us, when those who know what it's like to live with dependency tell us that this law could expose people to pressure that they may never name as coercion, then we shouldn't just hear them, we should listen to them. So to colleagues who remain undecided tonight, I simply say this. If you are not absolutely certain that this bill can protect those most at risk, then do not pass it. Because if even one person chooses death, not from true autonomy, but from quiet pressure, then that is one person too many.
Thank you. I call Maggie Chapman to be followed by Douglas Ross.
Thank you, Presiding Officer. I believe life is precious. I believe life is a gift. I believe deeply that all life has inherent worth. That worth does not diminish with illness, with disability, or with proximity to death. But valuing life is not the same as insisting that life must be prolonged at all costs, in all circumstances, regardless of the suffering, regardless of the wishes of the person living it. I believe in bodily autonomy. I believe in choice. I believe in the compassionate principle of being able to choose a good death. This debate has never been abstract for me. It's about family members, friends, constituents facing the end of their lives, in pain, in fear, and far, far too often without the control, dignity or peace they deserve. Liam MacArthur's bill asks us a simple but profound question. Do we trust people in the most difficult moments of their lives to make decisions about their own bodies, their own suffering, and their own death? For me, the answer is resolutely yes. People across Scotland have been talking about this question for years. Many are asking for honesty, for autonomy, for compassion. The majority of our constituents agree with the Humanist Society of Scotland that this is about compassion, dignity, and the fundamental right to choose. And we should be clear, this bill is not about abandoning care. Organisations like Dignity in Dying remind us that good end-of-life care and assisted dying are not opposites, but partners. They argue everyone should have the right to plan and control their own death, supported by robust safeguards and high-quality care. I agree. We must invest in palliative care, absolutely. But we must also recognise that even the best palliative care cannot relieve all suffering. I have also listened carefully to people of faith. Quaker voices in particular speak powerfully of conscience, compassion, and the importance of accompanying people with love at the end of life. While there is not unanimity, many emphasise that moral agency and care must go hand in hand, that we do not turn away from suffering, but respond to it with humanity and respect. I do have concerns about aspects of this bill, particularly the 6-month prognosis requirement agreed last week. Prognostication is not an exact science. Clinicians themselves have told us that predicting life expectancy can be deeply uncertain. By setting an arbitrary limit, we risk excluding people who are suffering unbearably, but do not fit neatly into that timeframe. I believe eligibility should be based on suffering and autonomy, not a rigid estimate of time remaining. In our deliberations, we've heard personal testimonies, a wealth of evidence, the lived realities of those at the end of life. We've also heard fears about coercion, vulnerability, about the lack of decent palliative care, about the message this sends to disabled people. I take these concerns seriously, but I believe the answer to these concerns is not to deny choice altogether. It is to design care and safeguards that are strong, transparent and rooted in trust. Because right now, the absence of a legal framework does not mean the absence of assisted dying. It means inequality. It means that some people, those with means, travel abroad. Others take matters into their own hands, often in horrific, traumatic and lonely circumstances. That is not a compassionate status quo. So I come back to the people at the heart of this debate, those facing the end of their lives, asking not for the impossible, but for dignity, for agency, and for peace. We cannot remove death, but we can shape how people meet it. And I'm so very grateful to Liam MacArthur for giving us the opportunity to shape our own deaths. Let's choose compassion. Let's choose dignity. Thank you.
Thank you. And I call Douglas Ross to be followed by Daniel Johnson.
Thank you very much, Presiding Officer. And like others, could I recognise the incredible work that Liam MacArthur has put into this bill in the last week, the last months and this entire session. Before I knew the make-up of this Parliament and the views of individual members, when I heard the bill was being reintroduced again for a third time, I thought it had the best possibility of passing because of the member in charge. Liam MacArthur is a rare politician that is very difficult to dislike. He is someone who works across the political spectrum, is compassionate, is empathetic and is absolutely committed to this cause. And no matter how this vote goes tonight, and the fact that less than 2 hours away there are many of us still unsure how this vote will go, is down to his efforts, the efforts of his team and the Non-Government Bills Unit. And I do want to put on record, as someone who will not be supporting this bill, my complete admiration for what he has done to get this very passionate, this very difficult issue to the floor of the Chamber in the way in which he has done it. And I won't be supporting this bill, but it is one that has caused me more trouble than any other vote I have taken, because as Liam MacArthur said when he was quoting Lisa Fleming, we have all had constituents, many hundreds or thousands, who have written to us about their personal experiences. They have been some of the most difficult and distressing emails and letters to read and respond to, and you would have to have a heart of stone not to understand the pain and suffering they have gone through and how they want to alleviate that for themselves or their loved ones going forward. Also, others have spoken about their family connections, and I thought George Adam once again spoke very passionately about his wife and his family. In my family, my wife takes a completely different view from me. She has always been so much in favour of this bill and cannot understand why I would not be. So this is an issue that doesn't just split parties, splits families, it splits couples, and there is no right answer. Because at the end of the day, each and every one of us will take a vote and will be able to defend it one way or another. But for me, it comes down to some of the issues about what's not in this bill. And the conscientious objections that were taken out of this bill for understandable reasons and the requirement for a 104 order do raise concerns with me. But they also raise concerns with the Royal College of Psychiatrists, who moved from a neutral position to a position of opposition on the bill, and from the Royal Pharmaceutical Society, who similarly said that because the bill doesn't contain vital protections for pharmacists and other healthcare professionals for conscientious objections, they could no longer remain neutral on the bill, and were urging members to vote against it. Another issue that I've wrestled a lot with is the issue of coercion, and we have heard many members speak about this tonight. If we cannot be absolutely certain, absolutely sure that no one will feel coerced into taking their own life because they feel a burden or because of the efforts of others, we cannot support this bill. I'll give way to Russell Finlay.
Russell Finlay.
Thank you, President Officer. I too fear that this bill cannot prevent coercion. You cannot legislate for human nature and human fallibility. Having changed my mind, I'll be voting against assisted dying tonight. And I'd like to ask the member if he agrees that if any member at this late stage tonight is still in any doubt, the responsible thing to do would be to vote no.
Douglas Ross.
I'm grateful for that intervention, and I understand that members will still be in doubt at this late stage, despite all the debate we have gone through, because it is such a difficult decision. But as Hamza Youssef just said in what I thought was an excellent speech, if just one person ends their life as a result of coercion, then this bill has failed. We have failed as legislators, as Parliament has failed, and we cannot allow that. I just want to briefly end on 2 points. Liam MacArthur has said before tonight, and others have said in the Chamber, including Rona Mackay, Patrick Harvey and Alex Cole-Hamilton, that this bill is the most heavily safeguarded bill of this type anywhere in this world. And that sounds really good. That sounds very comforting, but I have seen no way to assess or judge that statement. I would love that to be true. I'm just not sure we have the data or the background to support that. And finally, a voice I thought we might have heard before in this debate, but we haven't, and I want to close on this. As the enormity of this decision weighs heavily upon us all, I've listened to experts. And this morning we had an intervention from someone who I have respected for some time. Sir Harry Burns was this country's Chief Medical Officer from 2005 to 2014. And for him to write this morning about the bill and urging MSPs to oppose it, I think is something we have to listen to carefully. And he said this: "We may have no cures for their physical illness, but we can and we should give them a sense of control over their lives, not a pathway to death." I don't want to give people a pathway to death, and if this bill and the proceedings around it have done anything, it is to ensure that this Parliament and the next government prioritise palliative care and hospice care, so we can ensure people can live their lives to the fullest opportunity for as long as they can, not give them a pathway to death. Thank you, Presiding Officer.
Thank you. I call Daniel Johnson to be followed by Michelle Thompson.
Thank you very much, Presiding Officer. And if there's one thing that's clear, is I think this whole Parliament is united in our, frankly, almost nauseating tribute to Liam MacArthur, but it is deserved. And I can say on a very personal level, our most recent conversation about this bill, I just wish that disagreeing with people was always so agreeable. And that is a genuine personal tribute. And this is a bill that I have found difficult. I'm somebody that was opposed to the previous legislation that came before this Parliament. But in examining this, I, from first principle, asked myself, is this something that I would want to exercise if I was terminally ill? And I concluded that I would. And did I think that people should have an option? Do they have autonomy? And I think they might. But I don't believe that people make decisions in isolation. They make those decisions in the context of community, society and family. And ultimately, when we legislate, we create expectations, we create norms, we create expectations of how people will behave in certain ways. And therefore we have to ask ourselves whether we have the safeguards and protections that that needs. And therefore we have to ask ourselves, what kind of bill do we have? And I asked this at the beginning of the Stage 3 amendments. Is this a permissive bill, or is it a precautionary one? Is it one that enables people to do things, or does it provide people with an option in extenuating circumstances with safeguards? And unfortunately, in my view, we've arrived at a bill that is the former. And yes, we have introduced many additional standards, considerations, procedures, but ultimately what this bill boils down to is a decision that will be afforded to people on the basis of two medical practitioners' judgment. Yes, based on experience, yes, based on training, but two people's judgments. Now, that is why I think the Section 104 orders is problematic. It's not because we won't have a say, we will. But the detail of that is so critical, and we will not be able to scrutinise that. We will not be able to challenge that. We will be given a binary choice. But also further, in terms of those two doctors' judgment, there is no external check, there is no point of escalation, there is no oversight of those decisions. And I think when we listen to the external Royal Colleges, we must listen to the detail. It's not just the protections for conscientious objection. The Royal College General Practitioners said in one of their principles that there is a lack of independent and transparent system of oversight, monitoring and regulation. And that is what this bill lacks. Because a great number of members have said that this bill has more safeguards than any comparable piece of legislation. That is simply not true. If you look at the other Australian legislation, if you look at where this has already taken place, there are 3 external safeguards that virtually all of them have. Half of the Australian jurisdictions of legislation have a permit-based system, where every request has to be externally approved on a permit basis. And even those which do not, every single Australian jurisdiction has 2 forms of external oversight. A tribunal, by means that individual requests can be escalated and assessed, both by the individual themselves, the medical practitioners, or those who have immediate concern for the individual, i.e. family members. They also, each and every jurisdiction, has an oversight board, which oversees the implementation, assesses individual requests, is able to make referrals to other authorities, including the police, but can also provide advice to government and provides an ongoing statutory review and recommendation. We have neither of those oversight or safety mechanisms in this legislation whatsoever. What we have is a narrow bill, and yes, one that has improved numbers of considerations that we're going to ask those medical practitioners. But ultimately, it boils down to two doctors' opinions. Doctors who can make mistakes, can make errors of judgment. And yes, they may make referrals, but no amount of referral will stop those errors or those mistakes. Now, very often when we legislate in this place, good enough is good enough. Legislation, by necessity, has to be a matter of compromise. But this is not an area where we can afford compromise. Good enough is not good enough. And I say to members, if you are seeking solace from the statements of people in this chamber that this bill has more safeguards than any comparable legislation, you are mistaken. And if you do not believe that those safeguards are in place, do not vote for this legislation.
Thank you. I call Michelle Thompson to be followed by Douglas Lumsden.
Presiding Officer, this will be my last speech in this chamber, and I'm proud that it is this bill, one where we are all free to be colleagues acting on behalf of our fellow Scots, regardless of our view or our vote this evening. I'll begin my remarks by considering the philosophical tension underpinning this proposed legislation. On one side, the proposals before us can be seen as a continuation of individualism, now described as agency, and in the context of this debate, the ability to make choices about the manner and timing of one's own death. On the other side, we are reminded by philosophers such as Marcus Duvel that, and I quote, "In the concept of human dignity, questions about the role of humanity, the rights of individuals and the structure of our normative social and political orders are interconnected." In essence, we confront a profound fault line between two fundamental considerations: respect for individual choice and autonomy, and recognition of human vulnerability and the state's duty to protect life. But, Presiding Officer, we will not settle this philosophical dispute this evening, and certainly not through the binary vote each of us must cast. I said during the Stage 1 debate that whatever our vote, harms will occur. They occur already. Terminally ill people sometimes starving themselves to hasten death. Others are slowly over-medicated until life ends. We've heard multiple examples from colleagues, and this is our status quo. My greatest concern in this process has been the risk of coercion, and members will know my particular interest in the protection of women. That concern led me to support many of the safeguarding amendments, even in the knowledge that doing so makes any bill we may pass this evening more complex and at times more unwieldy. That said, coercion cuts both ways, and I've heard first-hand evidence from families who exerted significant pressure on their loved ones not to go through with their final wishes. A further significant concern relates to the decision that key aspects of protection and regulation will now be handled through a Section 104 order rather than via Section 30. Even although Section 104 orders are commonplace, like others, I remain unconvinced by the UK Government's reasoning. And it's a sober reminder that power devolved is power retained. And I caution those who believe that, should this bill pass this evening, the choice they hope for will be immediately and seamlessly available. Politics will not end with tonight's vote. If part of our job is to pass good legislation, and it is, then we must recognise that no bill is ever and can be perfect. This one is no exception. What we can say is that the member in charge has conducted this process with courtesy, respect and a genuinely open mind. And I also commend the Scottish Government and the Cabinet Secretary for Health and Social Care in particular for the way they have handled this difficult terrain. For my part, I will vote for the bill. It's not an unqualified vote, but an on balance, all things considered, and hopefully reflective yes. For those who remain uncertain, let me offer one final reflection. Yesterday, whilst visiting my own doctor, then my elderly father, and in speaking with his carers, and then talking to local constituents, I asked people informally what they thought. Now, it's by no means rigorous research, but every single person I spoke to expressed support. And I believe the public are ahead of us in this matter. And they look to us to create the progressive, dignified, supportive and enlightened Scotland they seek. But whatever the outcome this evening, the margin must be clear enough to give confidence that this Parliament has reached a decisive conclusion. So those of you who may be considering abstaining, I urge you to vote so that we have the clearest indication we can of the will of this Parliament. Thank you.
Thank you. I now call Douglas Lumsden to be followed by Monica Lennon.
Thank you, President Officer. And can I also pay tribute to my friend Liam MacArthur? I can only imagine the emotional toll that this process has taken on him. And whatever the result of tonight, he has done a brilliant job highlighting the suffering that so many people are forced to go through at the end of life. And, President Officer, I wasn't actually planning on speaking in today's debate. I spoke at stage one and thought I'd said everything I wanted to say, but I thought that this will be my last chance to speak in a debate this session of Parliament, and maybe my last chance to speak forever, as Paul O'Kane has pointed out. And, President Officer, I couldn't look myself in the mirror if I didn't do all I could to try and get this bill approved. Now, I didn't take part in stage 2 or stage 3 amendments, but listened carefully to what everyone was saying. And I must admit, I was saddened sometimes listening to some of the debate last week. We heard a lot about doctors, nurses, lawyers, managers, social workers, and at times it felt like we'd forgotten what this bill was all about. It's about people. This bill is about people suffering and what we could do to make their deaths as dignified and as pain-free as possible, giving them a choice when the end has come to reduce their suffering. We need to remember that when we vote tonight. It's about the person who is suffering and giving them a choice. And, Presiding Officer, much has been said about palliative care. And of course we need palliative care. And of course we would all like it to be better. But palliative care is no magic wand. It's not like taking a couple of paracetamols to get rid of a headache. It doesn't remove all the pain and make everything all right. People should still have a choice when the pain becomes unbearable. It's not an either-or when it comes to this bill. It certainly is not. And, Presiding Officer, like many people here, I've got emotional over this bill. I've had conversations with those closest and dearest to me about this topic, a topic that no one likes to talk about, which is death. And it's going to happen to us all, and we should be able to talk about it. But it often seems too hard to do just that. And as I said at stage one, I think I would never be able to have an assisted death. I think I would fight to have my last possible breath, but I can't be sure. None of us can be sure. None of us here can be sure, because none of us are suffering in the same way that some people are having to suffer right now. And we all have stories. My story I want to tell is about a friend of mine caring for his mother at the end of her life. She was hooked up to morphine, but begging her son to end her suffering. Now, he will live with the guilt that he was not able to help his mother more when the pain was unbearable and all hope had gone. And this is what we're putting people and their families through. But today, we can change that. As I said at the start, this may be the last time I speak in here, but if it is, and if this bill passes, I will feel that I've achieved something in my time here. I will have played my part in reducing suffering. Because we have an opportunity here today to reduce the suffering that some at the end of life are forced to go through. So I appeal to all colleagues who have not made up their mind. We have an opportunity here today to show that we are what a compassionate place Scotland can be. We have an opportunity to reduce suffering at the end of life, because we have all heard too many stories of people having a bad death. Well, we have the opportunity today to make that better and to make a difference. Assisted dying in this bill doesn't mean more people die, it means less people will suffer. So please don't let this opportunity pass us by. Let's not kick the can down the road for others to make that choice later on. Let's show that this Parliament works and truly represents the majority of people outside of here who support this bill. Thank you, Presiding Officer.
Thank you. I call Monica Lennon to be followed by Lorna Slater.
Death is a universal experience, yet it remains a difficult subject. We all approach this debate with a profound desire to live. People asking us to support this bill would certainly rather live, but for many of them, that choice has been removed by a terminal diagnosis. I think of my constituent, Joanne, and her father, Robert, a retired firefighter. The unbearable reality of Robert's terminal illness led him to beg his family to help him die. Too many families have been in that position. Too many people have experienced an agonising death against their wishes. Yet it remains taboo, consigned to the too difficult box. So I thank Liam MacArthur for creating a respectful space for the stories of dying Scots and his immense capacity to listen. I also honour those who shared their most painful moments so that others might not face a similar lack of choice. In a recent interview, I listened to Lorna Slater, who spoke movingly about her father's beautiful death in Canada. I know that holding a loved one's hand at the end is a sacred privilege, but for some, the law makes that peaceful holding of our loved ones impossible. The Scottish Government has confirmed that this bill is within our legislative competence and is deliverable. We have vital clarity that commencement will only happen once employment protections and conscientious objection rights are in place, as well as requirements for training and qualifications. The views of clinicians are important, but I was struck by the words of Rona Bailey, OBE, who is the Chief Executive of the Prince and Princess of Wales Hospice. In a letter to all of us, I hope that all MSPs have had a chance to read her words. Rona is a supporter of change with over 40 years nursing experience. She's advocating for a rights-based approach centred on the patient. And I am heartened to hear that her hospice is adequately prepared to engage with the new legal and clinical framework should this bill pass. I have seen the work of our hospice movement firsthand, even walking through fire for Kilbride's hospice. But to those who argue this is not the time because our systems are underfunded, join me in demanding that hospice-led palliative care no longer relies on bake sales and raffles. Assisted dying is not a replacement for palliative care, it's additional. Our views on how healthcare should be in the future must not be used as a cover to deny individual choice today. Whatever our own beliefs and preferences, our decision must be transparent and honest. Vote on this bill, not on one that doesn't exist. Our responsibility is not to judge, but to provide a compassionate, safe choice for terminally ill people who want to have that choice. Voting for the status quo is not a neutral act. It will deny safeguards, hope and compassion to many. So, Presiding Officer, tonight I will vote yes for choice, for agency and dignity for dying
Thank you. I call Lorna Slater to be followed by Jamie Green.
My father chose to have a medically assisted death. He died in November 6 last year. The process to access assisted dying was not straightforward. My mother, who was devastated by his decision but understood it, had to initiate the process and find the doctors and nurses with the right training. Because this service was not offered by the palliative care facility where he was, she had to find people who were willing to attend from other facilities. And then, of course, Dad had to go through all the interviews, the paperwork, and the cooling-off period. At each stage, the medical practitioners tried to dissuade him from proceeding. The reality is that only people as comfortable with administrative paperwork and as determined to work through complicated logistics, arranging in-person meetings, multiple in-person meetings and so on, setbacks, as my well-educated middle-class parents could have made that happen. When the doctor arrived, he gave what he called his butter chicken speech. "Hello, Mr. Slater, I see you're here with your family. That's lovely. We don't have to do this today, Mr. Slater. I can come back next week or next month. If you would even like to just have butter chicken with your family tonight, we can make sure that you can do that." Dad had to energetically and, to be honest, quite grumpily, insist that the procedure go ahead. Dad was very ill. He was dying and had been moved to a palliative care facility a few months earlier when that became clear. He had excellent care. My mother spent hours with him every day, and he saw his grandkids regularly. He knew that he wasn't going to get better. He would never be able to play Scrabble with my mother at the kitchen table again, or walk in the woods bird watching as a citizen scientist, his favourite thing in the whole world. On top of the daily discomforts of tubes and injections, of being lifted and moved, of interventions and medical procedures, of being rushed to hospital in the middle of the night when something went wrong, my father was afraid that he would lose capacity, that it would come the moment where he would lose the ability to make choices and to understand what was happening to him. He knew he was going to die, and he wanted to do it in the bright light of day, surrounded by his family while he knew who we were, before he could be incapacitated by pain or by pain medications. He was ready to go. He didn't want to risk gasping out his last alone and afraid in the dark of the night. My middle sister and I live a long way away from my parents, and his choice meant that he knew we would be there and that he wouldn't die alone. It gave him the comfort that my mother wouldn't have to cope alone, coming home from the hospital alone to an empty house. Originally, only my mum was going to stay in the room during the procedure. But as the nurse was getting things set up, my mum gestured for us to stay. And the nurse said to me and my sisters, "Don't feel like you have to leave. This isn't going to be traumatic. Your dad will fall into the best and deepest sleep he's ever had. He'll probably even snore a bit." And that is exactly what happened. Mum climbed into the bed to cuddle him. We girls held his hand. I got to hug him. And he told us he loved us. He told us to look after my mum. And he fell asleep. He did snore a bit. It was beautiful. I wish that death for myself. I wish it for anyone who wants it for themselves. I don't mind if you would never want this choice for yourself, but please, please don't prevent other people from choosing it for themselves. We should all have the right to choose.
I call Jamie Green to be followed by Ruth Maguire.
Thank you, Lorna. That was beautiful. I think we've heard some of the most profound and powerful speeches I've ever heard in this place, and I thank all members for that. On a more positive, friends, I celebrate another year alive this week, but I do so whilst also remembering those that we've all loved and lost. It is bittersweet to end my time here discussing death. I passed this bill at stage 1, like others, to let it run its course, and have said little since. I think we did it justice. Half of the amendments that passed came from those who opposed the bill. I wish we made more laws like this. But the debate ranged from fears of the worst of humanity on one side to well-meaning compassion on the other, and I think I sit somewhere in the middle, because there is always risk when making law. Our task is to weigh that risk up and mitigate where we can. No bill is perfect. So the question we must ask ourselves is not an abstract one. If I or someone I loved wanted that choice at the end, will it be there for them? I want to speak plainly and from the heart today because I was deeply conflicted by this subject. Presiding Officer, because whilst every one of us, yes, will die, few of us will have choice in the timing or manner of it. And some argue that is how it should be. Truth be told, I don't want to die. I am afraid of it. And after some recent ill health, I have spent many moments thinking about my own mortality. Will my death be quiet and peaceful, or accidental, or sudden, or painless, or painful? And in reality, our end-of-life choices are not always truly choices. DNR, nil by mouth, morphine, let nature take its course. But the one thing I cannot get out of my head is this: what if? What if palliative care can do nothing more for me? What if, in excruciating pain, I lose my dignity and control? What if I wish the end would come sooner and in a manner of my choosing? What if I would rather say my goodbyes with a smile on my face, perhaps a tear in my eye, than when I can neither see nor hear my loved ones? What if my body is spent, but my mind is staunch, and I decide my time has come? Regulated assisted dying already exists, disgracefully, only for those with the means to do it. Unregulated, unassisted dying exists by way of suicide, and that cannot be right. How is that in any way a choice? I fear a painful death more than death itself. So the dilemma I have grappled with is simply this: God forbid that day ever comes and I need that choice. Would I rather it was there or not? And you must ask yourselves the same question: there or not? And if I want that choice at the very end, then I must offer that choice to others. I have no privilege in death. If we vote to deny people that choice tonight, we deny everyone that choice, including ourselves, including people out there who one day might need it. And who am I to deny someone that most final of decisions in life? Dignity in death is not just a slogan, it is a right. When it comes to assisted dying, I believe in my heart of hearts that more people will be harmed by its absence than by its presence. And if we vote against this bill and it falls, I believe I would wake up tomorrow and regret it. And I think others in this room might too. I could not look someone in the eye in their dying days and tell them that I denied them that choice. I'd like to sum up in the words of Diane, who wrote to us all on Saturday afternoon. And she simply says this: it's better to have it and not need it. It's better to need it than not have it. It's my body, my life, and my death. Only I will know when enough is enough. Please grant me the choice to fulfil my dying wish. And I say to you, Diane, tonight I will do just that. And I plead with others that it's not too late to change your mind. No one will judge you for that. Vote to give me that choice. Vote to give yourselves that choice. Vote to give everyone that choice.
Thank you. I call Ruth Maguire to be followed by Sue Webber.
Presiding Officer, let me start by sharing my respect for Liam MacArthur. I find him to be a good parliamentarian and a good man. It does, however, remain a fact that consent, choice, free will and autonomy are not being experienced equally by all. My fear remains that for the estimated 1 in 3 women living with domestic abuse, even with the modest amendments to the bill around coercion, for some women, the danger that this legislation becomes another lethal tool to be wielded by an abusive partner is real. The deadly consequences for those women would be final. Presiding Officer, I normally relish debate, even when it looks like I'm going to lose, but today I feel really uncomfortable. This legislation frightens me, and I am someone who scares easily. I didn't get into politics to talk about myself and my own feelings, and this is certainly not a natural space for me to be in, arguing against something I'm fearful of rather than for something I believe will bring about a positive change or protect people. In what will be my last speech in this Parliament, I'm a little sad that my final contribution shares fear and not hope. But I'm scared that if this law passes because of the perceived positive impact on the small number of people who wish to end their lives early, that the negative and equally impactful experiences for many others and for our society as a whole will be immeasurable, and they won't be something we can come back from. As well as the casework I receive from citizens who are not having their needs met by the health and social care services at the moment, I do have direct experience of living with a diagnosis that will not be cured. My life will be shortened. I don't like saying that out loud, especially in front of you lot, but it is a fact. I find it really hard to put into words the impact that the language of dignity and compassion being used to talk about ending life has had on me, as if somehow wishing to carry on but with help is undignified and burdensome, unfair to people who love me. And that's just in the context of us talking about it in here. My blood runs cold thinking about sitting in a room in a hospital and having a doctor raise that with me as we weigh up treatment options. Presiding Officer, I share that thought in the full knowledge that people in my situation are not a homogenous group. And because I want colleagues to see that if it weighs so heavily on me, someone in a position of financial privilege, with a large, loving family who are able to care for each other, indeed someone whose job it's been for 10 years to have difficult conversations and debates and to have my own views and beliefs challenged, I want colleagues to see how this all plays out for people who don't have the privilege that we have. And in doing so, let's have our eyes open to the strain our health and social care systems are under. Not everyone is receiving the care they need. And if passed, this legislation will be funded from existing stretched budgets. What healthcare will we stop to fund this? Are we really going to be a country where the state funds dying while hospice care relies on charity? Consent, choice, free will and autonomy are not experienced equally by all. It's not a free choice if you don't have access to good palliative care. It's not a free choice if you have no family to support you and you're lonely and isolated. And it's not a free choice if you're grappling with poverty or other forms of inequality. Institutions cannot make a choice to opt out of this if it passes, meaning that some valued hospices and care homes will close at a time when we really need them. And as it stands, the bill in front of us, doctors do not have a choice when it comes to opting out. It is a fact, these protections have been stripped out of the bill, and there are no guarantees what they will look like, and this Parliament will not be able to scrutinise or amend them. Presiding Officer, today in voting against the bill,
I'm just choosing to vote for the inherent dignity of life, and I urge colleagues to do the same.
Thank you. I call Sue Webber to be followed by Alec Crowley.
Thank you, Presiding Officer. This has been deeply emotional this evening, and many members have spoken about the deaths of loved ones and how those experiences have shaped their views on assisted dying. And I want to begin by acknowledging that sincerity. None of us come to this issue lightly, and I do not question the compassion or integrity of those who will vote differently from me this evening. When I first entered Parliament, I instinctively shared many of the same instincts that lead people to support the principle of assisted dying. And across the chamber, two motivations have come through clearly. The first is the desire to reduce unnecessary suffering. The second is the desire to respect and protect individual autonomy. These are humane values, and they are values we all share. They are not dividing lines for us in this debate. But the real question before us tonight is whether those principles can be translated safely into the bill that sits in front of us. And having studied the safeguards proposed in this legislation and listened closely to debates throughout its passage, I have come to the conclusion that this bill does not provide that certainty. My greatest concern is the risk of coercion. Amendments have been made in good faith to strengthen the safeguards, and I recognise the effort colleagues have put into that work. But I remain unconvinced that coercion can be reliably detected in every case. And experts have highlighted how subtle and deeply embedded that pressure can be. In situations of domestic abuse, for example, people often come to see the world through the perspective of the person exerting control over them. They may not recognise that pressure themselves until they've had the time and space to reflect on their circumstance. The process set out in this bill simply does not allow for that depth of reflection. In legislation of this gravity, where the consequence is irreversible, even a small risk must weigh heavily on us. And I have also been troubled by the reliance on the Section 104 order to determine some key safeguards. And the matters such as conscientious objection and the training and qualifications required of medical professionals, they are not technical and minor details. They are fundamental protections. Yet we are being asked to pass legislation knowing that these aspects of those safeguards will be developed later through secondary legislation, subject to limited scrutiny and not shaped directly by this Parliament. We are legislating in one of the most sensitive areas of human life. Any uncertainty about how core safeguards will ultimately be defined is a serious concern. And throughout stages 2 and 3, I proposed amendments intended to strengthen this bill. And those debates did not provide reassurance for me. They confirmed that many important gaps remain. And I also remain concerned about how an assisting dying service would sit within the NHS. Because if a service were ever legalised, it must never become an expectation placed on patients or clinicians. Yet the structure of this bill risks embedding it as a normal part of NHS provision. And I received the letter from 370 healthcare professionals across Scotland, and there were many familiar names in that document with clinicians I've worked with for decades, ex-presidents of the Royal Colleges in both Glasgow and Edinburgh, and consultants and medical directors from Aberdeen to Wishaw. Presiding Officer, as we reach the end of this long and emotional debate, I believe there are simple questions we must ask ourselves before we vote. Can coercion always be detected? Are the safeguards fully defined and determined by this Parliament? And will this legislation avoid fundamentally changing expectations within the NHS, and that ultimately the doctor-patient relationship will change forever? If we cannot answer those questions with a yes, with complete confidence, then our responsibility as members of the Scottish Parliament is to be clear, and we must vote no. Thank you, Presiding Officer.
Thank you, Ms Webber. I now call Alec Rowley to be followed by Elena Whittam. Mr Rowley.
Thank you, Presiding Officer. I would first want to acknowledge every person who has taken the time to contact me to set out their views on this bill. Without doubt, this bill has generated more correspondence than anything I have dealt with in the 12 years I have been an MSP, with several thousand constituents contacting me to set out their views. As I said in the Stage 1 debate, some of the experiences people shared with me were heartbreaking, and I do understand with sincerity the strong views and beliefs and the legitimacy of the arguments on both sides of this debate. For me, the question around access to quality palliative care are crucial to this debate and to my decision-making. The mover of the bill has said time and again that it is not one or the other, and that access to quality palliative care should sit alongside access to assisted dying, and that people should have that choice. But we know this is not the case, and if this bill were to be passed tonight, then people dying would have access to assisted dying, but would continue not to have access to quality palliative care. So you will be in a position where you can be supported to choose death, but you will not be supported to choose life. It was just 4 weeks ago that I raised a question in this Parliament on the report published by Marie Curie, showing that 1 in 3 people in Scotland die with unmet palliative care needs. Now, I'm sure all of us in here would agree that this is an unacceptable situation. But for me, it is fundamental to the question that we are debating this evening. And I say again, if you are dying and you're not able to access the support and care you need, but you are able to access an assisted death, then you are being denied the choice of life. And that cannot be right, and it is not right. There are many other unanswered questions with this bill, but one I want to highlight is the cost of delivering this bill. It is unknown. The Scottish Government say there will require to be a degree of reprioritisation. In other words, you're being asked to support a bill that has many uncertainties about how it will be implemented and what it will cost, but we are being warned that other services will be cut to fund this bill. This surely is not right. In conclusion, Presiding Officer, I did find myself struggling throughout the Stage 3 amendments debates because there are legitimate arguments being made from both sides of this debate. I kept asking myself, what would you want at the end of life? Would you want to be able to make the choice of an assisted death? But again, I kept coming back to the first principle, which is that I would want to be able to exercise the choice of being able to access the support and care of quality palliative care. And if that choice is not available, then there is no choice. We have the power, the ability and the resource to prioritise palliative care and make Scotland a world leader. It is for these reasons that I believe that should be our priority, and I will vote against this bill tonight.
Thank you, Mr Rowley. I call Elena Whittam to be followed by Brian Whittle. Ms Whittam.
Thank you, Presiding Officer, and may I too thank Liam MacArthur from the bottom of my heart for enabling us and empowering us to debate this very important issue today. I can clearly recall last June staring at a message from my best friend for a full 5 minutes as the world around me fell away. 4 small words with mammoth implications. She has called it. I had known Madame Bergeron from the age of 19, and she was the very epitome of a classy French chic woman, always immaculately turned out, slightly aloof and sarcastic, and oh so determined. She both terrified me and awed me in equal measure. She had pioneering heart surgery when both of her kids were still teenagers and lived her whole life disabled, and yet she commanded every single room that she ever entered. Not always easy to live with, but loved fiercely by all of those around her. She had been living with terminal cancer for over 3 years, and it had consumed her entire abdomen. That day in June, she had sat down heavily in her wheelchair and felt something burst inside her very distended stomach. At that moment, she knew she would develop full-blown peritonitis and sepsis and would require all kinds of pain meds and sedation to try and manage her symptoms in a hospital setting before succumbing within the week. This was categorically not the path she wanted. She had lived with the very best of palliative care and also the palliative effect of being able to have an assisted death for most of those 3 years. In fact, she called it her security blanket. The fact had given her great comfort as she chose to live as long as she could with grace and courage. She was anything but suicidal. A Catholic of strong faith in the Quebec Roman Catholic tradition, she also said that she knew her God was merciful and that she had the support of her priest and her community when she set in train the plans that would help her to leave this world on her terms, the way she had lived her whole life. Natalie dropped everything to drive the 3 hours from Montreal to Shawinigan, where the family gathered for one last evening. There were tears and there were laughs. And boy, were there commands. Madame Bergeron was conducting like a symphony master. She wanted everything to be just so. Natalie recounted to me that she couldn't help but get frustrated by her mum's painstaking choice when trying to settle on her final pyjamas and dressing gown, until she realised her beloved mama was dying as she lived, elegant and oh so bossy. The house was full the afternoon Nicole Bergeron died, peacefully dressed in white daisies. Her bed was surrounded by loved ones who shared the most tender of moments. She was able to speak to each of them, and the words she spoke to my best friend were the salve that has helped Natalie to come to terms with her loss. Natalie's also described her mother's death as beautiful. Madame Bergeron, tu me manques énormément. Please contrast Madame Bergeron's passing with the way my mum, Irene, died 12 years ago this week, after over 2 weeks without food or water. She was surrounded by love, absolutely. She had also been assessed as having capacity and of making her choice free from coercion. But she did not have a peaceful death, and she took the only legal option open to her under our current laws. And it was awful. I don't have the words to describe to the members in this chamber how awful it was, Presiding Officer. If you have not seen somebody starve to death, there is no words to describe that. She deserved better. And Presiding Officer, my decade at Women's Aid taught me how real coercion can be. But it also taught me that the answer to risk is not to look away from difficult situations. I spent time training police officers and social workers and housing staff about coercive control before this place had even named it and recognised it. With the right skills, training and opportunity, it can be detected. To say otherwise is simply to walk away from a wicked issue. Right now, behind closed doors, right across this country, women with terminal illnesses who are experiencing domestic abuse have no safeguards. This bill helps to bring that coercion into the light and removes the power from abusive men and returns that agency to its rightful owner. And that's what this bill is about, agency and autonomy. We must give our folk choice. And it is, after all, the settled will of the majority of our constituents, including those who are disabled and those who have experienced domestic abuse, especially those who are terminally ill. They're forgotten in all of these conversations. They are our most vulnerable citizens. Please vote yes for them.
Thank you, Ms Whittam. I call Brian Whittle to be followed by Jackie Bailey. Mr Whittle.
Thank you, Deputy Presiding Officer. On a topic when many members are either vehemently opposed or passionately supportive, we have seen both sides seek to have a genuine, constructive, respectful debate on the substance of the bill, and I commend colleagues across the chamber and on both sides of that debate. I also want to make special mention of the efforts of Liam MacArthur and his team in bringing this bill forward. I also want to talk about our MSPs and their staff who have worked incredibly hard to make this a debate worthy of such a significant issue. And there are those who are vehemently against the bill, and there are those who strongly support it. And I absolutely respect our colleagues' right to their positions. It does strike me that after 10 years in this place, where I consider some of our interactions as less than ideal political discourse, some policies and debate, we finally get to show what this Parliament really can be. At stage one, I voted for the principles of the bill. I did so because my instinct is to allow choice, even though it's not a choice I can ever imagine making for myself, and I do recognise I've never been, thankfully, in that position. But, Presiding Officer, just because it's not a choice that you would make or that you believe in doesn't mean you should automatically take that choice away from others. However, of course, it's not that black and white. I did have serious reservations at the time the bill was drafted, and I said that it would have to be significantly amended. I remain concerned about the exclusion of pharmacists from the healthcare framework, despite their expertise in supply, handling and the effects of medicines and other drugs. Also, the lack of safeguards for other healthcare professionals. Similarly, there are concerns around the risk of coercion, especially in the amendments that allow for doctors to raise the subject of assisted dying with patients at their discretion. The doctor-patient relationships involves a profound degree of trust, and in my mind, for a doctor to propose assisted dying to a patient as an option could compromise that trust and risks the patient feeling pressurised towards a choice they may not otherwise make. The bill has shone a much-needed light on palliative care, on social care, as well as general access to medical care. This bill is not about other care provision, but assisted dying cannot be seen in isolation. When I mention giving choice to people, it must be a real choice. It must be a choice that includes appropriate palliative care, social care and medical care. Without these elements of care, it is no choice at all. I hear that East Ayrshire are reporting a £10 million deficit in its social care budget, which will inevitably result in cuts to services. I'm hearing North Ayrshire are delivering critical care only. And yesterday, only yesterday, on a visit to care services, I was told of a couple who are having their care package cut, and they are now waiting for the outcome of this bill. And that is being replicated across Scotland. And many have talked about their own experiences in here. I haven't done that, but tonight I will. My aunt died recently of stomach cancer. In the middle of the night, she was on her hands and knees in agony, waiting for pain relief to arrive. However, she did eventually access palliative care, which gave her a much more comfortable last week or so, and a much better experience for her and for the family. Presiding Officer, too often we have heard that appropriate end-of-life care is not accessible, be it palliative care, social care or general care. As the need increases, cuts are being made. Shame on us. It has to be better than this. And I know that whatever we vote today, Presiding Officer, we will be seriously letting down a huge swathe of the public. My decision comes down to evaluating and listening to everything I've heard in evidence, in the amendments, both in this chamber and in committee and through my community. And I've come to the conclusion there is no right answer here. As I began, I believe instinctively in choice, but it has to be real choice. And I've come to the conclusion that if I have any doubts, I cannot vote for the bill. Presiding Officer, at the end of life, we should have the option of choosing how we depart this planet on our own terms. Unfortunately, To my deep regret, I do not think this bill in the current social climate meets the high bar required to pass assisted dying legislation. And given these concerns, Presiding Officer, I cannot in all conscience vote for the bill. Presiding Officer.
Thank you, Mr Whittle. I call Jackie Bailey to be followed by Keith Brown. Miss Bailey.
Thank you, Presiding Officer. As I said last week during consideration of Stage 3 amendments, and others have repeated this evening, this is the most consequential bill of this parliamentary session and probably the most consequential bill of the devolution era. And whilst I will vote against the bill at decision time, I do want to join everybody across the chamber in commending Liam MacArthur for his approach, his openness with colleagues, irrespective of political persuasion, and his engagement with lots of professional organisations and families that have experienced difficult deaths. His approach has been second to none. This is the third vote on assisted dying that I've participated in. The two previous bills brought by Margaret MacDonald and Patrick Harvey were wide in scope, with few safeguards, leaving the door open to unintended consequences. As a result, clinicians at the time opposed the legislation, and both bills failed at stage 1 by a considerable margin. By contrast, this bill has taken a much narrower approach, and many medical and palliative care bodies have remained neutral as a result. Since the bill was first proposed, I have heard very moving stories from those who believe that assisted dying could have prevented unnecessary suffering, those who want agency at the end of life. I've also listened to the concerns of disabled people and those who fear that assisted dying could have led to a loved one's unnecessary death. I cannot do justice to their testimony in 4 minutes, but their stories stay with us all. We've considered the role of doctors and nurses, the definition of a terminal illness, the risk of coercive control, and much more besides. There is, however, no decision on the model that would be used, no certainty about the cost to the NHS for the implementation of this bill. And all this taking place against a backdrop of financial pressures on palliative care, leaving the uncomfortable question for us of whether terminally ill patients will be able to make a choice at all. I won't rehearse many of the arguments that have been put, but I agree with all of Bob Doris's comments about palliative care and Brian Whittle's comments about the real crisis in social care just now. In dealing with the bill, I worked with Hospice UK, the Children's Hospice Association Scotland, otherwise known as CHAS, the Royal College of Nursing and the Royal College of Psychiatrists to improve the safeguards in the bill. Some of those amendments were accepted, and I thank colleagues for doing so. And I recognise that there has been progress from where the bill started. There is, however, a fundamental problem with the bill. Scottish Government rightly advised that the employment issues covered by the bill were not legislatively competent, so the bill can only become law with a Section 104 agreement between the Scottish and UK Government. Provisions allowing protection for staff were therefore completely removed last week from the bill, with the promise that they will be put back in after the legislation had passed. That was a watershed moment for many people in the chamber. Now, the UK Government has taken a position of neutrality, which mirrors that of the Scottish Government, but I was genuinely concerned that the Cabinet Secretary could not guarantee to me when I questioned him that all of the safeguarding provisions would be replicated in a Section 104 agreement. For many MSPs, this was the equivalent of asking them to vote in the dark, and for it to come so late in the day was problematic. There are questions about whether the bill was competent even on introduction. Consequently, and it came as no surprise, that the Royal College of Psychiatrists changed their view from being neutral to opposing the bill, as did the Royal Pharmaceutical Society in Scotland. And many of us have received emails from clinicians expressing significant concern on that point. So we've all been weighing up the views of constituents, the views of those who will have to implement this bill if passed, and the views of families who have lost loved ones in difficult circumstances. And in all of this, our job is to consider the impact of this bill. And that is unemotional. That is about analysis. And in doing so, I've come to the conclusion, regretfully, that I cannot support the bill as it stands.
Thank you, Ms Bailey. I call Keith Brown to be followed by John Mason. Mr Brown.
Thank you, Presiding Officer. Like others, I'd want to mention the point made by Liz Smith about the excellent nature of the debate that we've had. However, she mentioned something else which has not been repeated, which I think is worth repeating. I've always thought it's perfectly possible for this Parliament to have debates of this quality. We just choose not to do it. And I think the other point that Liz Smith made when she talked about the need to get past the rancour and bad humour that is too evident in this chamber too often is extremely important, and I hope that prevails in the next session of the Parliament. The approach I have taken to this bill has been very much to maximise, where I thought I could, the safeguards that were presented through the amendments in the event that the bill passed, but not to the extent that I thought it would make the bill unworkable if it did pass. However, the two issues for me are like many other members. First of all, the Section 104, which is a huge issue. No one in this Parliament will draft the Section 104. It will be drafted by others. It's then due to go through a process which this Parliament will have no say in, where it may be rejected completely. And for those who say, and I think rightly, this is one of the most important bills that we've ever considered, how can they accept the fact that we will not see through to its conclusion two vital areas of legislation, because the decision will be taken by others? I can't accept that. And I don't trust the fact that another Parliament can be trusted, not because of any malevolence on their part, but I think it's evading responsibility. However, my main concern, as it's always been, is in relation to the issue of coercion, and especially the pressure that people will put on themselves. Now, when I think about this, I usually have in my mind the picture of a woman, usually a mother. In the last few years, I've lost a niece, a sister, a mother and a partner in similar circumstances, all of whom are mothers. Now, this might be misogynistic and it might be patronising, but my view is that mothers in particular feel much more keenly than the general population the need to relieve burdens on others. It's almost socially instilled, and if it's not, then it comes through sheer love, a word that's not really been mentioned much in this debate until this point. And I think it's, of course, true to say, and I was very touched by Lorna Slater's speech, that it's also possible for men as well, but in particular mothers, deciding that, for example, that her remaining family would be better off financially if she was to decide to go for assisted dying, or that some of her children, in my case, sisters having to travel from Wales and England to come and see her on a regular basis, if it would be easier for them if they were to choose assisted dying. Now, I know that there will not be many cases like that, but I think, like Hamza Youssef, one to me is too many. And I think it's important. Michelle Thompson did this, but it's not been that prevalent. There is pain on both sides. I acknowledge that people will still go through some of the terrible experiences that they have to go through currently if you don't pass this bill. But I think those that are urging that we pass it should also acknowledge there's going to be pain on the other side. You can imagine if you were aware of your mother, your sister, somebody else deciding to go for assisted dying for reasons other than the ones that are proposed, because they felt they were less of a burden, there's pain on that side as well. Those two things are extremely valid. I also think it's true to say, as it was said by Ruth Maguire, the issue of domestic violence, the way that women can be made to feel to have no self-worth, is extremely important in all of this. And I was also extremely moved by the speech of Pam Duncan-Glancy. It struck home to me, in a way that it hadn't done previously. A lot of disabled people probably cling to and take a huge deal of comfort from the fact this provision is not currently in law. And I think that's worth thinking about. So in my view, those two things, one in relation to the Section 104, the inability of this Parliament to see through some of its most crucial provisions, or even be absolutely assured that they will be seen through. And I remind members of a point I made at stage 2 of the GP that came to see me, who said that she would resign immediately if any bill was passed which took away the right to conscientious objection. And crucially, in relation to coercion, I think it's true in terms of explicit coercion, but more pressingly for me, the idea of self-imposed coercion. Those things, I don't think that can ever be successfully dealt with, the second of those. I think the first of those can be more successfully dealt with. And just to say in conclusion, I think this will come. I think assisted dying will come at some point. I just don't think this bill is the bill that you should pass.
Thank you, Mr Brown. I call John Mason to be followed by Kenneth Gibson. Mr Mason.
Thank you very much, Presiding Officer. Now, one of my colleagues suggested to me that he would rather religious people would be up front and say that it was because of their belief in God that they opposed the bill. And as that is one of my reasons, I am happy to say a little from that angle. However, I have other reasons for opposing the bill, including from a financial perspective, given my background as an accountant. On the financial front, I know that Michael Mara questioned whether the financial memorandum fully covered the estimated costs when we debated amendments to the bill last week. However, the other angle in finances is whether there is the opportunity to save money if someone was to choose an early death. It does seem to me that the public purse has the potential to save on hospital places, on care home fees, on pensions and perhaps on other costs if assisted dying becomes an option. Clearly, if someone chooses to die just a few days before their natural death, it would not make much difference. But if someone has a life expectancy of 6 months, but could perhaps go on for a year, then the savings could be considerable. And that is not to mention a family who have a well-off elderly relative and for whom getting their hands on the estate more speedily could be very attractive. We know that power of attorney is abused by some families and it is not well policed. Therefore, it seems likely that a range of players could potentially benefit financially if assisted dying becomes an option. That is why I deliberately chose the word encouraging an early death rather than just allowing an early death, which was the phrasing that I know Lorna Slater objected to last week. Sure, we are talking right now about giving people more choice, empowering them and words like that. However, I think we do need to look further ahead as well at what could happen and I think is likely to happen. We have discussed how difficult it is to stop coercion or pressure on someone to end their life prematurely, especially when that pressure could be very subtle. So how much more this could be the case where there are financial incentives added in. So what about the angle from a Christian perspective? At its core, we believe that God gives life and God decides when life should end. Clearly, there are also human reasons for both birth and death, but we believe that behind all of that, God is guiding and directing. But I should say, to be fair, that not all Christian believers oppose assisted dying. Just on Sunday, one of my friends at church told me that he supports it. What about the question of suffering? Surely a loving God would not allow suffering, would he? That is a question that folk often ask and have asked for many, many years to people of faith. And there's not exactly an easy answer to that question, but yes, actually, God does allow suffering. We believe that because human beings chose to go their own way rather than following God's way, suffering came into what God had made to be a perfect world. Suffering clearly is happening all over the world, and there can be suffering with both a natural death and an assisted death. I think we all want to reduce suffering as much as we can, whether we have religious belief or not. So absolutely I would support the many calls there have been for better palliative care and encourage more resources for the hospice movement, as others have said. At the end of the day, no one really wants declining health or a death. Yet these are part of the human condition. Of course, one big difference for those of us with a Christian belief is that we are promised life after death. So however hard our lives might have been, and for that matter, however hard our deaths might have been, there is something better available to look forward to. Perhaps not surprisingly, I'm currently reading a book about retirement, and it makes the point that older people have so much to offer. And we can all have so much to learn from people who are older than us and also give to people who are younger than us. So please, colleagues, let us not undermine the older people, their value and what they still have to contribute. They are valuable, and I think we are duty-bound to oppose this bill. Thank you.
Thank you, Mr Mason. I call Kenneth Gibson to be followed by Stephen Kerr. Mr Gibson.
Presiding Officer, the years of hard work and dedication of Liam MacArthur and before him Margaret MacDonald and Patrick Harvey have taken this Parliament to a definitive moment. Rona Mackay, Alex Cole-Hamilton, Sandesh Gilhani, Carol Mochan, Lorna Slater and many others made thought-provoking and moving contributions. Like them, I back choice for anyone of sound mind stricken by terminal illness, the loss of bodily functions, autonomy and basic human dignity. But of course, we already have assisted dying if you have money. Up until the end of 2024, 608 UK citizens ended their lives at Dignitas in Switzerland at a cost of £7,000 to £14,000 each. Deaths that often happened earlier than necessary due to the need to be able to travel. At stage 1, I mentioned a West Kilbride constituent who suffered from progressive supranuclear palsy, a horrific neurodegenerative terminal disease. In August, she too ended her life in Switzerland. So in reality, we have a two-tier system with assisted dying only for those who can afford it, and the status quo for everyone else. We must recognise that 300 to 650 terminally ill people take their own lives in despair across the UK each year, denied an assisted dying safe death. Desperate people watching a loved one dying in agony risk prosecution and incarceration by sometimes ending the life of a terminally ill loved one. And palliative care does not always alleviate insufferable pain. A regulated system backed by legislation must be better than the status quo. Dr. Julie Neal, a retired GP, said, "To deny patients the choice of an assisted death when we know that a significant minority of deaths are wretched, no matter how expert the provision of palliative care, seems to me utterly wrong." But this is what I was forced to do when asked for help to die by a patient with advanced metastatic melanoma. He was intelligent and knowledgeable about what lay ahead, wanting to avoid a lingering demise. I explained that I was unable to help him due to the very real threat of imprisonment. I was later horrified to learn that he had shot himself. An assisted dying law would provide a kinder, safer alternative, which I and a growing number of doctors would be prepared to be involved in, a welcome and much-needed change from the cruelty of our current system. Zoe, not a constituent, said, "By the end, my mother's cancer had spread to her brain and she was in terrible pain. Mum determined not to let the cancer do its worst, that she would construct some kind of escape. Because she had no other viable alternative, she attempted to take her life out in the garden, alone. When we discovered her, she was still breathing, and I rang an ambulance to help move her inside. I told them of Mum's clearly defined wish not to be revived and showed them the legally binding documents to prove it, but they wouldn't listen. A doctor threatened me and called the police. Paramedics, doctors and police officers were all arguing with what to do as my mum lay dying on the ground. Hours later, Mum regained consciousness and was in emotional and physical agony. She had written heartfelt notes to us, which the police confiscated. A few weeks later, Mum finally managed to escape her pain. I was questioned by police for hours and made to sign a 5-page statement. Then she was subjected to an autopsy, the final insult. 11 months later, my husband Andrew was diagnosed with colon cancer. His death was full of horror, pain and indignity. We crossed every line we didn't want to cross. I cannot put into words how different it would have been for them and for our family if my mum and my husband could each have been assisted to go peacefully as they wished and with the dignity they deserved. Presiding Officer, supporting this bill is about compassion, personal choice and human dignity. For the many like Zoe, please support this bill.
Thank you, Mr Gibson. I call Stephen Kerr to be followed by Michael Matheson. Mr Kerr.
Presiding Officer, I'm sure this must be one of the most serious and thoughtful debates that this Parliament has ever undertaken, and I begin by acknowledging the sincerity of colleagues across the chamber. I have been moved by speeches from members who are on both sides of the issue. Members who support the bill do so out of compassion for those who are suffering. Members who oppose it do so out of concern for the vulnerable and for the principles that guide medicine. No one approaches a decision like this lightly. For me, this is not an abstract question. Like many people, I have been at the side of those I love as their lives have come to an end. I watched my parents die. I watched my wife's mother die. I have watched dear friends and family pass from this world. Some of those deaths were peaceful. Some were harder. Those experiences stay with you. They remind us of something simple but profound. Death is part of life. It comes to us all. Experiences like that shape how we think about questions like this. They remind us that death is not simply a matter of policy or law. It is deeply personal. It touches every family. However, the decision before Parliament today is not about abstract principles. It is about the legislation that is in front of us. It is about whether this bill represents sound and safe law. And I have come to the conclusion that it does not. During the passage of the bill, we've heard increasingly serious concerns from those who would be responsible for operating it in practice. We've had several letters from hundreds of doctors and nurses, including the one that was quoted earlier by Sue Webber, warning us that in their professional judgment the bill does not contain sufficiently strong safeguards to protect patients from coercion, untreated mental illness, or unmet social and palliative care needs. One signatory of one such letter put it plainly: this is not a theoretical debate. It concerns the safety of real patients. We've also seen the Royal Colleges and professional bodies move from neutrality to opposition as the detail of the legislation that is proposed has become clearer. At the same time, members are being asked to approve legislation where important safeguards will ultimately be determined through secondary legislation and processes beyond the direct scrutiny of this Parliament, and that should give us all pause. Because if this legislation fails, it does not fail in theory, it fails in real lives. In a system such as this, one mistake, as has been said by several speakers, would be one too many. None of us can stand here today and say with certainty that the framework before us eliminates that risk. Opposing this bill must never be mistaken for indifference to suffering. Quite the opposite. Our responsibility is to ensure that every person in Scotland receives the care they need at the end of their life. Wherever someone lives in Scotland, they should have access to high-quality palliative care, effective pain relief, skilled medical support, and the compassion that allows them to die with dignity. And that means serious investment in palliative and end-of-life care and honesty about the gaps that still exist across our country. Many members across the Chamber have spoken about the need to strengthen those services. On that point, I believe we are all united. So I will vote against this bill. When doubts remain about a decision of this seriousness, caution is the wiser course. On a matter of life and death, this Parliament must be certain before it changes the law.
Thank you, Mr Kerr. I call Michael Matheson to be followed by Jackson Carnell. Mr Matheson.
Thank you, Presiding Officer. As I rise to speak in this debate, and what will be my last contribution to a debate in this place after some 27 years, I cannot think of a more consequential debate during my time in this place. However, I want to put on record my congratulations and thanks to Liam MacArthur and to colleagues across the Chamber for what has been a very dignified and considered debate to date. We all care about people dying and want to see good deaths for those we love and for ourselves. However, this bill will not create a new option for a few. If enacted, it will impose a new reality for every person towards the end of their life, the option of assisted dying. It will, in my view, change life and death for everyone. And in doing so, I believe we should be particularly mindful of the impact that could have on some of the most vulnerable members of our society who lack agency in their decision-making. Last week I shared my concerns that the safeguarding measures in the bill do not provide suitably robust defences against the risk of coercion. In 2018, as a Parliament, we listened. We listened to the voices of women who had suffered at the hands of abusers through domestic abuse. We listened to their plea to recognise the extent of coercive abuse, and we worked with experts to shape legislation to tackle the issue. I believe now more than ever we need to listen to those voices again as they warn us of the dangers created by this bill. Isabel Kerr, who has run rape crisis centres in Scotland for decades, recently stated, and I quote, "The bill assumes that busy doctors will have the capacity and expertise to spot signs of abuse. My experience tells me that they won't in most cases." MSPs need to realise that coercion will occur under any assisted dying law. In my view, the real questions are who will be coerced to die and how many such deaths will be missed. This is a complex issue. Strong arguments are put forward by both sides. However, the success of legislation often boils down to its workability. I feel duty-bound to point out that assisted dying bill at Holyrood is not workable in its approach to detecting coercion. These are strong words, not from a person who opposes the law in principle, but from someone concerned about the very vulnerable constituency in our country. And when supporters of the bill talk about choice and autonomy, they should remember that these are not the reality for some women, for disabled and older people trapped in abusive and coercive situations. We should be in no doubt. Coercion will take place. No words on the face of this bill will prevent it, because sadly, not everyone who dies has people around them who truly have their best interests at heart. Domestic abuse experts like Annie Donaldson and others have warned us of the bill, and I quote, risks offering a new potentially lethal weapon to abusive men whose partners have been diagnosed with life-threatening or terminal illnesses. And the Scottish Government's own evidence shows as we continue to have a hidden population of victims of abuse and coercion in Scotland. It is inevitable that they will include individuals who are or become terminally ill. Abusive relationships don't end after diagnosis. And while I recognise those who support the introduction of assisted dying are eager to see legal change, we cannot and we should not ignore the serious and real threat posed to vulnerable people through the coercion to die. And given the extent to which domestic abuse remains so prevalent in our society, coupled with the continued low rates of disclosure and the challenges of detecting coercion, it is inevitable that coerced deaths will occur if this legislation is passed by Parliament. Therefore, to those who remain torn on this bill, I respectfully say this: do not back it if there is any seed of doubt in your mind. Remember, there is no room for uncertainty when it comes to life and death. I would urge members to vote against the bill tonight.
Thank you, Mr Matheson. I call Jackson Carnott to be followed by Christine Graham. Mr Carnott.
Thank you, Presiding Officer. I supported Margot MacDonald's bill and Patrick Harvie's bill. I eventually abstained on Margot's bill. She told me to abstain for reasons that I won't repeat here because I might get arrested. But I have found today that I come to this debate with no personal story to match really some of the most profound and inspiring stories that I've heard across the chamber. Any personal story I would bring would be quite feeble by comparison. I have learned two things to my surprise today. I will say this once and never again. I could have listened to Ross Greer's speech again. And secondly, I might have preferred Crystal Ross to be the Member of Parliament rather than her husband. And that might be a sentiment that, that others would agree with this evening, having had time to reflect on it. I would like to pay particular tribute, as others have, to Liam MacArthur, and not just to Liam, but to his team. to going back to Jack, to George, to the other people who have helped since. The former of all of those, actually, when my own head of office left in 2022, told me he was adopting me as my unofficial carer, which was both charming and deeply alarming. But they have worked incredibly hard to process the enormous volume of correspondence and work that Liam has had to progress during this Parliament. And none could have done so with the charm, dignity, ease and restraint with which he has. And I think that his conduct of the way this bill has passed is, like others have said, a remarkable tribute to him, but also to this Parliament. And I think he's done a fabulous job. I stand here as someone, you will understand, who wasn't always terribly sure about this place, but I've come to have a profound respect for it. In fact, I've cherished its potential in the 19 years I've been here, not always its output. But I remember when I first came in and I wondered, what are these things? I looked around. I thought they were bottles of whiskey. But I was told, no, that is the silent majority. That is the silent majority of Scotland looking at us as we debate the issues before us. And over the years I've been here, whether it was the ban on smoking, whether it was the groundbreaking legislation on improving the lot of those who required wheelchairs, whether it was the introduction of free personal care, whether it was same-sex marriage, where I remember arguments of coercion again being made at that time, whether it was really the travel to the United States for those women suffering from transvaginal mesh, when this Parliament works together, it is actually at its best. And all of those things, I have to accept, would probably not have advanced the social life of Scotland had not this Parliament been here to do it. And in this debate today, I'm reminded that each of us is equal. We're not loyal to any manifesto tonight. We're not loyal to any party leader tonight, however well-intentioned their interventions might be. Each of us is an equal voice in the proceedings before us. Today I had quite a profound experience. I went into Costa before I came in here in my constituency, and there was a group of guys and a couple of women who talk about things every morning very early on. The Costa was very busy, and I asked them if they were me, what would they do? And they all put up their hand in support. But that wasn't what was profound. I looked up, and all around the Costa, other hands went up as well. And we should not forget, although it can't be the only thing that governs our decision tonight, that the vast majority of the people of Scotland understand what is before us and support the progression of this legislation. And I want just to return to Ross Greer, because why I enjoyed his speech was because he set out in technical detail what the safeguards actually are that have been introduced by Liam during the progress of this bill. And that we would need commencement orders to pass before the bill would actually be enacted. And that is the answer to Jackie Baillie and others who say we don't know. Well, if you don't like, you don't have to vote for the commencement orders in that final analysis. The terminally ill are the voices missing in this chamber tonight. Look around and ask yourself, if your neighbour said to you, I'm dying in excruciating pain, would you say, well, I'll do something about palliative care, years from now perhaps, or I'm very sorry, you'll have to endure? No, that is not the answer. To move forward today is to recognise a single truth. We all have a right to life, but we don't have a duty to live, whatever the circumstance before us. I don't know whether I would take advantage of that opportunity, but I believe it is wrong to deny, in this day and age, individuals the chance to have that right.
Thank you, Mr Carlow. I call Christine Graham to be followed by Alasdair Allan. Ms Graham.
Thank you very much, Presiding Officer, and may I start by paying tribute to my late colleague Mark MacDonald and Patrick Harvey, pioneers, and to Liam MacArthur. His dignity in this has been extraordinary, and indeed to all contributors so far. Now, I'm 81. I'm more aware of my mortality than most other MSPs in here. In fact, I think about it quite regularly. My power of attorney is in place, my will's in place, the wee purple file where I keep all my wee secrets about where the money is hidden, that's there for my boys to find. Now, I repeat, I respect those with firm religious opposition to assisted dying. But I know that no matter how we were to amend this or do it, they're never going to pass it. And that's it. And I want to speak to the people on the cusp, perhaps even people who have said so far, I was in doubt, but now I'm not going to support. I want to speak to them because I've listened to concerns raised on capacity, undue influence and coercion, mostly in the context of disabilities, physical and mental or domestic abuse. And I say to the Chamber, I'm satisfied that the bill provides barriers and protections for those vulnerable groups, and I certainly would not vote for it if that were not the case. If passed, indeed, I predict that this will be the most policed and closely monitored legislation ever, and I welcome that. But this is about choice. That final choice about how I or others may wish to die if we have a terminal illness and are at the end of life. What it is not about is competing with or undermining palliative care. I'm delighted concerns about palliative care provision have been brought to the fore. So if this bill is passed, and even if it's not passed, I will campaign for better funding and sourcing of palliative care for everyone. But it's about choice. Neither of my parents had choice. One had a good death, the other had a very bad death. Dad got up one Monday morning, made up his bed, placed his pyjamas neatly under the pillow, set the breakfast table, then sat in his armchair with his cup of tea in one arm and the digestive biscuit on the other. His last words were a phone call to my brother. He said to Tony he felt not right, and the phone hit the floor. He died, cup of tea and digestive biscuit barely touched, in his own chair, in his own home, surrounded by a gallery of family photos. It was our pain finding him there, not his. It broke our hearts, but we were grateful it had happened that way. Mum had cancer for months. She worsened, and for the last 3 weeks, she was in the Western General in Edinburgh, just waiting to die. She was told practically on arrival they could do nothing, but would try to make her as comfortable as possible. I saw her with my father almost every day. Only once did she express her fear when she whispered to me out of his earshot, "Christine, will there be pain?" And of course, I said no. But there was. Near the very end, Jim, the wonderful, understanding charge nurse, took Dad, me and my siblings Tony and Katrina aside and asked if he could up the morphine to help with the pain that would probably accelerate death. And together we said yes, and we thanked him. Now, the First Minister knew my parents well, the good people they were, my unassuming, uncomplaining mother. The family made the choice for her. She had no right to choose. That's all I want, the right to choose, not like my mother, drug stupefied. We didn't know if she could hear us. But I hope, with some control, dignity, aware of my surroundings, with my sons, Angus from Canada and Neil from London by my side. That must be my choice, not for everybody, but I would like it for me. Please support this bill. And if you're in doubt, please don't stand in the way of it. Abstain. Thank you.
Thank you. I call Alasdair Allan to be followed by Stuart McMillan.
Presiding Officer, I have found this debate hard, so I have no right whatsoever to offer any judgments about the conclusions which other members have so carefully reached and still more carefully argued tonight, not least by Mr MacArthur. For all of us, on both sides of this debate, profound personal experiences and huge questions of principle are engaged. Although, of course, as Mr Kerr said rightly, we are not debating a principle tonight. We did that at stage one. We are now debating a bill. I've tried to support amendments which I thought might introduce safeguards, but I avoided backing wrecking amendments as I saw them that might have landed the bill in court. And yet I am left, after all of that, still looking at a bill that genuinely troubles me. And one of the reasons for that, as other members have mentioned, is because of the significant holes in it. I realise there were legal reasons why Parliament had to remove the provisions guaranteeing health professionals the right not to participate. And the best hope now is that those gaps will eventually be filled in by Westminster. That prospect clearly reassures some members, but it notably does not reassure the Royal College of Psychiatrists in Scotland. Meanwhile, I was personally surprised that Parliament did not accept an institutional right to opt out. And, like Mr Hepburn, I was genuinely taken aback when Parliament rejected some of Mr Johnson's amendments. These would have prohibited doctors, rather than patients, from initiating a conversation about assisted dying. For older patients from many backgrounds, a doctor is still an authority figure. Some people have told me they simply lack the confidence to contradict a doctor, ever. Presiding Officer, I recognise that this bill is founded in the vitally important principle of personal autonomy. But for me, it exhibits a very idealised vision of that autonomy. It pictures a world in which people exercise choices without any external forces ever being placed upon them. I think of the woman in a controlling relationship, or the person who has the unspoken fear that living out his last years in a care home might cost his children the family house. The bill also seems to assume that people seek out the help and support that they need in their lives, to allow them to be assertive about their own rights. In rural and other traditional communities where the desire to save face and avoid being talked about can be powerful forces, such an assumption, believe me, is often ill-founded. Presiding Officer, clearly families, doctors, nurses already have to wrestle with deeply distressing end-of-life decisions. And I am in awe of the members who have been able to speak so openly and movingly of those experiences. The manner of some deaths now raises questions about human suffering to which I certainly offer no trite answers. Yet I still have to recall the advice often given to legislators that hard cases make bad law. That is definitely not to belittle the terrible hardness of the situation. the terrible hardness of the situation we now have to legislate. Rather, it is to remember that our laws generally have a wider application than we envisaged.
After diagnosis.
Potential in the 19 years I've been here.
through in great detail some of those protections, quite a lot, which I absolutely acknowledge. And I also welcome that part of another two protections, those who can apply are from, the ages went from 16 up to 18, and also welcome the at least 12 months residence in Scotland before the first declaration of patient. I disagree with allowing the doctor, who must remain at the time of ingestion of the drug, to be able to assist the patient. I disagree with the lack of opt-outs for hospices and other facilities. There were a variety of amendments at Stage 2 and Stage 3 seeking opt-outs for religious organisations who operate their care facilities. Conscientious objection and opt-out, but these amendments were rejected. This has also been spoken about by others, and I do share some concerns there. The Section 104 orders have been used before in this Parliament. So they are not a new process. However, following the removal of Section 18 from the bill, they now believe vital safeguards have been removed. Once again, that touches upon the Section 104 order. And as we've already heard, other bodies have also now rejected this bill because of a lack of safeguards, including from the Royal College of Medical Society, Medical and Dental Defence Union of Scotland, the Royal College of Physicians and Surgeons in Glasgow,
Thank you, and I call on Liam MacArthur, the member in charge, to wind up.
Whether, as Douglas Lumsden and Paul O'Kane observed, they realise it yet or not, I think this certainly has emulated the debate we had at Stage 1 back in May. It has been a high point of this Parliament. And can I also echo the comments it causes would be unforgivable. I know there are those whose position on assisted dying has been set for some time, both for and against. I respect those positions, even where I fundamentally disagree. However, in the time available to me now, I plan to address those possibility of any act coming. Moreover, the courts here have made clear this is a matter for Parliament to decide. And then there's the more generalised fear about taking a decision of such significance. I don't underestimate those fears, but there is nothing compared to the fear felt by those who must be at the centre of this debate. The fear of 22-year-old to die. In 2019, the Inescapable Truth About Dying in Scotland report was published, drawing on testimony from palliative care professionals, dying people and bereaved families. And in the run-up to it, that have declared their opposition to this bill. I realise that to do otherwise now would be difficult and uncomfortable. But I would ask those colleagues to measure that short-term discomfort Professor Sir Graham Downey, former chair of GMC, made a plea that we need to listen carefully to the compassionate honesty of palliative care professionals who recognise the limitations of their speciality, the trauma of bereaved relatives whose
but the terror of his illness and the agony he experienced in his death, and that breaks me. This bill, it's tightly drawn, it's heavily safeguarded, and it's legally defensible. And MSPs can have confidence that what they are voting for will be delivered. Sir Graham Downey, former chair of GMC, Parliament will simply force people to travel overseas, take decisions behind closed doors with no safeguards, no protections, no support, or condemn them to suffer, like Brian, like Kath, like Heather. Throughout this process, I've sought to be measured, reasonable and respectful. In my view, that's the only way to address an issue of this sensitivity. And look, I am enormously grateful for the nauseating families being grotesquely failed by the ban on assisted dying. As a growing number of countries and states around the world, including Jersey and the Isle of Man, are proving there is another way. We can and must do better. This is the time, this is the bill, this is the change that dying Scots desperately need us to take. But most of all, listen to Lisa and the hundreds more like her and back this bill.
Thank you. Thank you. That concludes the debate on the Assisted Dying for Terminally Ill Adults Scotland Bill at Stage 3. It's now time to move on to the next item of business. There are three Reviewers Scotland Bill at Stage 3 be agreed. And as this is a motion to pass the bill, The result of the vote on no votes against, there were 2 abstentions. The motion is therefore agreed and the Non-Surgical Procedures and Functions of Medical Reviewers Scotland Bill is passed. The next question is that motion 21101 in the name of Ivan McKee on the Building Safety Levy to pass the bill. The question must be decided by division and members should cast their votes now. I call Stephanie Callaghan for a point of order.
Confirming my vote is yes.
Thank you, Ms Callaghan. We'll ensure that's recorded. Ivan McKee on the Building Safety Levy Scotland Bill at the result of the vote on motion 21101 in the name of Ivan McKee is yes 70, no 56. There were no abstentions. The motion is therefore agreed and the Building Safety Levy Scotland Bill is passed. The final question is that motion 21005 in the name of Liam MacArthur on the Assisted Dying for Terminally Ill Adults Scotland Bill at Stage 3 be agreed. And as this is a motion to pass the bill, the question must be decided by division and members should cast their votes now.
is more like her.